Thank you, everybody. Sorry for this short break, but still got a full afternoon.
Recording in progress.
Okay, with that then, we'll bring the board back into session and I'll turn to the clerk to hold the roll to establish a quorum, and we'll go to our next item.
Okay, Supervisors Frost,
Here.
Kennedy,
Here.
Desmond,
Here.
Cerna,
Here.
Natoli,
Here.
and you have a quorum.
Great.
Okay, for your first item back, this is item 56. This is the 2022 federal and state legislative priorities.
Okay, I think it's going to be, I don't know if Ann's going to make any comments, but I know Natasha Drain's going to be carrying this item, so I'll turn to either one or both of them. So,
Hi, Supervisor. This is Natasha.
go ahead.
Excellent. Good afternoon, Chair, members of the board. I'm Natasha Drain, your Governmental Relations and Legislative Officer. As part of this workshop, I've invited our state lobbyist, Audrey Ratajczyk with Crew Strategies, to provide a presentation on our achievements last year, to touch on what we see coming in 2022, and to know any late-breaking information for you. Following Audrey's presentation, I also have a PowerPoint that will touch on the high points of the legislative priorities. And after my presentation, of course, I hope to hear from you. With that, I'm going to hand the presentation over to Audrey. I see my PowerPoint flow. Could you change it to the other PowerPoint? My apologies for the confusion.
Metro Cable, can you please change the PowerPoint?
Perfect. Thank you. Can everyone hear me?
We can. Go ahead, Audrey.
Oh, great. Good afternoon, everyone. And I don't see my video on, but if it's able to turn on, I am here, but otherwise via voice. Thanks so much for the opportunity to be here with you all today. Audrey Ratajczyk from Crew Strategies, the county state lobbyist. We had a very busy 2021 legislative session last year that resulted in a number of wins for the county that we were really excited about. So in this quick presentation, I wanted to outline some of the major policy and budget issues that were addressed by the legislature in general last year. Second, I wanted to highlight the specific county priorities and successes that we had. And then lastly, provide a brief overview into the issues we're already seeing come up in the 2022 session, although only a weekend, but a lot's already happening. And then what we expect to see come out up throughout the year and on the ballot through the initiative process in November. So just in terms of the 2021 year last year, the general legislative items and budget issues, you can go to the next slide, please. So first, at the request of our county coroner, Kim Jin, we worked very hard last year to secure $1 million in funding for the county coroners statewide to be able to train together in how to deal with mass fatality events. This came out of one of our department meetings last year that we had with Ms. Jin. And right now, law enforcement and fire personnel have the ability to train together for mass fatality events, but the coroners were not included in training. So we worked closely with the Coroners Association and others, and ultimately got the $1 million included in the budget. So we were super excited about that. It included securing a legislative champion. So Assemblymember Cooper carried the budget request last year, and we had countless meetings with Cal OES, Department of Finance, budget committees, the governor's office, et cetera. And we're really excited that that was included, and something that Cal OES has been working on closely with the coroners to get that funding out so that it can be very useful. The second item was sideshow budget request funding that we had worked on with Supervisor Desmond and Supervisor Frost. Originally, we had talked about a $2 million request to go to the Office of Traffic Safety to help fund a task force to prevent and end sideshows. Once we had further conversations with Traffic Safety, they only get out federal grants, and they don't have systems set up to be able to do state grants, and it would be really costly to be able to set that up just to get out this funding. So we shifted and talked to CHP, and they really liked the idea and something that it could flow through them to be able to develop this task force. Ultimately, it was not included in last year's budget, but assuming that it's still a board priority this year after you approve the priorities today, and we've already kind of laid some of that groundwork to potentially bring this request back next year, and I think we'll be able to be successful this year. We've already talked with Assemblymember Cooper and also Senator Dolly, and both have agreed that they would love to submit the request. And CHP has been doing a lot in this space right now. So I think it's really timely because with COVID and everything, sideshows have been getting more frequent and dangerous. So I think the time is right that we would be able to get that done this year. And then just in terms of other more general stuff that was impactful to the county that was in the budget last year, as you've heard, it was the second year that a number of criminal justice fines and fees were proposed to be removed. So the original proposal had proposed to remove 67 different criminal justice fines and fees, and it did not include a backfill to counties to provide a backfill of funding for the services that we provide that are associated with those fees. So we worked really closely with CSAC and with the urban counties of California to push back on that, to limit it. So it was limited to only 17 fees that were removed, and also to provide a backfill for those services. And ultimately, it'll be $50 million ongoing to counties, although not probably as much as it could have been, but at least it was a step in the right direction and provided us some funding. So I think that remains to be seen of if there'll need to be more funding provided. But the allocation methodology is supposed to come out by March. So we're continuing to watch for that. And then there was also Project Home Key funding of $1.45 billion last year, and also $150 million for Project Room Key. And then lots of Delta levy funding. So we work closely with Supervisor Natoli and with the Delta Counties Coalition. There was $104 million in bond funds for local assistance to support Delta levies. And then more specific to the Delta, we also were a part of a $12 million budget request that Assemblymember Frazier submitted to help remove abandoned and derelict vessels from the Delta, which Natasha will get into in more detail in her presentation about our potential sponsored bill and budget request this year. But last year, the $12 million was included in the budget. And then also in the budget last year, we worked closely with the Waste Department, with Doug and Kelly and others. There was $60 million included to provide grants to local jurisdictions to help implement the 1383 organics waste regulations. So CalRecycle is still working on getting out that funding, but we're watching it closely and hope that it's something that the county will be able to take a part of and get some of that funding, because I know they're working really hard to get 1383 up and going. And then, as you all know, there was the $6 billion, the big broadband package that CSAC kind of led the effort on, and that got done last year. And then also local public health funding. Last year, there was $300 million that was committed in the budget, but it would start this year. And then we were really excited about that. And then the governor in his budget yesterday also proposed additional funding to local public health jurisdictions in this year's budget. So that would supplement that from last time. And then last year in the May revise, the budget had proposed to halt admissions of county LPS conservatives at state hospitals. The goal was to clear beds for felony IST individuals that were on the wait list, but ultimately this result would have sent the ill LPS conservatives back to counties and not provide us the assistance to create local placements for these really complex cases. And so we worked closely with Ryan and Behavioral Health Department and Senator Pan's office to be able to push back on that, to make sure that if something like that were to happen, we'd have the resources. But ultimately, the final budget didn't include the halt of LPS admissions. So that was good for the county as well. And then child support, the budget agreement had restored funding for local child support agencies, which is something we supported with the Child Support Directors Association. And then lastly, on budget, the climate resilience funding. As you all know, the two bond efforts didn't move forward last year, but that was because the legislature had the surplus, and so they wanted to do the $15 billion climate package to get out some of that one-time funding instead of doing the bonds. So we had worked with both of the bond authors to get a direct allocation to the Lower American River Conservancy in both the bonds. But since they didn't end up moving forward, we worked with McCarty's office to get a direct allocation in the budget for the Conservancy. Ultimately, we were a part of those discussions and helping get that done. Ultimately, in the budget, it showed that it go to the city of Sacramento, but we're working closely with Liz and Parks and with McCarty's office to make sure that it benefits the county as well. And next slide, please. And then just these will be really quick, just in terms of more broad legislative items that happened last year. Brown Act legislation was obviously a huge deal with AB 361, allowing Board of Supervisors, as you're doing right now, to continue to operate remotely, which was needed for the pandemic. And then there was 2 vaccine mandate related proposals last year. They ultimately didn't move forward, but I just wanted to flag it because it's something that will likely be coming back this year that we'll want to watch. One proposal was just about employers and how that they would be able to require employees to have the vaccine. And if they didn't have it, what testing and stuff would look like. And then the other one went a little bit further to include that, but also patrons attending certain industries would have to be vaccinated before entering. So both of those, it was a big discussion with business, labor, and other groups that will continue to be worked on, but likely something that we'll see coming back next year, or this year, I should say now. And then the AB 988 crisis line was another bill that we were engaged on closely with Bruce and Ryan and others. And it would have created alternative to 911 for mental health crises. You instead call 988. Ultimately, the bill that would have implemented this last year didn't move forward. That proposal had a fee, a telco fee on users' cell phone bills. So I think that might have been the sticking point, and ultimately it didn't move forward last year. But this year in the governor's budget yesterday, he already said that Health and Human Services Agency is developing a plan to support connections for prevention efforts like hotlines, the 988 Mental Health Crisis Center, and connecting those with the mobile crisis response teams at the local level. And last year, or this year in his budget yesterday, he also included 7.5 million general fund with 6 million of it ongoing to OES to advance implementation of 988. So something that we'll want to see how that money flows through OES and how we might be able to work closely to get that done. And then last year, there was $2 billion in aid to counties, large cities, and continuums of care for the HAP program. And then there was a larger kind of $12 billion homelessness package. This year, the governor, in his budget that he just released yesterday, had $2 billion for homelessness. 0.5 billion of that was for tiny homes and getting up more temporary housing. And then the other 500 million is for cleaning up encampments, and that would be through grants to local governments. So that's something we'll want to be really closely engaged on with the governor's office and also with CSAC and UCC to see how that funding gets out. And then also last year, there was the police reform legislation. There was a number of bills, but SB2 Bradford, the peace officer decertification, and then some police use of force legislation that was signed. So I think that's just an issue to watch that will likely come back in 2022 as well. And then the last one that I wanted to mention was bail reform. That one didn't end up moving forward at the end of session. SB 262 was the Hertzberg bill that would have adopted a statewide bail schedule. Ultimately, it would have been the zero bail bill, but it didn't move forward at the very end of session. It was on the assembly floor. It got moved to inactive. So that's one to watch because he's already said that he wants to bring that back this year. So another one to see in 2022. And next slide, please. And then just a quick note on some of the successes that we had last year. I already mentioned the corner funding and then sideshow funding that we will hopefully be able to get done this year. Another big issue was the Sacramento and Solano, what we're calling the Kaiser Carvin. The governor's May revised budget proposal last year. It included the transfer of Medi-Cal specialty mental health services from Kaiser and would transfer those patients to the county mental health plans. It's only affects Sacramento and Solano counties, and it would align the system of care just in those two because the other counties already do it the other way. Our team was concerned about this, not necessarily for taking on the patients at all, but just because of the timeline and the resources that were going to be provided, given the discrepancy in the population that we thought this would cover. So the numbers that we had versus Kaiser and Department of Healthcare Services were all very different. So we just wanted to make sure that we're all on the same page here so that this could be a successful transfer to make sure that these patients, that their services are not interrupted and that we can do a good job. So we worked really closely with the county's legislative delegation to push back and make sure we had the time and resources needed to make it successful. We coordinated a delegation briefing, did a letter to DHCS, and Senator Pan weighed in on our behalf. And then ultimately the budget trailer bill language, it included a number of conditions that would have to be met before the transfer can occur, which gave us an additional 12 months. So that was exciting and we're continuing to work on it. It's an ongoing thing, but there are weekly calls with DHCS and Kaiser. So we'll continue to keep you posted on that. And then SB 226 by Senator Pan was our county sponsored bill, which was signed by the governor last year, which was really exciting. It would codify an agreement that the county has with DHCS to negotiate with our designated health plans. So that was good news. And then AB 821 by Assemblymember Cooper was a sponsored kind of supported bill from the county on sexually violent predator placement, specifically when an individual committed their crime somewhere else and then they're being placed in their non-domicile county. So for example, they commit their crime in Monterey, but then they're getting placed in Sacramento. Our bill would have provided more transparency to local DAs in knowing how that placement happened. And so we'd be why they're being placed here and have more information when that decision is happening. Ultimately, the bill didn't move forward because of concerns from the Assembly Public Safety Committee, but we've been continuing to work on this over the fall. And again, assuming it's still a board priority after today and when you approve the priorities shortly, or with any changes, we've already started to lay the groundwork to move something forward this year as well. Assemblymember Cooper is the chair of the Select Committee on Law Enforcement and Community Relations. So he has agreed to do an oversight and informational hearing in the next 2 months to bring light to the issue, where we would have the DA's office and others go through their concerns with the placement process and the information that they receive. And so we could kind of see what comes out of that hearing. And then if we need potential legislation, we would have a vehicle to do that as well. But the first step would ideally be the oversight and informational hearing. And then the climate resilience bonds, I already mentioned, but we were able to get the direct allocation to the Lower American River Conservancy. And then the last one I wanted to mention was waste management legislation that we'd worked on closely. SB 619 would delay enforcement and add support for counties when implementing the 1383 organics waste provisions. The bill was amended at like the last 2 nights of session, and we were really concerned with one of the self-hauling provisions, but we worked with our delegation and were able to get that removed and then ended up supporting the bill, and then it passed. So we were excited about that. And then lastly was AB 332 that dealt with the safe and proper handling of treated wood waste, which was a concern with Department of Toxic Safety and the sunset date for how we were able to treat treated wood waste. But that bill we worked on closely with the coalition and were able to get that passed and signed by the governor as well. And next slide, please. And then the last one is just 2022 look ahead. Some of these I've already mentioned throughout the presentation, but as you know, there's the budget surplus, and the governor put out his January budget yesterday with the money for homelessness. He had an additional $2 billion for housing. He also had the single payer healthcare. He didn't directly have that in the budget, but he wants to expand Medi-Cal to all undocumented folks in the state. So that part was part of his proposal. And then he also has said that he'll want to work on single payer healthcare with the legislature. And Assemblymember Ash Kalra already has AB 1400, which I think was already heard in committee today. And they're trying to move quick on that as well. So that'll be another issue we'll see this year. Again, the vaccine mandate legislation will be coming back. The governor had already wanted to do early action on the COVID recovery stuff. So increased funding for pop-up testing sites for vaccine, getting more vaccines out. So we'll expect to see budget funding and some legislation on that. Transportation funding we'll likely see. As you recall, last year, transportation funding didn't end up making it in the budget. They needed an additional trailer bill to get done in order for that money to get out, and it didn't get done before the end of session. So all the $4 billion for active transportation and intercity rail capital program, all of that got reverted back to the general fund. And so they'll need to come together with a package with the legislature and governor's office this year to be able to get that funding out. The governor proposed yesterday in his budget, I think it was $9 billion for transportation, but a lot of that was going to high-speed rail. So there could be some potential sticking points with the legislature there that we will want to keep an eye on. And then housing and homelessness are always important. Wildfires, there was a lot of climate and drought funding already included in the governor's budget yesterday, and then we'll likely see bail reform back as well. And then lastly, I just wanted to mention the ballot initiatives. A lot of them are in the very early stages, but just because there's so many broad topics to keep our eye out for, there's split roll, a potential water financing measure that could provide funding to water infrastructure projects, mushroom legalization. There was 3 different sports gambling proposals that are already being circulated, and some of that funding would go to housing or to homelessness services. And then there's another one that I didn't list on here, but would undo 3 strikes law and allow resentencing of those individuals. So many of those, again, are in the early stages, still need to collect signatures, but I just wanted to mention it because a lot of big issues will be coming up in 2022. And then with that, I will, or any questions, or I'll kick it back to Natasha for her follow-up on the specific priorities and our proposed budget proposal.
Okay, thank you, Audrey. Went through a lot of material very rapidly, and thank you for the good recap. We do have a hand up, Supervisor Frost.
Hi, Audrey. Thank you for that overview. I was wondering if any of these have numbers or assigned numbers yet, or is it too early?
For the ballot initiatives?
Yeah.
Yeah, many of them do. I think there's only like 4 that total that have qualified, but a lot of them are already getting their title and summary and are being circulated. So on the Attorney General's website, they are all listed with language, and then most of them are already being circulated once they receive title and summary.
I'm interested in the vaccine mandate legislation and the COVID-19 recovery. In particular, I don't know if you know the numbers on that.
Yeah, so the vaccine mandate legislation, last year there were 2 proposals and they actually never got introduced. They were just circulated and there was bill language, but there are no bill numbers for those yet. And they've only been in session this week, as you know, so there's been probably 100 bills introduced and the vaccine proposals are not in there yet. So I suspect we'll see it over the next month or so as bills are introduced, but no bill numbers yet. Okay. And then for the COVID funding, that was proposed in the governor's budget, and he is hoping that they'll take early action on that. So I can forward you the summary of that, but no bill number. That's just going to be a budget item.
Okay, thanks.
Mm-hmm.
Audrey, I don't see any other hands up. Just a quick question for you back to the legislation that Assemblymember Cooper had entered in as related to the SVP placement. What was the opposition in the Health Committee?
It was in Assembly Public Safety, and I think they had the concerns is just that the overarching concern that we received from the committee chair was that it's already so hard to place someone, was their argument. So any sort of additional burdens on placing someone, they didn't want to make anything harder because they already have such a hard time finding a placement, given that you have to be this many miles from a school, from a library, et cetera. Their kind of just overarching argument was anything making it more difficult is a concern. So something that we'll have to work through. But I feel like our bill didn't necessarily make it more difficult. We just wanted to get some of the information up front so that we would be able to make informed decisions when we go to rebut these hearings in court, so. Right.
I'm just curious. Who might be the ones that would be opposing the legislation to be more transparent and more, I think, upfront with the counties and communities where they're seeking to place them. So, all right, thanks for that. Any other questions by board members? If not, we'll go back to Natasha. Thank you, Audrey. No, I don't see. Unless, Sue, I'm sorry, Supervisor Frost. Yes, I'm sorry.
Yeah, I was just going to ask, were there 2 public education initiatives?
I think there's only one being proposed so far. There was also a legislative school bond proposal that was moving forward last year. It is potentially still moving this year, but again, they're very cautious about doing any bonds right now, given the state surplus. So the governor did propose some school infrastructure financing funding in his budget, but it was only like $1.2 billion, whereas the bond proposal would have been $10 billion. So the legislature and governor will continue to be seen of how that works out. But yeah, the governor wanted to do one-time funding, I think, instead of the bond.
Okay, thanks.
Mm-hmm.
Okay, anything else? All right, if not, then thank you once again, Audrey, and Natasha, back to you.
Thank you, Supervisor. We could go to the other PowerPoint. And maybe while they're doing that, I just want to note that Audrey mentioned action today. Again, this is a workshop for you today. We're hoping to hear from you, and we'll bring back a set of proposed priorities for your approval or consideration at a future board date. Okay, thank you. I'd like to also note that I'm not going to go over every proposed change in the 2022 federal and state priorities today. Most substantive changes are made at the request of a county department because they recognize a need that can be addressed legislatively and believe that the board's positioning on the issue is important. All of the proposed changes are shown in attachment 1. This is the red line version. And attachment 2 is the clean version of this document. The board letter also contains a table that explains the reason for each substantive change. So today I want to focus on pages 4 and 5 because these pages are essentially new to this document and are intended to help us identify and prioritize pressing issues in Sacramento County. Next slide. This presentation covers the purpose of the legislative priorities, proposed key board actions and advocacy priorities, a sponsored bill proposal, and 5 proposed state budget requests. And we'll also talk about next steps as well. Next slide. The legislative priorities do several things. They establish the priorities, principles, and policy statements of the Board of Supervisors. Secondly, they create the basis for advocacy efforts, alerting stakeholders to the county's greatest needs. And third, they provide staff and interested partners guidance on the board's positions on key policy matters, which essentially means providing guidance to my office, the Governmental Relations and Legislative Office, on how to engage on policy issues that arise at the federal and state levels. Next slide. As I developed a set of key advocacy priorities for your consideration, I looked to some of the issues this board has prioritized over time. I listed these actions on page 4, setting the context for my recommendations. They're also listed here on the slide. I think it's important to note here that while I have identified a set of key advocacy priorities to provide greater focus, these priorities, of course, do not limit my ability to weigh in on other issues that may arise in 2022, and of course are consistent with this document. So first, the board has prioritized Bay Delta activities, has prioritized declaring racism a public health crisis, declaring a climate emergency, has also prioritized some budget priorities, including addressing homelessness and related issues of mental health and substance abuse, as well as improving the condition of streets and roads. And then also last year, the board had directed our office to, as Audrey noted, work on the issue of placing sexually violent predators in Sacramento County. And also, as she mentioned, the issue of dangerous sideshows, which essentially means illegal street racing. So looking to these actions, I developed a set of key advocacy priorities. Next slide. Okay, priorities 1 and 2 address the FM3 Research Community Needs Survey and subsequently the board's adopted budget priorities. So the first key priority is housing and homelessness, including efforts to address its related impacts. The second priority is funding to modernize aging transportation corridors, or Fix It First. Really, this is about bringing additional funding to fix our roads. The third priority is COVID-19 response and recovery. This priority recognizes that we continue to navigate the pandemic and the needs associated with it. The fourth priority addresses behavioral health. This priority recognizes the need to coordinate with the state on several of its major initiatives that will be implemented in 2022, including implementing the first phase of CalAIM, grant funding opportunities for behavioral health, and Medi-Cal benefit expansions, among other things. This priority tracks with what the Urban Counties of California is doing, or UCC rather, and we will work closely with that association on this priority. The fifth priority is supporting funding to enhance local climate mitigation and adaptation efforts. This directly supports the board's adopted resolution declaring a climate emergency. The sixth priority addresses the board's adopted resolution declaring racism a public health crisis. The language for this policy statement is derived from that resolution, which speaks to addressing the underlying social determinants of health. The seventh priority supports the board's direction to address sideshows. The eighth priority also supports the board's direction to address the issue of SVPs, or sexually violent predators. And the ninth priority addresses the board's Delta priorities. With that, I'd like to move into talking about a proposed sponsored bill and some state budget requests that I think are supported by these priorities. Next slide. This year, I'm recommending that the board sponsor one legislative bill relating to the Delta in support of priority number 9, improving and mitigating risks in the Delta. This bill idea is to establish a statewide ongoing funded program that would remove commercial abandoned and derelict vessels, or ADVs, from California's waterways. This work would be done through a state coordinating council, or a state coordinating council of federal, state, and local agencies that would identify, prioritize, and authorize the removal of commercial ADVs. Currently, there's a statewide program for the removal of recreational ADVs, but there's no such program that exists for commercial vessels. The next couple of slides gives you a visual what I'm referring to when I say commercial ADV. Next slide, please. 6 months ago, I didn't know anything about commercial ADVs. I didn't even know what they look like. And you may know what they look like, but I wanted to show you some photos to illustrate what I'm talking about. These images are of commercial ADVs that are currently in our Delta within Sacramento County. Commercial ADVs are often equipment used in marine construction, such as a crane barge as seen in the top left picture. In that photo, the barge is actually sunk and the only thing that you can see is the crane, which is above the water. In the second photo, you see a sinking barge. You notice that at the bottom of the photo. There's a number of other non-working vessels. They're kind of all tied together. And these are just sitting here polluting our Delta waterway. Next slide. Now, each of these photos are of an abandoned site also in the Delta. It's called Scary, which is named after the last name of the person that used to own these vessels. At the top, you see an old abandoned tugboat. And to the right, you can see a sunken crane barge. I like this photo because it illustrates how oil can easily seep into the waterway, and you can see it there in the top right corner. There's a sheen on the water. The thing about these old commercial vessels is that they are full of environmental and human toxins, such as lead and oil. When the tide comes in and out each day, it picks up these toxins on these vessels because the water reaches the engine compartment or other places petroleum products or other hazards were stored and pulls them out of the vessel and into the waterway, creating negative health, environmental, and ecosystem effects. That bottom photo is also a crane barge, but I included it here because this one shows you the magnitude of the size of some of these vessels. They're massive and incredibly difficult and expensive to remove. It can cost millions of dollars to remove oil, hazmat such as lead, and to dispose of the metal and other materials that make up these vessels. Several federal, state, and local agencies are involved when removing these vessels, but they don't always coordinate well or at all in some cases, coordinate well or at all in some cases. My apologies. Next slide. So the problem is that commercial ADVs create health and environmental and navigation hazards, as I noted, in the Delta, and there's currently no program or coordination among affected agencies to effectively address this issue. After some informal conversations with federal, state, and local partners, we believe a state program that brings these partners together to identify, prioritize, and fully fund the removal of vessels will clean up our waterways of commercial ADVs. So with that, I'm happy to answer any of your questions about this proposal, but I've also asked Sergeant Darren Epperson with the Sheriff's Marine Detail to join me today to assist with any questions you might have.
Okay,
Any
thanks.
questions? Yeah.
Thanks, Natasha.
Go ahead, Supervisor. I'm sorry.
No, go ahead, finish up.
If you don't have any questions on this proposal, I can continue on with the presentation.
Okay, I was going to pause and see if there was any questions regarding what you had outlined. And I appreciate that Sergeant Epperson's on the call as well. So any questions? I don't see any. Okay. All right. Let's keep moving on.
Great. Next slide. Okay, let's talk about state budget requests. As you probably heard from Audrey, we anticipate that there will be a discretionary surplus in the $31 billion range. And I think it's important this year that Sacramento County put forward its own requests. As noted with the key priorities, this will not limit the board from weighing in on other important budget matters. So there are 5 state budget requests I'm recommending that the board sponsor this year. The first request is a one-time state general fund request of $1.2 million to fund electronic benefit transfers, or EBT, for use of CalFresh benefits at farmers markets. This request is made in support of advocacy priority number 6 relating to health equity. This proposal would make the use of EBT more cost-effective for farmers market vendors in Sac County, and it would increase access to healthy, fresh food for anyone regardless of income. Okay, the second request is a one-time state general fund request of $2 million to fund a statewide task force program for the California Highway Patrol. You heard this from Audrey. This supports your advocacy priority number 7, which relates to sideshows. Next slide. The third request is a one-time state general fund request of $3 million for improvements at Mather Community Campus. This request is in support of advocacy priority number 1 relating to housing and homelessness. The need is great, as you well know, at Mather Community Campus, and we hope to bring some additional resources to help make some needed improvements. The fourth request is a one-time state general fund request of $20 million to remove commercial ADVs in the Delta. Now this slide reads $18 million, but I've received new information since creating this presentation, so I'm recommending a $20 million request. This request is in support of advocacy priority number 9 relating to the Delta, and it is complementary to the sponsored bill I spoke about previously. Last year, Assemblymember Frazier, and you heard this from Audrey, sponsored a $12 million request to remove commercial ADVs in the Delta. The State Lands Commission did receive those funds and is in the process of determining how they will spend those funds. Now, while we appreciate this step forward in funding ADV removal, the need in the Delta is much greater. The State Department of Fish and Wildlife has estimated a cost to remove all commercial ADVs in the Delta at around $34 million. For this reason, in partnership with our Delta County partners, we recommend the board request $20 million to close that gap. The fifth and final request is a one-time request of $50 million for a statewide regional parks fire prevention program. This request is in support of advocacy priorities number 1 relating to housing and homelessness, and advocacy priority number 5 enhancing local climate mitigation and adaptation efforts. This request will provide local jurisdictions funding to provide housing and services to persons camping in parklands in order to reduce wildfire risk. I see a question. Supervisor Cerna?
Yes, thank you, through the chair.
Sure, go ahead.
Yeah, thank you. On that $50 million request, Natasha, first of all, there probably is some kind of formula to how you arrive at these numbers. So I'd be interested to know specifically how you arrived at the $50 million figure for the Regional Parks Fire Prevention Program legislation or funding request. And then would we be so specific in our request as to point out various different regional park assets under the purview of Sacramento County? Would we specify how much would be that we would request for the American River Parkway, separate from Dry Creek Parkway, et cetera, et cetera?
That's a good question. 2 things. First, I've asked Corey Brown, who is a local attorney and a Parkway advocate, to also be here today to help answer questions on this request. So I'll probably hand it over to Corey to maybe address, Corey, the $50 million number. And then if you want to respond also to the specific assets within Sacramento County, but I would just note that this is a statewide program. So I would like to hear from Corey what his thoughts are about including those specific assets.
Thank you.
Yeah, thank you. Corey?
Very good. Thank you, Supervisor Cerna, for the very good question. The $50 million figure recognizes 2 key factors. First, the problem is a very large problem and exceeds what $50 million could accomplish, but it could make a significant impact upon providing housing to folks that are unfortunately illegally camping in the parkway while reducing fire risk and protecting natural resources. The $50 million seemed to be a reasonable amount to ask for in context of this year's budget, with the size of the budget surplus, with the governor's leadership and focus on helping address homelessness as well as wildfire. So while the $50 million doesn't solve the problem, it gets us part of the way through that. And that's why we came up with a $50 million figure. Certainly, much more could be allocated to address this on a statewide basis.
And then, Corey, would there be any specificity in our request to pinpoint different assets?
There could be, because this would be establishing a statewide program. Generally, you would be setting up criteria that the agencies would be allocating the funding. The current draft includes criteria that would be very favorable to Sacramento's parks, including identifying areas that have had severe damage currently from wildfire, that have a significant issue of people camping within the parklands and things like that. But there is flexibility in terms of exactly how this is drafted. But I think to get a statewide program established at this dollar amount, sometimes it's more difficult to earmark funding for specific parks rather than set up criteria. I think if the criteria is established appropriately, you can end up with the same result. But very open to suggesting different types of language for this program.
Great. And then lastly, I think I heard you say that the money would be used in part, or perhaps a majority of it would be used to help find shelter or housing for folks. So it would respond to the connection between encampment, living in parkways, and fire risk, and trying to reduce the risk by way of relocating folks from parkway assets into appropriate shelter. Is that what I heard you say?
Correct. Yeah, the basic notion is that each dollar would be helping achieve three goals. First, providing housing to reduce homelessness. Second, reducing fire risk. And third, protecting park resources.
Okay, very good. Great. Thank you.
Thanks, Corey. Supervisor Frost, you had a question?
Yes, thank you, Chair. Corey, I was wondering, to the point of being able to identify other different assets, is it possible to identify like a community who's working on an escape fire evacuation plan, safety and evacuation and mitigation plan? Speaking specifically about Rancho Murrieta, which is an at-risk community with like one road out, and they're trying to put together a plan that would prevent them ending up in a situation like the car fire. So we've been looking for funding for that.
Yeah, more than happy to talk to you and learn more about that situation. I am familiar with Rancho Murrieta, but I'd love to learn more about that situation and provide advice on how you could potentially address that.
Okay, great. Maybe I can reach out, or you can reach out to me. I really appreciate that.
More than happy to.
Okay. Any other questions? If not, keep moving down through, Natasha. Thanks, Corey.
Great. Thank you, Supervisor.
Yes, thank you, Corey. That brings me to the last slide, which is really just to talk about next steps and to hear from you and your thoughts overall.
Okay. All right. We've heard some comments, and obviously a lot bundled up in the legislative package. And thank Natasha, Audrey, certainly Corey, and Sergeant Epperson for their contributions to this, along with all the other county departments that I'm sure have weighed in. So let me go to my colleagues. I see Supervisor Desmond.
Thank you, Chair Natoli. Thank you, Natasha and Audrey. I have a question on the governor's budget, proposed budget with respect to cleaning up homeless encampments. Was there any specific language in there about funds specifically for abandoned vehicles? And maybe you think about, we're talking about abandoned and derelict vessels. I'm thinking about vehicles, not vehicles that are currently being used, obviously, for housing. That's a different issue. But abandoned vehicles that are unquestionably abandoned. I mean, it's becoming a bigger and bigger problem. We're wrestling at STA about trying to get more, vehicle registration fees, renew the vehicle registration fees for abandoned vehicles, but it's not enough. So do you know if there's was there anything specific about that in the budget?
Natasha, I didn't know if you wanted me to jump in, but no, I don't think there was anything specific to that. We haven't seen trailer bill language yet, but it's really just to expand the $50 million in competitive grants that they did last year from the encampment resolution program. So I'm just looking at the summary of what he put out yesterday, and I don't see any mention of that, and I didn't hear it in his presser. So I'm thinking more just for relocating for encampments, but I didn't see anything related to vehicles in it.
I wonder if it might be worthwhile to make it the language broad enough to encompass those kinds of efforts, because a lot of these encampments involve abandoned vehicles as well. So
or even an additional appropriation if needed. I think that's a great idea.
I think a lot of municipalities are wrestling with it. Certainly, I know in Supervisor Toley's district, I mean, downtown Sacramento, of course, but also in the unincorporated areas more and more. Thank you.
Any other questions, comments. This is a workshop. I would just note, I'm very supportive of certainly appreciate the comments Supervisor Desmond relative just to abandoned vehicles and anything we might do to give us an opportunity to seek more money there, but certainly on the abandoned vessels, I mean, the magnitude of just the pictures that were shown there, if you were out on the shoreline or out on the water, just massive structures, obviously constructed of steel and other metal, and there they sit in the water, either sinking and or contributing pollution or certainly causing other hazards for boaters and recreations and so forth. So, and I know that our, marine detail with the county has been very, very engaged both on the recreation vehicles, but certainly as it relates to working with our brethren in other counties and folks to, I think, get focused to the issue. And folks in Yolo County, I know years past have been involved, but all 5 Delta counties are very committed, and we appreciate the efforts that Assemblymember Frazier brought forth last year. But clearly, there's a need for additional funding, and I think we could be at the forefront working with our fellow counties to seek legislation in a year that looks to be a good budget year to maybe begin to clear the delta of some of these hazards and have an effective program to do so. So, Natasha, anything you wanted to add, or is there Sergeant Epperson anything before we bring this back to the board?
Because you asked Sergeant Epperson, maybe I'll see if he has anything to add. Just to note that Supervisor Desmond's comment, I could add another policy statement here related to abandoned vehicles specifically. We could add a budget request. I can work with some folks to identify what that might look like, and add it here and bring it back to you in the next iteration, if that's what you would like to see.
Well, pleasure of the chair.
Yeah, no, I think it's great.
Yeah,
I mean, the worst thing to say is no.
Yeah, right. Exactly. I agree. Either as part of the larger, budget item to clean up encampments, or a separate one, because I think it's becoming a bigger and bigger problem.
I definitely think we need to raise awareness. I'm sure that folks know about it, but I think to the extent that we can raise awareness, I think that's also really important as well. So I'll add something into the document for your consideration.
All right.
Hey, Natasha, this is Sergeant Epperson. Can I add something?
Oh, sure.
Sure,
Good afternoon to Chair Natoli and the members of the board. I just want to add that the photographs that Natasha showed, and she did an excellent job kind of explaining the situation. There's 3 large commercial abandoned derelict vessel sites within Sacramento County on the waters. She had pictures of 2 of the sites, but there's another 3rd site that's also the same scale and scope. I would estimate each one of these sites is going to cost around $2 million to clean up from start to finish. So that would be $6 million just for the county of Sacramento out of that $12 million that the estate got for the entire Delta. Even the $34 million estimate was done in 2018 and is probably shy of the actual cost. But we certainly are in need of that additional funding, and certainly are in need of a statewide program. So I certainly appreciate the board's support in this as we try and come up with a solution, not only for our area and the Delta, but statewide.
I might just make a quick footnote here. I still got a couple of colleagues punched up, but is that there needs to be some assurance too that what these vessels are retrieved, that they're not put back out in the marketplace. I mean, that was an issue some years ago with some of the vessels that they were, abandoned, taken in via whatever program. They were surplus to begin with, and then they were sold to some scrap dealer and put right back out on the water to once again be a potential problem. So I think that just as they do with a lot of the abandoned vehicles or cars that are given through under certain programs, they are destroyed. So there's no question that somehow this is going to be spend all that money cleaning it up, and then it ends up being somebody's problem later down the road again. So.
Yeah, that's exactly correct. So our only option is destruction and disposal. There is no reuse of any of these vessels or marine equipment, because you're right, it'll just get pushed around across our county line to one of the other neighboring counties, and it'll be the same issue for them. So we've already crossed that out as an option.
Good, okay. Thanks, Sergeant Epperson. Appreciate your work there. Okay, we have Supervisor Frost and Supervisor Kennedy.
Just wanted to ask Natasha, when are you coming back with this second review?
Good question. If I brought it back on consent, I'd come back on the 25th. If we come back for a presentation, I have to push it out to February. So my preference is to bring it back to you on consent with what we've talked about here today on the 25th, so that we can get working on these issues. We've done some preliminary work, but without your approval, I don't really feel comfortable having the conversation, having conversations with the legislature on these issues.
Is it possible to talk with you, Corey, prior to that timeline?
Yes, I can be available this week.
Okay, thank you.
Okay. Patrick.
Yeah, I just not to belabor the point, but on the abandoned vessels, are we going to have a coordinated effort with other counties? Because there's two sides to every river.
Yes. That's a good question. Go ahead, Sergeant Epperson.
Yeah, so we do that now on a county level when it comes to the recreational vessels. The three sites that are within our county are far enough into our county that they're not going to drift away. They're all fairly large, and most of them are sunk down on the bottom. So we don't have any issue of them creeping across the county line or too much concern for coordinating with the neighboring counties. But what we're proposing is a statewide solution where all the counties in the Delta and then the San Francisco Bay and then along the coastline all would have some say in this council of statewide agencies and some federal representation. So that's the whole idea of the coordinating council, is so all of us can present our issues and problems, of our ADV sites to the council. Then they can look at them, accept them, prioritize them, decide which ones are going to get funded, and then set out to enact the disposal of those sites.
Thank you.
It's really the only way to go is coordinating.
Okay. All right. Any other questions, comments? If not, I think, Natasha, you've gotten pretty good direction and consensus around most of the issues. Sounds like a couple bringbacks and on the consent calendar in 2 weeks, it sounds like. So
Happy to do that.
Chairperson, we do have a public comment.
Sure. Okay, very good. Let's go to our callers then.
Okay, could you please transfer the caller? Hi, caller. Please start with your comments. You have 3 minutes.
Sure. Hey, my name is Nikki Jones. I'm an organizer with Incarcerate Sacramento and also an organizer with the Sacramento Homeless Organizing Committee. I do appreciate the presentation today. I have some questions, and I wonder, kind of on a bigger picture, how these priorities are determined, where, some of I saw the 1 through 9 priorities and kind of how those find themselves manifesting in particular legislation. Here and there, we see this one example about cleaning up the river, which I really appreciate. But I would like to kind of have a bigger picture, also know how this process seems like how it should be more engaged with constituent policy priorities, and would like to hear how those have been engaged and what engagement will happen before those priorities come back for approval. There were a lot of things brought up and discussed, and a lot of things kind of placed on the slideshow and not discussed. Obviously, would have liked to hear quite a lot more about some of the real emergencies that we're in, like the climate emergency. And I know that the cleaning up the river relates to that, but there are a lot of kind of when you're the county and you can only work on county things, what you advocate for on the state and federal levels is just so huge. This is where the sky's the limit. This is where you have to dream about what your county and your constituents need and listen to them about what that is. And so I also have concerns as it relates to criminal justice fines and fees. Really, really disappointed to hear that this county advocated for less removal of fines and criminal fines and fees removal, criminal justice fines and fees removal. You know, the county and city went through a listening session process this year about that. We've heard a lot. There's a community working group on this that has a lot to say about how these fines and fees particularly impact and affect the lives detrimentally of communities of color, of poor communities, and why these are tied to histories, legacies of white supremacy, and why are we advocating when we understand racism as a public health crisis, when we understand the criminal justice system has been lopsided, why are we advocating for these fines and fees that weigh families down, that weigh community members down from reestablishing in the community? It's really honestly absurd, and I'd really love to hear any thoughts about why that was a priority. I understand the lost revenue, but we have to account for the wrongs we've done. You can't just say, oh, we're going to lose money. You have to account for why these people should be paying you. They shouldn't be. We've historically seen that we've wronged the community, and now we need to account for it. So, this is really one small piece of a bigger picture of where is the community engagement on your process for deciding legislative priorities, and we really need to know why you fought to keep these people in debt, because it is honestly atrocious. So yeah, appreciate all y'all's time and work on this, and hope to see something different in 3 weeks. And obviously would like a presentation. There needs to be quite a lot more dialogue, and it's the fact that it would come back on consent and prohibit some of that dialogue is even more concerning. So I think we need to expand dialogue instead of and community engagement instead of moving towards a lack of a non-transparent legislative priority process. Thanks.
Thank you, Nikki. Thank you for your comments. Okay.
Uh,
any response?
There's no
Sure,
more callers.
Oh, I'm sorry.
Sorry.
Okay.
I can't, your mic is going in and out on my end, so I apologized. I didn't mean to cut
Okay.
anyone off.
No, it's fine. Okay, well, I was asked, Natasha can respond. I know we had another call. I think there's only one caller, but we'll take the other callers, then we have Natasha can respond.
Yeah, I appreciated the comments from the caller. On the criminal justice fines and fees, we did not advocate on keeping the fees or not keeping the fees. We were just making sure the legislature understood the impact of the loss of that revenue. And we were advocating for backfilling those fees. We wanted the legislature to step up and provide us revenue, again, to address the revenue loss. It wasn't that we were advocating to keep the fees. So I just want to make that clarification. So sorry if for some reason that got confused. Audrey, did you want to add anything on that?
No, that was perfect. I just wanted to apologize if that came off as that's how I advocated that. No, it was just simply, we just wanted there to be a back as those fees are used for other county services. So we simply for a backfill, not on whether the fees should be eliminated. We had, did not weigh in on that. So thank you, Natasha.
Yeah, and then just to note that the advocacy priorities were derived from actions that this board took. So that's how I came up with these 9 priorities. And I kept these statements broad, and that's intentional. I want to be able to have some flexibility to weigh in on the issues that are coming up in the legislature. If we're super specific here about priorities, we might be missing something that comes up both at the federal or state level. So these are intentionally drafted the way that they are. I also want to note that we do a lot of work internally with departments to identify what their issues are, what's coming up, things that they know that need to be addressed in the coming year. And that's how we revise these priorities. It's always in partnership with our department director. So just wanted to make that note as well.
Ann, you had your hand up. Go ahead. You're on mute, Ann. There you go.
I apologize.
Yeah.
I also just wanted to point out that many of the key advocacy priorities, not all, but many of them are also quite consistent with the results of the poll that we recently conducted with the community about what their priorities are. So many of those are consistent with the public as well.
I would just say too that, again, appreciate Nikki calling in. I know she and others certainly have weighed in, at board hearings consistently over the course of a number of years. But if there's, interest, certainly I know Natasha, you're always very accessible. And I assume that Audrey, if you need be, wanted to talk further, is the one just that you've explained how we derive them, into Ann's point, your point about either working with county departments through survey instruments, through board direction. But I think, part of the question was there is that how are these developed, and how do they get before us in the format that they are? And I think that's been, addressed in part. But again, I would encourage Ms. Jones and others to reach out to you, Natasha, and you can maybe coordinate some ongoing discussion about at least how you get there. Obviously, it's still up to the board to either bless these or not. So,
Sure.
Okay, thanks. All right, Flo, you said other callers?
We do not have any other callers.
Oh, I'm sorry. Okay, got that. All right. Okay, so this is a workshop. I'll bring it back to the board. Looks like we're going to try to come back in a couple of weeks. I would just note too, if it's on consent calendar, if there are any questions or comments, we can pull it off consent to have further discussion. In fact, we could schedule it back as a separate matter. I'm fine with that too. I mean, if there were some items, there's, unless there's objections by the board, if there is an interest, obviously. Maybe
We would have to wait till February if we bring it back for a presentation.
Why?
If it's on, excuse me.
But I was just saying, why is that though? If we brought it back as a separate matter, I mean, our agenda is full, but no full, it can't be fuller than it was today, or is it?
It is.
Okay, so we have an evening session on the 25th. Is that what you're saying? Because we're going to get there today before we're done, I think so. All right. Well, again, and I'll get to Supervisor Frost, but you can bring it back on the consent calendar, but if there's discussion, we're going to end up pulling it off anyway. So anyway, all right.
That was what I was just going to say. We
We
could
will
put it on,
do what you wish.
we could put it on consent and then pull it if we have changes or comment.
Or comments and yeah. All right. So the board's okay with bringing us back on the consent calendar on the 25th, recognizing some of the timelines, but understanding we may have further discussion. If so, obviously it will come off of consent. So it's okay. All right. That's what we'll do then. We'll come back on the 25th, and Natasha.
Thank you.
Thank you. All right. Very good. That concludes that item for the present time. So we'll now move to the 2 o'clock matters and go into the time items for the afternoon. Madam Clerk, next item.
Okay, for item 57, you are acting as the Sacramento County Water Agency and the Sacramento County Water Financing Authority. This is approving the issuance of the Sacramento County Water Financing Authority of Series 2022 revenue bonds, interim financing in a principal amount not to exceed $95 million, and approving the forms of and authorizing the execution and delivery of the related documents, and directing and authorizing certain other actions in connection therewith.
Good afternoon, Chair
Hi,
Natoli.
Colin.
Yes, this is Colin Bettis, your county debt officer. The item before you today is the approval of the Series 2022 bonds for the water agency. The water agency intends to finance the costs of certain additions, betterments, and improvements to the agency's water system, comprised of the Arden Service Area Distribution Pipe Realignment and Meter Installation Project, utilizing the WIFIA credit agreement that was approved by the Board of Supervisors on November 17th and closed on December 8th of 2021. The WIFIA credit agreement was selected as the method of financing due to the advantageous rates that are now set at 1.89%, which is better than what was originally anticipated at 2.08% as of October 20. As mentioned in the presentation in November, the agency and the Office of Budget and Debt Management are now recommending approval of an additional interim financing, namely the Series 2022 bonds, in order to achieve additional savings during the construction period. At the time of writing the report, the estimated savings were approximately $1.8 million due to the very beneficial interest rate achieved through the WIFIA credit agreement set at 1.89, as well as rising short-term interest rates. The amount of actual savings during the construction period will now be less than originally anticipated and is now estimated to be approximately $700,000. The WIFIA credit agreement allows for the unique opportunity to lock in those long-term interest rates and only pay on the credit agreement at the time that we pull down the loan to take out the interim or pay off the interim financing. The agency will be required to pay a portion of the interest on the interim financing mechanism. However, that will be paid at the short-term interest rate at approximately 0.8% versus the 1.89% of the WIFIA credit agreement. In addition, we plan to issue the Series 2022 bonds with a premium, which will be utilized to pay the costs of issuance and a portion of the interest during the construction period. That concludes my presentation, and I'm available for any questions you may have.
Okay, thank you, Colin. Was there anybody else on? You had a number of other presenters, but they're just available if there are questions. So
That's correct. We have Nick Jones from PFM on if you have any questions from our financial advisor.
Very good. Let me look to board members' questions on this. All right. Oh, Supervisor Desmond, go ahead.
I pressed the wrong button. Thank you, and thank you, Colin, for the presentation. Mine doesn't have to. My question or comment doesn't have to do with the financing, but just really the projects that this is going to fund in general and the impact in some of these communities that are served by the county. And I had a brief conversation about this with Chair Natoli and our county exec. I mean, we're going to be doing an awful lot more work in some of these communities and tearing up some of the roadways in the process. And I'd just like to go on record, and reiterate conversations we've had in the past that it's my hope that our Department of Transportation will be working closely with the Sacramento County Water Agency to identify opportunities where, instead of just repairing a portion of a roadway that may already be degraded to an extent, that we are repairing the entire roadway, or at least doing an overlay on the entire roadway. I know Chair Natoli probably has some comments about this as well, but it really creates a lack of trust in these communities when they see the county come in and they're already dealing with a roadway. It may not be one of the worst on our PCI index, but it's already in pretty bad shape. And a utility comes in, tears it up, and just repairs, a little patch. That is very, very frustrating to folks. So I really hope that our DOT folks are working together and really maximizing our dollars to repair the entire roadways where we can. I don't know if.
Yeah, I would just like to maybe piggyback on that, because we did have that brief conversation about this, and I would just add that, and I shared this in my briefing with Ann yesterday, that this project, probably the largest one, we got 30 miles of distribution pipeline in right of way is going to be installed with this project. And I drew some parallels with the Harvest Water Project, which again will be in a rural area where the roads are some of the worst PCI in the county already. And it's one thing for the utility of the water, and whether it's delivery of recycled water with the Harvest Water Project, which benefits us in lots of different ways, or the potable water supply for folks in these neighborhoods in District 3. It just seems to me that if we're going to approach this from a more global, and I think the rightful approach, that is that for streets that have long been in a deteriorated state, to not go in there as a part of these projects and upgrade the water infrastructure in this case, but also get the streets back into a good state of repair is ignoring the problem. And yeah, it takes money, and it's not the water department's going to pay for all this. Only there is an apportioned share, but and whether we look at it in the general fund context of these larger projects, or we look at it in the context of we're using WIFIA to finance the water infrastructure, and you have a rate behind that. But maybe there's some other infrastructure financing that would allow us to do this. But I just think that it would be a real mistake for us to go in and only do half a street or a section of the roadside edge and then call the rest good because that's just the way it was and we didn't touch it with this project. I think that's a bad way of doing business. We've done that this way in this county for a long time, sometimes out of necessity. I think those days are over, at least in my view. While we're looking at our budgets and so forth, and whether it's in this segment of the county over the next 2 or 3 years as this bill goes on, the Harvest Water Project over the next 2 or 3 years, we need to find a way to do a complete streets and put the streets back into a state of repair that will last another generation or two. Whereas right now, they're already in a deteriorated state. So I'm 100% supportive. And if this needs to be a budget discussion, again, it's not all gonna be done this year for upcoming budget deliberations, then so be it. I just think that it needs to be a business practice on the part of this county that not only will we go in and repair what we tore up, but we actually make it better when we leave that spot and have a road in good repair. So I don't know. I had a chance to talk with you. I'm not necessarily generating response today, but I feel pretty strongly about it as it relates to this project as well as others in this county. So.
Supervisors, this
Yeah,
is
Michael.
Mike Penrose.
Welcome back.
Thank you. I just wanted to weigh in a little bit and advise the board that there has been significant coordination for the Arden water projects in past years, based just on the exact concerns that have been raised both by Supervisor Desmond and yourself. And there is an effort underway and a clear acknowledgement of the coordination of the infrastructure provision with these projects, both with DOT and the water agency. The needs of the funding for all the components of the road rework may come up in future budgetary discussions. But in terms of prioritization and coordination of work and putting those two together to get the best complete project for the road conditions, that's in play and will continue to be exercised as this program is delivered. It's clearly the best way to do it. So just wanted to assure you that those coordination efforts are actually underway and being considered from a programming perspective to line up that work together. So.
Well, thank you, Michael. And I would suggest it again with the Harvest Water Project, which is miles and miles. It's at least probably 30 miles of rural roads that are in bad state of repair. And there's no way that with D5 allocation, you could get all those roads done in the next 5 or 10 years with overlays and repairs. So I just think it needs to be a part of that discussion with the sanitation district as well. And it can't just fall to that project, just like with the water can't fund all this either. So I know you're aware of it and you were aware of it before you retired and came back, but I appreciate your leadership on this issue. So we'll need some attention to it. All right. Anything else on this? If not, then we have any callers on this?
We do not have any public comments.
Okay, we have a recommendation. We have a motion.
I'll move approval. Desmond?
Okay. Okay, it's been moved and seconded then to approve the staff recommendation. And this is acting as the Sacramento County Water Financing Authority. So do we wear a different hat now or?
I think in fact, there's 2 actions, one for the agency and one for the authority.
Okay, and so they require separate actions?
I believe so.
Can I ask Lisa Travis to confirm that? We haven't done that in the past for other items when you're acting as 2 hearing bodies. I read into the record that you're acting as the Sacramento County Water Agency and you're also acting as the Sacramento County Water Financing Authority.
Right. I mean, since the board members are the same, I believe that it's acceptable to just take one motion. Either way is fine, I guess, but I will defer to the board as to how you want to handle it.
Okay, I think one motion is fine, as long as it's acceptable. So
Yep.
if I understood Supervisor Desmond's motion, it was seconded by Supervisor Frost, and that would be the action to acting as both of those bodies, the agency and the authority, to approve the staff recommendation. Okay. All right, if nothing further, then Flo, please call the roll.
Thank you. Supervisors Frost,
Aye.
Kennedy,
Aye.
Desmond,
Aye.
Cerna,
All right.
Natoli,
Aye.
unanimous vote.
All right,
Okay, for your
Okay,
next,
next item.
okay, sorry.
All right, go ahead.
Item 58 is the retroactive authority to apply for and accept grant funds and execute a retroactive revenue agreement up to $5 million with the State of California Department of Healthcare Services for the term of July 1, 2021 through June 30th, 2024 for the Behavioral Health Quality Improvement Program. Authority to execute retroactive revenue agreements with qualified and interested managed care plans for the term of January 1, 2022 through December 31, 2022. Retroactive authority to amend and increase fiscal year 2021-22 expenditure agreements with behavioral health providers in the total amount of $3,410,000 from January 1, 2022 through June 30th, 2022. Approve a salary resolution amendment adding 10 full-time equivalent positions and approve an appropriations adjustment request in the amount of $3,787,621 to support the implementation of California Advancing and Innovating Medi-Cal Enhanced Care Management.
Okay, thank you, Flo. All right, looks like Siobhan and Brian and Janine Spodnitz are up today, so on this one, again.
Great,
Go ahead.
thank you again. Good afternoon, board. I am going to go ahead and give the presentation on CalAIM implementation, and Dr. Quist and Janine are available to answer specific questions if they should arise. So this is just a continuation of the CalAIM discussion that we've been having with the board. We came to you with a board workshop last fall, and then we've been speaking to you about different components of that along the way, such as the health information exchange. So the first several slides are kind of a repeat of some of the information that you've already heard from me. And so I'm going to speed through those very quickly and get into the heart of the proposal pretty quickly. So next slide. So just as a reminder, CalAIM, California Advancing and Innovating Medi-Cal Overview, basically the Department of Healthcare Services for the state submitted a waiver to the federal government, to CMS, to improve the quality of life and healthcare outcomes and reduce disparities in outcomes for Medi-Cal beneficiaries by implementing a broad delivery system, program and payment reform across the Medi-Cal program. So that's just a big way of saying we're going to use healthcare dollars to do things outside of the box to improve the quality of life for people that we serve. The federal approval came for this waiver on 12/29 and with a January 1st go live date. Next slide. So a reminder about the framework. The way CalAIM works is that the federal government gives funding to the state Department of Healthcare Services, and the state has developed the framework. Within that framework, local managed care plans that operate within counties actually develop these models of care in conjunction with and with input from the community partners. In Sacramento County, we have 5 managed care plans: Aetna, Anthem, HealthNet, Kaiser, and Molina. I want to thank our plan partners. They've done a fantastic job coming together and engaging with the community, with the county, with our health systems, our federally qualified health centers, and our community-based organizations to be able to get input about the gaps and the needs for Medi-Cal beneficiaries in our communities so that we can develop the best model of care possible for Sacramento County. And so that is the framework. Next slide. So under CalAIM, there's several initiatives and reforms: enhanced care management and community supports, which I'll talk a little bit more about in a moment, behavioral health payment reform, behavioral health medical necessity criteria, eligibility criteria, and documentation redesign, a long-term plan for foster youth, a multi-system data exchange and care coordination, mental health and SUD integration projects. SUD is substance use disorder, and population health management. Next slide. So a little more in-depth, enhanced care management and community supports. I've spoken to you about this, and the reason why this is important to highlight is because this is what goes live now in January. And the goals of enhanced care management are really to provide a whole person care approach through comprehensive care coordination. This is really building upon the lessons learned through the whole person care pilot that just ended here in December of last year. The whole person care target populations include folks with severe mental illness or substance use disorders, homeless individuals, high utilizers of healthcare, foster youth, individuals transitioning out of incarceration, nursing home residents transitioning to the community, individuals eligible for long-term care and at risk of institutionalization, and children with significant medical or mental health needs. Community supports provide medically appropriate and cost-effective alternatives to higher cost emergency healthcare services. These fall into 4 buckets, although there's 14 identified community supports at this time. Housing and navigation supports, which include things like navigating folks who are homeless into more permanent or secure housing, security deposits, tenancy repair, those types of strategies. Post-acute support services, this includes things like respite care or medical respite as folks are transitioning out of higher levels of care, such as a hospital. Transition supports and at-home supports like personal care. How do we help keep people, transition people back from institutions such as the jail or such as nursing home into their own homes? And then how do we help support them once they're in their own homes to maintain? Next slide, please. So this structure really puts, the proposed structure really puts Sacramento County at the hub of CalAIM planning for the community. And the Department of Health Services, our behavioral health, primary health, and public health divisions will play a coordination role in this, ensuring that our elected officials, our Board of Supervisors, and other community leaders have an opportunity to learn about and weigh into the decisions being made under CalAIM, engaging community providers and stakeholders, and then working with our managed care plans to ensure that whatever models are being developed are doing so with our beneficiaries in mind. The Department of Healthcare Services alone is just one of the departments that's heavily impacted by CalAIM. Our Department of Homeless Initiatives, Department of Human Assistance, and Department of Child and Family Services are all key departments in making sure CalAIM gets up and running as it should. And I just want to thank my department head partners and the County Executive's Office for all of their support in thinking through how this can best be rolled out. Next slide. So in this proposed county role that we'd like to have in CalAIM, starting in January, right now, 2022, these are the activities that we're proposing that we take on as a county. Ensure coordination amongst managed care plans and providers, define the needs and gaps to inform CalAIM efforts, ensure CalAIM policy and funding opportunities are effectively leveraged for the benefit of county residents, provide information on CalAIM to the community and to stakeholders, facilitate a learning collaborative to assess outcomes and continuously improve the impact of CalAIM services for our county residents, define how the county's homeless services and system of care can be leveraged and braided with the CalAIM homeless and housing supports, serve as an administrative hub for enhanced care management for the severely mentally ill and substance use disorder populations, implement behavioral health payment reform and documentation reform, and build and maintain a social health information exchange for comprehensive care coordination and data sharing across providers and plans. Next slide, please. In addition to what those efforts are right now, there are going to be some future efforts under CalAIM. The state is still defining what those will look like that we would like to spearhead and be able to help the community to plan for. And these include exploring the county's role in serving foster youth, individuals transitioning out of incarceration, nursing home residents transitioning to the community, individuals eligible for long-term care and at risk of institutionalization, and children with significant medical or mental health needs. So we have a lot of programs that the county already operates in our multiple departments that serve these populations, and we just want to be able to leverage the CalAIM resources to serve them more effectively. And then to plan for the future of CalAIM reforms and initiatives, including but not limited to population health management, for which our public health division is uniquely situated to not only track what's happening with our whole population's health in Sacramento, but then to implement efforts and make recommendations as to how to improve the overall community health. And then the SMI SED is severely emotionally disturbed demonstration project for children that we'll be looking into to see if that's something the county should engage in. Next slide, please. So currently we are proposing multiple board actions that will help give us the tools and resources that we need in order to implement the proposal that I just presented. First, we are asking that the board accept $5 million in grant funding from the Department of Healthcare Services for the what we call BHQIP, Behavioral Health Quality Improvement Program, to support implementation of the behavioral health aspects of CalAIM implementation. So those are the things I talked about, like documentation redesign, medical necessity, changing the criteria, those types of things that are going to be a heavy administrative lift for our behavioral health division. We're asking that the board allow us to enter into revenue contracts with the managed care plans, Aetna, Anthem, HealthNet, and Molina, and you'll notice Kaiser's not on there. Kaiser is actually not contracting with the county for this service at this point. To receive funding for CalAIM related activities. So this would essentially be enhanced care management or community supports that we may be a hub or a pass-through for. We're asking to amend and increase contracts in the amount of $3.41 million with all mental health and substance use providers who have existing contracts with us so that they can provide ECM services to both the SMI and SUD population. So what we're intending to do is leverage our existing partnerships with providers who will now also be providing enhanced care management in addition to the other services they provide on our behalf, such as full service partnerships, for instance. And then adding 10 full-time staff to the DHS to support the development and implementation of CalAIM activities throughout the community. 6 of these staff would be housed in our behavioral health division to do all of the behavioral health related activities, 2 in the administrative division to usher in the new reforms under CalAIM and work with the managed care plans, and then 2 at our primary care clinic to help support high utilizers of healthcare services through enhanced care management. Next slide, please. And I'll just make one comment. We are not currently asking for additional general fund to implement this. We feel this is going to be fully sustainable with the funds that we are able to leverage through managed care and through Medi-Cal and through the grant funding. So our next steps would be to obtain approval on the action items from the board that I presented today, to execute our contracts with the managed care plans and our providers so that we can begin ECM services to the SMI and SUD populations as soon as those contracts are executed. And then for the remainder of this year, we would begin the implementation of other CalAIM initiatives and reforms. And then starting in January 2023, we would implement ECM for the new populations and the new community supports that I've outlined prior. So that is the end of my presentation, and I am happy to take questions.
Siobhan, I guess a question that comes to my mind, I asked this of Ann yesterday, as we see the items on the agenda today, and maybe some of the positions are more easily recruited and filled than others, but when we look at the expansion of some of these efforts or implementation of others, I guess I'm curious, how are we doing as it relates to, workforce? Obviously with COVID, that has its impacts, but generally, are we running high vacancy rates? Do we have good pools to draw from as it relates to professionals and paraprofessionals in these various positions? Because I guess I'm concerned that we appropriate money, we budget positions, and it was alluded to in one of the calls earlier this morning that we have, vacancies in any number of areas. And I guess I'm just curious as to, how you think we're doing, because it's going to rely on, in a lot of cases, not just the provider contracts and they're having the personnel to provide the service, but us as well. So can you give me some insight on that?
Absolutely. Yeah, no, I think that is a very important aspect to look at when we're thinking about not only hiring county staff, but also hiring and contracting with providers to do this work. One of the things I will say is the reason we chose to put the MHSA item prior to the CalAIM item on the agenda is because we recognize that the rate increase and the capacity increase that you approved this morning in MHSA will really help our providers to be able to hire, recruit, and retain staff within the programs to provide the direct services. With regards to county staff, when you look at our vacancies, one of the reasons we have a higher than normal vacancy rate right at this moment is really because we have ramped up efforts so quickly in some of these programs to actually expand, for instance, the wellness crisis call center and response, to actually hire staff. And we are in the process of hiring staff. I think where we're going to have the biggest challenges aren't in things like CalAIM, what I'm proposing here, because these are more administrative positions. Really where we're going to have the challenge is doing the direct service work. So we're seeing a significant concern in our nursing and medical areas. We're seeing significant concerns in our behavioral health areas when it comes to direct service populations, clinicians and counselors to actually go out into the field and do the work. Earlier today, Dr. Quist talked about how we're going to be implementing peer-related efforts. One of the things we really are focusing on is looking at different classifications of staffing that we can bring on. I think we've relied on traditional staffing patterns such as clinicians who are clinically trained. We know that there are peers, that there are paraprofessionals who are really equipped to do the type of work that we want to do, the outreach and engagement to certain harder to serve communities. And those are the folks that we really are going to be focused on getting hired and trained and ensuring they have the necessary tools and resources to do the job. And then you've probably seen a lot of efforts around public health, workforce development, behavioral health workforce development. There are initiatives coming down from the state and locally that we're doing to try to develop a workforce to create a career ladder for folks who want to enter our profession, but maybe need a little bit more education and training to do so. So those are all things we're going to focus on in tandem to be able to address some of the vacancies and concerns we have with staffing. But I feel confident with this proposal that we'll be able to get it up off the ground.
So are there time related issues as it relates to accepting the grant, though, that, if you can fill the positions and deliver the service and ramp up as you've suggested? But I guess, because I said it on the Youth Advisory Board, Mental Health Board on Friday, and heard Dr. Gordon's presentation. I know about the initiative to actually have a career, focus for providers of service in the, behavioral health area. But I guess it still occurs to me that even with all that you said, that in part with the clinicians and so forth, people that actually can provide the service at a certain level, everybody, I say a lot of folks are looking for those very same people to do services both in the private sector as well elsewhere in the public sector. So are we at risk of losing dollars in the event that we aren't able to implement, as you might have suggested?
No, we're not at risk of losing dollars. Like I said, some of the reforms that we're doing or the initiatives are really going to rely on this 10 staff that we're hiring for the county. The contracts that we're going to have with providers, it really is the way the dollars flow is if they provide the service, then they bill us for the service or claim through us, and then we claim. So it's not about we get these dollars and would have to pay them back. It's really more of a traditional healthcare billing in a sense, if you will.
Okay, pay as you go. Okay. All right, very good, thanks. Other questions by board members? See any hands? Do we have callers, Madam Clerk?
Yes, we do.
Okay, let's go to our call line.
Okay, could you please transfer the first caller? Please transfer the caller for item 58. There's one caller in the queue. I do see them. Hi, caller, please start with your comments. You have 3 minutes.
Oh, sure. Let me pause the meeting. I thought I did.
I'm sorry, I can't hear what you said, dear. Hello, can you hear me?
Can you hear me?
Yes.
Sorry, you said you couldn't. Sorry, I had a background. I had the meeting in the background.
Oh, okay. Sorry about that. Yeah, if you could start with your comments, you've got 3 minutes.
Sure. This is just Nikki again. Hi, everybody. Because of the really wonderful advocacy of some people in community, mostly with Sacramento Act and Mike Jasky following this really closely, been able to follow the CalAIM process and have been really, the biggest thing about this for me that I appreciate is that we're finally getting insurance to pay for things that aren't necessarily medical care, but definitely impact people's health. And I can't say how many, medical professionals, physicians that I have spoken to that talk about, oh gosh, if they could just prescribe housing, and how many healthcare barriers, if they could just prescribe transportation, which thanks to some things have been helped with. And I know this CalAIM doesn't address necessarily housing or access to housing, but the idea that you can bill these folks for more than just the medical services is really good to hear. And in terms of job, kind of a lack of ability to place folks in these jobs, I just want to say that Sacramento State has one of the leading social work programs in the state, if not the nation. And so it's concerning. I hope that y'all are doing really targeted, specific outreach out there to make sure that from this community comes the workers who work with this community. And I know that continuing, finding specific healthcare for inside the jail has been difficult. And I just want to say that's going to continue to be difficult because y'all need to release people. This talks about reentry. CalAIM talks about reentry. We're still waiting to see what the county's plan for decarceration and getting people out of the jail and into community safely and with the resources they need is. And we've been waiting for quite some time. We know I could probably go on for 6 more minutes about this, so I'm happy to be cut off. But this idea that there's now money, we can look at this, okay, there's support for folks in reentry. What is the interim public safety and justice agency, Bruce, what's happening to really move towards getting people out of the jail? And we just haven't seen that. And we really need to see that because, right now there's 900% increased COVID numbers from last week from inside the jail. So we need to stop people from getting in, and we need to stop people from getting out. And Callie addresses some of that, but we would like to hear what else you're doing.
Thank you, Nikki, for your comments. All right. Any other callers, Madam Clerk?
No, at this point, we do not have callers, and I will close the public comments.
Okay, thank you. Okay, I'll bring it back to the board then. Further questions or comments? Seeing none, then the motion be in order.
Go ahead and move the item.
Second.
All right, it's been moved and seconded, moved by Cerna, seconded by Kennedy to approve the staff recommendation as outlined. And I trust we will have periodic report backs on this. The handshake your head, yes. So, okay, if nothing further, then I'll call for the vote. Clerk?
Yes, Supervisors Frost,
Aye.
Kennedy,
Aye.
Desmond,
Aye.
Cerna,
Aye.
and Natoli.
Aye.
Unanimous vote. Okay, for item 59, introduce ordinance amending Sacramento County Code Chapter 4.07, banning flavored tobacco sales to any person, waive full reading and continue to January 25th, 2022 for adoption.
Okay, so I understand Supervisor Kennedy, you're going to kick this off. Is that correct?
Yes, Chair, thank you. I have a fairly lengthy statement I'd like to make to kick it off. And I also know that I believe Dr. Cassiere is on the sidelines. If there's any health-related questions, she'll be available for that. Yeah. While California has made great strides in reducing tobacco use remains the #1 preventable cause of premature death and disease in Sacramento and the nation, killing 480,000 Americans annually. Prohibiting the sale of all flavored tobacco products in all tobacco retailers is a critical step that will protect children living in Sacramento from the unrelenting efforts by the tobacco industry to hook them to a deadly addiction. Flavored tobacco products are designed to alter the taste and reduce the harshness of tobacco products so they are more appealing and easy for beginners who are almost always kids. These products are pervasive and are marketed and sold in a variety of kid-friendly flavors. With their colorful packaging and sweet flavors, flavored tobacco products are often hard to distinguish from the candy displays near which they are frequently placed in retail outlets. In California, 9 out of 10 high school tobacco users report using flavored products. Menthol cigarettes increase smoking among youth as well. No other flavored product contributes more to the death and disease caused by tobacco use than menthol cigarettes. Menthol delivers a pleasant, minty taste and imparts a cooling and soothing sensation. These characteristics successfully mask the harshness of tobacco, making it easier for beginning smokers and specifically kids to tolerate smoking. The FDA's Tobacco Products Scientific Advisory Committee has reported that menthol cigarettes increase the number of children who experiment with cigarettes and the number of children who become regular smokers, increasing overall youth smoking. Young people who initiate using menthol cigarettes are more likely to become addicted and become long-term daily smokers. The availability of menthol cigarettes reduces smoke cessation in some populations, especially among Black Americans, and increases the overall prevalence of smoking among Black Americans. Menthol cigarettes are marketed disproportionately to younger smokers and are disproportionately marketed per capita to Black Americans. A 2009 federal law, the Family Smoking Prevention and Tobacco Control Act, prohibited the sale of cigarettes with characterizing flavors other than menthol or tobacco, including candy and fruit flavors. While overall cigarette sales have been declining since the 2009 law, the proportion of smokers using menthol cigarettes, the only remaining flavored cigarette available, has been increasing. Menthol cigarettes comprised 37% of the market in 2019. The overall market for flavored tobacco products is actually growing. In recent years, there has been an explosion of sweet flavored tobacco products, especially e-cigarettes and cigars. These products are available in a wide assortment of flavors like mango, blue raz, pink punch, and mint for e-cigarettes, and chocolate, watermelon, and cherry dynamite for cigars. Tobacco companies are making and marketing deadly and addictive products that look and taste like a new line of flavors from a Ben & Jerry's ice cream store. Flavors are not just a critical part of product design, but are a key marketing ploy for the industry. In 2016, a Surgeon General report on e-cigarettes concluded, e-cigarettes are marketed by promoting flavors and using a wide variety of media channels and approaches that have been used in the past for marketing conventional tobacco products to youth and young adults. The 2019 National Youth Tobacco Survey found that 69.3% of middle and high school students, over 18.2 million youth, had been exposed to e-cigarette advertisements from at least one source. Flavored tobacco products are popular among youth. These sweet products have fueled the popularity of e-cigarettes and cigars among our youth. 8 out of 10 of the kids who have ever used tobacco products started with a flavored product. Across all tobacco products, the data is clear. Flavored tobacco products are overwhelmingly used by youth as a starter product, and preference for flavors declines with age. In California, 8.2% of high school students reported using e-cigarettes. The California Student Tobacco Survey found that an increasing proportion of these youth are using flavored tobacco, 96.2% in 2019-20, up from 86.4% just 2 years prior. Among California's high school e-cigarette users, the most commonly used flavors are fruit, 63.9%, mint or menthol, 14.7%, and candy or sweet, 13%. Youth e-cigarette users are also at risk of smoking cigarettes. It's a 2018 report from the National Academies of Science, Engineering, and Medicine found that there is substantial evidence that e-cigarettes use increases risk of ever using combustible tobacco cigarettes among youth and young adults. In January 2020, the FDA restricted some flavors in cartridge-based e-cigarettes, but exempted all menthol-flavored e-cigarettes and left flavored e-liquids and disposable e-cigarettes widely available in every imaginable flavor. New data show that the market share of these products has grown substantially, and that youth quickly migrated to flavored products that were exempt from the FDA's policy. Among high school e-cigarette users, use of disposable e-cigarettes increased by 1,000% from 2019 to 2020. And in 2020, 37% of high school users of flavored e-cigarettes reported using menthol products. E-cigarette market share data from California confirmed these trends. From February 2020 to June of 2021, disposable e-cigarette sales in California increased by 51.9%. Disposable products are sleek, easily concealed, pre-charged, cheap, some less than $5, and can even have higher nicotine concentrations than even Juul. They are widely sold in kid-friendly flavors like candy and fruit. From February 2020 to June 2021, menthol-flavored e-cigarette sales in California increased by 43.1%. From 226.4 thousand to 324.0 thousand units. And menthol flavored cartridge sales increased by 44%. Tobacco companies have a long history of targeting and marketing flavored tobacco products to Black Americans and our youth. Tobacco industry marketing, often targeted at minority communities, has been instrumental in increasing the use of menthol products in the disproportionate use of menthol products by minority groups and youth. Menthol cigarettes are marketed disproportionately to younger smokers and Black Americans. Dating back to the 1950s, the tobacco industry has targeted these communities with marketing for menthol cigarettes through sponsorship of community and music events, targeting magazine advertising, youthful imagery, and marketing in the retail environment. This targeting continues today. In 2018, California tobacco retailers in neighborhoods with the highest proportion of Black residents were more likely to advertise menthol cigarettes and charged an estimated 25 cents less for Newport cigarettes compared with stores in neighborhoods with the lowest population of Black residents. Nationwide, as a result of this targeting, 85% of Black smokers smoke menthol cigarettes, compared with 29% of white smokers. In 2013, the FDA released a report finding that menthol cigarettes lead to increased smoking initiation among youth and young adults, greater addiction, and decreased success in quitting smoking. Tobacco use is the #1 cause of preventable deaths among Black Americans, claiming 45,000 Black lives every year. Tobacco use is a major contributor to 3 of the leading causes of death among Black Americans: heart disease, cancer, and stroke. The higher rates of some tobacco-caused diseases among Black Americans result in part from their greater use of menthol cigarettes, which are associated with reduced cessation. A study released just this month found that among the Black community, 157,000 smoking-related premature deaths and 1.5 million excess life years between the years 1980 and 2018 can be attributed to menthol cigarettes. The scientific evidence leaves no doubt that menthol cigarettes and other flavored tobacco products increase the number of people, particularly kids, who try the product, become addicted, and die a premature death as a result. In Sacramento County, nearly 90% of our kids who use tobacco report using flavored tobacco products. In Sacramento County, half, or 52%, of current youth cigarette smokers report using menthol cigarettes. In Sacramento County, the vast majority of current youth tobacco users report using a flavored product, with 96.2% using flavored vapes, 78% using flavored hookah, and 75.7% using flavored smokeless tobacco. We've all been touched by this, not just from a personal level, also a financial level for our community. It's costing us great amount of money in order to deal with the repercussions of smoking that is starting with our youth, and they're being targeted by the tobacco industry. I can tell you from a personal standpoint, if you had asked me 11 years ago, did I have anyone in my family with cancer? My answer would have been no. Within 15 months, lung cancer wiped out an entire generation of my family. And they all started when they were young children. So this is personal for a lot of us. And so I would like to ask that the board consider approving this ordinance and for the children in our community and the minority communities that have been so heavily targeted. Thank you, Mr. Chair. I appreciate the time.
Good. Thank you, Patrick. Okay. Do we have a member of the board with the hand up? But was there any more to the presentation, Patrick? Did you say Dr. Kassiri was going to just be available or part of the presentation?
Yes, Dr. Kassiri is available. I believe we have also staff from finance standing by if there's any questions of them.
I see Mr. Lemire and others. Okay, so let me go to
Supervisor Natoli.
Yes.
If I could add that Dr. Kassiri isn't able to be with us today, but Dr. Gail Bronson from Public Health is available to speak if you have questions for her.
Okay, thank you
for being with us, Dr. Brosnan.
Yes, thank you. So let me go to questions. I know we have probably a number of folks that are signed up to speak. We've received a good deal of correspondence, some of as recently as an hour or two ago on this, but let me go to board members. So Supervisor Desmond.
Thank you, Chair Natoli, and I just want to preface my comments. Supervisor Kennedy, I thank you, for your leadership on public health issues. You're a friend, and you're also a leader on these kinds of issues, and I have a great deal of admiration for you because of that. And it's kind of emotional. I just got struck by it. My oldest sister died of lung cancer. Was a smoker for 35 years, and So, I mean, I have no issue with the science and the terrible impact of these tobacco products. And thank you for taking the time to outline all of that. So I really appreciate it. You and I had a chance to talk a little bit, and you know, when it comes to, well, a couple of things. I'm just going to break down a few comments. By first, I want to talk a little bit about our process for, you know, crafting legislation here and implementing legislation, which we're discussing today, and then kind of talk a little bit about my philosophy, which Supervisor Kennedy, you and I spoke about that yesterday. The process, I guess, just starting with that. You know, it's tough. The first time I saw this ordinance was on Friday. And so I didn't have a lot of opportunity to really dig into it and talk to different stakeholders about it. You know, I think we're all used to the legislative at the state capitol, that process. There are so many public opportunities to be heard as legislation winds its way through the process, unless of course it's a budget trailer bill. And that certainly was the case with the underlying state legislation 793. Yeah, here today. So I just want to preface my comments with that, because if I'm not entirely prepared, that's the reason. And I don't know. I know it's a discussion for another day, but I don't know if this board has ever considered forming like a law and legislation, you know, subcommittee. I know we're much smaller than other bodies that do that. But just as a procedural matter, so today we're going to be discussing this matter, but we will not be making a final decision on this, right, until second or third. Okay, so this is not the only chance the public will have an opportunity to provide input, correct, Patrick? Okay, just want to make sure on that. So just from a process perspective, I think it's important to make sure the public knows what we're doing before we do it, especially for something like this that's going to have a great deal of impact. And I ask your indulgence too, because as Supervisor Kennedy, I know he has an awful lot of folks in the unincorporated area, as do I. So a lot of, probably a very large percentage of the businesses that will be impacted by this are in my district. So I just will have a lot of questions about it. First, with respect to my just kind of philosophically, it's tough. We hear people use the term nanny government or paternalistic government. And so I struggle with that a little bit whenever we're making, and I'm not talking about children. I mean, I have no issue with banning these products and being sold to children, which they already are. But when it comes to making these decisions with adults and preventing them from using a product, that's where I struggle a little bit. And I think Supervisor Kennedy, you'll have to help get me there with some of these things. Yeah, I talked to a friend the other day who chews tobacco, and he's an adult. He is a very educated person. He is chews tobacco just infrequently, but he chews the wintergreen tobacco. And he said to me, he said, "Rich, who are you to tell me that I can't use this product anymore?" And I think, Supervisor Kennedy, I think this ordinance would include that. I mean, it would be banned in Sacramento County. Is that accurate?
That's accurate.
And I do get concerned, just as a philosophical matter, that if we start making these decisions on what we should ban in terms of what adults can engage in terms of products or activities that they can engage in, it's kind of a slippery slope. And I don't want to be. I want to be consistent at the very least. I look at alcohol products, for instance, and you can go down the aisle of a grocery store and see a lot of alcohol products that are clearly being marketed to young people because of the flavors, the fruity flavors, and the I guess some of the advertising they have. And then same with cannabis. If you go into a cannabis dispensary, this board's going to be having a decision or having a discussion about changing the county's approach to cannabis legalization. But it certainly strikes me that in those dispensaries, there's a lot of products there as well that feature fruity flavors and catchy marketing schemes that I could see, young people being attracted to as well. So I guess, my first question, Supervisor Kennedy, which you and I discussed a little bit, help me make the distinction between what we're talking about today and some of those products. And You know, I mean, I'll throw that out there and see what you have to say. Help me get past this philosophical, you know, inconsistency that I am concerned about.
That's fair, Supervisor Desmond. And I will tell you that I've been considering this for 7 years. So this isn't something that, you know, I jumped into. It's just, I finally just had enough. First of all, the addictive nature of this is much higher than other products that you mentioned. As far as cannabis, cannabis is highly regulated compared to tobacco. I don't know personally, but I hear that you know, you can't even get into a dispensary, you know, without registering, without showing ID. I mean, so children's access to cannabis is already so regulated that I don't think it's analogous to that. The nanny gate, I mean, the nanny state stuff. Yeah, I struggled with it too, and I will tell you that. But the fact is to me, it's, I mean, the same thing as, and you know, you hear this all the time, but you know, we make people wear helmets when they're riding their motorcycle. We make people wear seatbelts when they're in their cars because of the societal cost, I think, is what finally tipped that legislation. And so I see that this is the same in that category. I look at it.
Thanks for picking two examples that you knew would resonate with me.
Yeah, well,
I appreciate that. The other question I had that someone actually brought up to me is, you know, it's not lost on me that we are, you know, I'm looking outside my office right now downtown, and you know, we're surrounded by a lot of folks suffering from addiction, from really bad substances, methamphetamine, opioids, heroin, out on our streets. And you know, at a time where we're almost not entirely legalizing these things, but we're certainly creating a more permissive environment for some of these. But I know that's a side issue, but it made me think. Someone brought up to me, you know, some of these tobacco products actually help folks who are trying to, you know, kick their addiction to a harder drug, some methamphetamine or some other substance. Has there been any discussion, you know, about that, or do you have any opinion about that, Supervisor Kennedy? In other words, do you think, is there a chance we may be removing a tool for adults, you know, to help make a product available to them that might help them get off a much more harmful drug? I'm curious if that's come up. Honestly, that's not a rhetorical question.
No. It is an argument that is made frequently, but there's no science. There's no scientific basis that these products actually, I mean, there are those who say, well, these particularly vape products help the cessation of smoking of cigarettes. There is no scientific basis that I have seen. And in talking with, you know, those in the industry, I have not seen that is a claim that I have not seen backed up by any scientific basis.
Okay. And then just kind of, you know, and I appreciate your response, and you can understand I'm obviously, you see that I'm struggling with this. Getting into some of the specifics of the ordinance and the state law. So I throw it out there to you is you know, why would this state law, maybe, or SB 793, which passed with actually, you know, pretty good bipartisan support actually at the state legislature. Now it's on hold as a result of the referendum process, but from what I'm hearing, that referendum process is probably going to fail. Why wouldn't we wait and see if that happens before we take any action?
Well, that's a very good question. I asked the advocates the same question, and you know what it came down to. First of all, what this does is this also is consistent, and I made sure that when it was drafted that it was consistent with what the city of Sacramento is doing. So 1/3 of our population is already operating under these rules in the county, at least. But as far as, you know, the way I look at it, Supervisor Desmond, is, first of all, I'm not as confident as you are in the initiative process coming out the way I'd like to see it come out. I mean, tobacco, we know how much money they have, how many resources they have, and we know they're going to come after it in a big way. So, you know, I hope you're right, but I'm not convinced. The other thing is that every day we wait, someone more kids are getting hooked on these. Every day we wait, more people in the African American community are being targeted and becoming hooked. It's just it's to me it's at a level of dire need, and that's why I opted to introduce this rather than wait.
Okay, fair enough. I appreciate that. It's funny when we talk about the city of Sacramento and what the city does. I mean, it occurs to me that it would be a better, from a policy perspective, almost a better approach to mirror what the state law is likely going to be to ensure more consistency. It's funny because I hear from the business community. I know we all received some public comment today that came in today from some business owners who sell some of these products that would be affected. And they're obviously against this ordinance for, they think it'll affect their business. But I actually met with a group of business owners, and this just kind of, this came up in passing, that the state law passed and the county is going to be considering something. I had not seen the ordinance yet. Their bigger concern, I mean, they almost knew it was almost a fait accompli that the state law was going to go into effect. Their bigger concern was consistency, across jurisdictional boundaries, and that's something, when I worked at the Highway Patrol, that was always something we were very cognizant of, is making sure we establish a regulatory framework in the state of California that is consistent, right? So businesses are not navigating patchwork laws, and we experience that in different contexts. But so that's a concern of a lot of businesses that I hear from. They're more concerned. They know that the city of Sacramento has done something that's pretty, I think, pretty restrictive, more restrictive anyway than the state law. Their request to me was, look, if the county supports something, we would ask that it's consistent with state law. Do you have any thoughts on that?
Well, like I said, I mean, to me, and we can just differ on that, because I wanted it to be consistent with the city, because, as you know, the district I represent, you can drive down many streets and you're in city, county, city, county, city, county. So that's why I specifically looked at mirroring this after the city of Sacramento. So
okay. And see, I'm on the other side, where it's they're in the county and they'll be in the city of Citrus Heights and the city of Rancho Cordova. And so, that's a bit of a challenge too. And then, that also kind of leads into a couple other questions that you and I actually, we talked about it a little bit when you and I spoke, is that it seems to me some of the specific, I'm looking at there was a headline in the news clips, and a media headline that we're introduced an ordinance banning candy flavored tobacco sales in Sacramento County. And it really talks mostly about youth. And this, obviously, the city of Sacramento's ordinance, this ordinance we're proposing is much, much broader than that. But I mean, it seemed to me there is some wisdom in some of the exemptions that were created in the state law, specifically with respect to hookahs. That's something that's carved out, because I think that's distinct from some of these vaping products that really are, I agree with you, marketed towards children, and they're a gateway into tobacco products for children. I think hookahs enjoy a distinction, not only in terms of the product itself, but in terms of how they're used. The state law, as you know, also made some exemptions for premium cigar products. So those are things that I wonder, I'd like to have a discussion. Maybe I'd like to hear from some other board members, but maybe have a discussion about some of those exemptions and whether you might be willing to consider implementing one or a couple of those, incorporating any of those into the ordinance that we're going to be considering or discussing more today. So I'll just stop there and wait to hear from some of my other colleagues. Thank you, Supervisor Kennedy.
So if I may, Mr. Chair, just respond to that. So I too was considering a hookah exemption because it's a cultural thing as much as anything. but I did come across some numbers, if I might. A single hookah tobacco smoking session, which is typically 40 to 45 minutes, exposes its users to 25 times the tar, 125 times the smoke, 2.5 times the nicotine, and 10 times the carbon monoxide as compared to a single cigarette. So if we were to go down that route, I just want to get that, have that fully understood.
Thank you.
Before I go to the next supervisor, I just wanted to say, Supervisor Desmond, you, in your earlier comments, you said you thought there was going to be several hearings. What's being proposed today, again, it's entirely up to the board. If this is introduced, it would be the first reading. And then if, as at least recommended in the staff report, would come back to us for adoption on the 25th. So just be aware of that this was at least advertised for consideration as introduction of amendments to the existing tobacco ordinance. So it wasn't just a workshop, and not that you said the workshop, but I just wanted to be aware that if action is taken today in the affirmative, whatever that were to look like, it would be back to us in 2 weeks for adoption unless we chose to do something else. So is that correct, Patrick? That's my understanding.
Yes, I won't speak for Ms. Travis, but yes, this is an ordinance that's being proposed. So first reading would be today. Second reading would be at least 7 days, so 2 weeks with our rules. However, if it were to be substantially changed today, and again, Lisa can address this, then I believe it would have to go through another first reading.
Lisa?
Yes, that's correct. If there's a substantial or substantive changes to this ordinance today, then we would bring it back in 2 weeks for further introduction and then continue it to adoption.
Okay. And then lastly, the way ordinances are done allows for a 30-day implementation, and so become effective unless otherwise specified in the ordinance itself. It would take effect whatever the requirements were 30 days from the time it was ultimately adopted. Is that correct?
Yes, that's correct.
All right. Thanks. Supervisor Desmond, any clarification on that? I just want to be clear because you kind of referenced.
Yeah, no, I appreciate that, Chair Natoli, and I think that's important for the public to understand as well. Yeah. Right. No, that's very helpful, and I'll probably have some additional comments.
Okay, good.
Yeah,
okay,
thank you. Thank you.
Okay, Supervisor Frost.
Thank you, Chair. Let's see, one of the questions I was going to ask about was it be effective, because a lot of the business owners have, purchased inventory, and so it could be have a financial, I'm not sure what kind of financial impact it could have. I did want to ask, my understanding is this is for the unincorporated area only, so it would not pertain to any of the 5 or 7 cities. And I wanted to ask Ben Lemira if he could maybe speak to, or if someone could speak to the financial implications to the county. That was one of the things that we had talked about in the past when we had brought this issue up. And I remember us, I believe we heard something like it was a couple $1 million annually, or maybe that was what Sacramento City was potentially going to lose. So thanks for being here, Ben.
Ben Lemira, Director of Finance. And in answer to the question is that city did say when they passed their ordinance, they were estimating about a $2 million loss in sales tax revenue associated with tobacco products. We're not able to verify that was a $2 million loss to them. And it's a very tough thing to estimate because there's other tobacco products that are wrapped amongst the tobacco sales. And from what we were able to see in some of their, at least in their financial statements, we weren't able to see an impact of the loss in revenue. And that was, I think we looked back at just their last CAFR, and we couldn't tell that there was actually a loss in revenues associated with the ban. It's a tough number to estimate. Like I said, the flavored tobacco is wrapped amongst the other tobacco products.
Okay, thank you. So I wanted to say that I did receive calls and visits from the Indian community regarding the hookah. Some of the, some of the, they shared with me about the rich culture and tradition and how this is something that has been a part of their culture for over 100 years. And so that, and I guess there's hookah bars. I've never been to one, but we have hookah bars, which potentially we would be shutting down businesses, which is, so that I'm concerned about. But the other thing that comes to my mind is the idea of some of the businesses are within 5 or 15 minutes from a border, to another county or city that does have flavored vaping, which bears the question, is this something that you just, punish your local business people? They can't sell it, but someone 5 minutes away can, or someone who lives in a neighborhood and has a convenient place they go close by, to get the flavored vaping, which is helping them, kick a 20-year habit on cigarettes. But they have to now drive to Placer County to get their vaping cigarettes. I'm not a smoker, so whatever they call it. But the point I'm making is it doesn't solve the problem. I'm concerned about if it solves the problem, which I think Supervisor Desmond's point about doing it, doing at the state level, at least it's consistent across the board and fair to every business, and we're not punishing businesses that are in close proximity to other competition. The other thing that that occurs to me, and that was the conversation that we had a long time ago around why not, use some of those revenues that we have on some of these products to do a better job enforcing the laws that are already in place, or maybe even have the laws be so strict, like if they sell it, if they get caught selling it to kids, they lose their license to, their license is revoked and they have a $10,000 fine, instead of up to $10,000, we just revoke their license if they get caught selling it to children. I don't want children to get on cigarettes, and I want people who are smoking and trying to get off cigarettes. I don't think it's fair to, I guess, try to insert myself into their decision about their life and their health. I think that's an individual decision. So those are some of the things I understand what I respect your priorities, Supervisor Kennedy, of thinking of people's health. And I'd be interested. I have also received a lot of letters from the business community and also some communications from the Indian community around the hookah, and also those who are actually vapors, adult vapors, who actually feel like for the first time in years, they may have a shot at getting off of cigarettes. And then we ask ourselves, we have cigarettes and we have marijuana, we have alcohol, and we have all these other things that you can get addicted to, but we're picking this one thing. So those are some of the thoughts that come to my mind, and I'm going to look forward to hearing from public comment, what they bring to share with us about their thoughts.
Okay, thank you, Supervisor Frost. Supervisor Cerna.
Thank you, Mr. Chair. Well, I guess I should never take for granted what I might think is going to be a slam dunk for this board. You know, I guess I come from this from a pretty simple distillation of what I fundamentally believe our responsibilities are as elected members of this board. And it's something that we practice very, very regularly. In fact, no more so than in the last 22 months. And that is to a large extent to set policy, to make decisions, thoughtful decisions that are vested in the charge to protect public health. To me, you know, whether you want to call it a no-brainer or low-hanging fruit, if you think about the fact that more than 1 out of every 4th death from cancer in California comes from smoking, and then you cross-check that against our own personal experiences, I don't believe there's a single person on this board that hasn't been touched in one way very intimately about or from someone dear to them either being sick or passing from cancer. Supervisor Kennedy mentioned his experience, as did Supervisor Desmond. You know, I lost 3 of my parents within 7 years from the disease, and it's little known. It's little known, but my late father was a smoker, not an aggressive smoker, very early in his adulthood for about 10 years. So was my biological mother. Whether or not that was attributable to that time in their life, I'm not a doctor and I've not been told that, but nonetheless, it does tie me to being a family member close to someone who's died from it. If you think about what we do in terms of not just you know, the analogies to traffic safety that were mentioned earlier, but you know, some of the things that we institutionalize as a county in terms of our practice to protect public health, whether it be all the infrastructure that we have set in motion long before COVID to keep communicable disease in check. This to me is part and parcel of that general charge in terms of being good stewards of ensuring threats are kept at a minimum to keep our constituents healthy. And let's be clear, this is not an outright ban. It's not like the individual that wants to kick cigarettes can't switch to vaping. They can. They're just going to have to vape a tobacco flavor. You know, again, I don't see this at all as being distinct in any way from some of the other decisions that we've made, you know, decades ago, in fact, to keep our constituents healthy and disease-free. The economic arguments, I can appreciate that. I can understand it, but I don't feel, speaking for myself, that I've been elected to this post to let you know, the economics of this supersede the fact that if we can keep adults and especially young people from even beginning the habit of smoking or tobacco use in general, you know, we have fulfilled our responsibility. And, you know, I appreciate obviously the great thought that Supervisor Desmond has given this, and I always appreciate the fact that he's seems to keep an open mind and wants to hear from both sides of this, of most if not all, policy debates that have been in front of him since his election to this board. But in terms of attempting to join my colleague Supervisor Kennedy to try and convince Supervisor Desmond or Supervisor Frost of why this does constitute good public policy and why this is needed, I would simply ask you to dig deep and reflect on the charge that we have to advance what is good, appropriate, and healthy for the constituents that we serve. That's why I'm very supportive of this. I'm not, quite frankly, interested in negotiating to the bottom a watered down version of it. I think there's a lot to be said for consistency when it comes to a prospective policy like this in the county when it's already been adopted by our largest sister jurisdiction in the city of Sacramento. And again, it's not an outright ban. It simply, for me, just will make it a little more difficult for people to poison themselves and to begin on the path of addiction that the statistics tell us more often than not are going to lead to lung disease, cancer, emphysema. And so I'll just leave it at that. I'm eager to hear from the public.
Thank you, Supervisor Serna. Supervisor Kennedy.
Yes, thank you. And thank you for that, Supervisor Serna. I just, a couple of things that did come up. There was a 2020 Surgeon General report that on smoking cessation that says, and I'll quote, "There's presently inadequate evidence to conclude that e-cigarettes in general increase smoking cessation. In fact, there are a lot of products on the market that are not smoke-based to help people quit smoking already. So I just, that's not a compelling argument to me. And also, as far as the costs, the societal costs are well known and well documented of smoking and what it does. Approximately $13.3 billion in healthcare costs each year in the state, including $3.6 billion in Medi-Cal expenditures. The policy, this would lead to substantial savings over the long term. The state will save approximately $11,000 in long-term healthcare costs for every smoker who quits because of a policy like this, and at least $21,000 for every youth who is prevented from smoking. So if you're going to dollars and cents it, there is an argument to be made there as well. Thank you, Chair.
You bet. Okay, thank you, Supervisor Kennedy. With that, then I think we have a number of folks that have signed up to speak to this. I know we received a good deal of correspondence. I wanted to ask one question though about the ordinance. Does it change the spacing requirements between tobacco retailers as a part of this?
I don't believe that it does. It only affects the type of products being sold.
Okay, so there's no changes in, because we've had an ordinance on the books now for, gosh, 25, 30 years, different elements to it, but it does not. So the only thing it affects is the type of product that either is allowed or prohibited in, Lisa, is that correct?
Correct, yes.
Okay. All right, thank you. Okay, Flo, I'm going to turn to you to help manage the calls.
Yes, sir. Please transfer the first caller.
How many do we have, Flo?
We have about 29, maybe even 30 callers in queue.
Okay, before we start, I've been allowing 3 minutes today, and it's seemed people a little less rushed. But if you can be succinct, recognizing we're now approaching 5 o'clock, and with that, we'd be at 6:30 before we concluded the calls potentially. So try to be concise. Obviously, get your point across. We will still allow for 3 minutes, and then bring it back to the board once we've concluded the public testimony. So, okay, thank you. Flo, go ahead.
Okay. Hi, caller. Please start with your comments. You have, please start with your comments.
Okay. Hi, my name is Angel, and I am an advocacy and training intern at the Sacramento LGBT Community Center and a resident of District 1. Our center took an early support position on this ordinance and asked that the Board of Supervisors vote in favor of ending the sale of flavored tobacco products in Sacramento County. At the center, we support and provide health and other services for LGBT youth and communities in need. Research shows that LGBT communities are nearly twice as likely to smoke e-cigarettes than their cisgender counterparts, due in large part to targeted advertising in LGBT press and other industry tactics. Big Tobacco preys on our youth and communities of color with kid-friendly candy and minty menthol flavors. Ending the sale of these products in Sacramento County will make it that much harder for tobacco companies to hook more youth onto tobacco and suffer lifetime addictions to nicotine. Tobacco companies have spent millions in our state to continue pushing their products. You can help break the cycle in Sacramento County. We ask that you pass this important ordinance and end Big Tobacco's profit off community health.
Thank you, Joel.
Okay, please send the next caller.
Supervisor Kennedy, do you have a question or a comment? I see your hand up. Okay.
Sorry about that.
Okay.
Hi, caller. Please start with your comments. You have 3 minutes.
Good afternoon, Sacramento County Board of Supervisors. My name is Rima Corey. I'm General Counsel for Fumari, which is a premium hookah tobacco manufacturer, and I'm also one of the founding members of the National Hookah Community Association, which was founded to protect and preserve the rich 1,000-year cultural tradition of hookah. First and foremost, we as an association represent Middle Easterners, Afghans, Turks, Indians, North Africans, Armenians, Indians. I mean, this association really does give a voice to a lot of these minority communities that celebrate and use hookah in social events, celebratory events. It is really a centerpiece for social engagement, especially for Muslims who don't drink. This is how they bond. And, hookah is not the problem with youth. Hookah use amongst youth is one of the lowest of all the tobacco products. It is a very unique tobacco product. It cannot be used with other devices such as vape. It can't be chewed or rolled or used in other pipes like bongs. Hookah tobacco is only used in a hookah. Hookahs are generally 3 feet tall. They are very difficult to conceal. Kids aren't hiding them in their backpack and pocket and smoking them at school. They take about 20 to 30 minutes to set up. So, kids aren't sneaking them into school and smoking them in the bathroom. It just takes way too long. Recess would be done before then. And of course, they're not being confiscated at schools. Hookah is one of the least used tobacco products by youth, according to the CDC. And the FDA agrees that although there's a correlation between flavors and youth initiation of tobacco products, that they do not see the same correlation with youth usage because of its low prevalence. So here we have a cultural tradition, not an issue with youth, and it will be banned if this passes without a hookah exemption because hookah tobacco only comes in flavors. So therefore, it would be a de facto ban on this rich cultural tradition. So before we solve a problem that doesn't exist, please understand the facts. We ask that you please consider this and that you exempt hookah like it's exempted in the SB 793, the California State Flavored Tobacco Ban, along with premium cigars over $12 and loose leaf tobacco, because all of these items are not traditionally used by youth. So please don't let our cultural tradition become collateral damage. This would be an unintended consequence. We expect our lawmakers to understand the difference and to give consideration to all the minority communities that will be disproportionately impacted by such legislation. Please take a moment to understand what that impact would be. We appreciate your time and consideration. Thank you very much.
Thank you. Okay, next caller.
Please send the next caller. Hi, caller. Please start with your comments. You have 3 minutes.
All right. Good evening, Mayor and council members. My name is Jessica Garcia. I am a resident of District 3 and I'm finishing up my final year at Sacramento State. I just want to start off by thanking the council for their work on this ordinance. This is such a great step in creating a safer and healthier Sacramento for youth and young adults. The tobacco industry has intentionally marketed their candy flavored products to lure minorities and young adults for decades. Flavors like dulce de leche, churro, and tamarindo are just a couple of examples of popular candy in the Latino community that have been transformed into tobacco flavors by the tobacco industry. These products were made with the intention of gaining youth and young adult users, not adults. Consequently, e-cigarettes, which are offered in over 15,000 flavors, are now the most used tobacco products among Hispanic and Latino high school students. As a young Latina, it is concerning to me that my community members, my community continues to be targeted by the tobacco industry as a direct result is being negatively affected by disproportionate burden of disease and death. I urge you to protect the lives and future of our youth, young adults by approving this ordinance to prohibit the sale of flavored tobacco. Thank you.
Thanks. Jessica, before you hang up, if you're still there, what did you say some of the flavors? Did you say the churro? Yeah, churro flavored?
The person hung up the phone.
Yeah, okay, that's fine. Okay.
I know one of them was tamarindo, which is a tropical fruit.
Okay, tamarind. Okay, got it. I wasn't able to. I was trying to write it down here. So thanks, Phil. Okay, next caller.
Please send the next caller. Can someone send the next caller? I think the feed must have cut off for everyone, and then they jumped back in. So sorry about that.
Okay.
Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Good afternoon. My name is Jim Knox. I'm a Sacramento resident and the director of the American Cancer Society's advocacy work in California and Hawaii. And we urge you to adopt the comprehensive ordinance before you as is, without any exemptions. We know that tobacco kills more people than alcohol, drugs, guns, car accidents combined. We know that the tobacco industry's use of flavored products is what's driving the youth vaping epidemic and is the basis for its ongoing practice of predatory marketing of menthol in communities of color. And we know that the history of the tobacco industry shows that they will exploit any loopholes or exemptions left open to them. And that's why it's critical that the board follow the lead of the city and align with its comprehensive policy of prohibiting the sale of all flavored tobacco products with no exemptions. And to be clear, the state law is designed to be a floor, not a ceiling. Local governments can, should, and always have been able to adopt tobacco control measures stronger than those set out in state law. And in fact, it's the only reason why California has the strongest tobacco control laws in the world. And that is because local jurisdictions in California adopted them first. And their lead was followed by the state, and then other states, and then the nation, and then other nations. So we urge you to adopt this measure in its strongest form, and we thank you for your consideration and leadership.
Thank you, Jim.
Please send the next caller. Hi, caller. Please start with your comments. You have 3 minutes.
Yes, hi. My name is Dalbir Chahal. I'm a retailer in Supervisor Natoli's District 3. I'm also representing Store Owner Association, APCA. I would like to thank Supervisor Desmond and Supervisor Frost for their thoughtful comments. I'm requesting Board of Supervisors not to proceed with this ban since statewide flavor ban is already going to be on the ballot this year. you should let voters decide if they want to ban any flavored tobacco or not. Not waiting till November 2022 is a voter suppression, makes the whole BOS look like bad regardless of the topic. I also want to remind you that the 30-day sell-off is not sufficient as the retail businesses are really slow and struggling financially due to COVID. Supervisor Frost was asking a question like what finances we are talking about. Throwing away the unsold inventory would be a financial loss for a retailer, especially for the 30 days. 30-day sell-off is too little to sell the existing inventory unless county want to buy inventory from us back, And Supervisor Kennedy was talking about that he did everything to match this to the Sacramento City, but even Sacramento City gave us 6 months to sell the existing inventory. Also, menthol cigarettes and chewing tobacco has nothing to do with the candy flavors or kids. So menthol and chewing tobacco should be excluded from this ban. I think that young children are more getting hooked on to the flavored marijuana than to the flavored cigarettes. So that should also be considered. Cigarette is not that harmful as you guys think. And the last thing I would like to ask to Supervisor Kennedy, that he's talking about children's getting hands on the tobacco product. I mean, we are responsible store owners. Where those children are getting that tobacco? I mean, is it just a political agenda to push this ban? I mean, or are there any numbers? Sacramento County did any research, like how many retailers got caught selling those products to the children? That would be my question for Supervisor Kennedy. So at the end, I would request you guys not to proceed with this ban. Let voters decide in this ballot what they want to do with the flavored tobacco. Thank you.
Okay, next caller, please.
Please send the next caller. Hi, caller. Please start with your comments. You have 3 minutes. Could you
Hello.
could you mute the meeting in the background?
Yes, I can.
Okay, thank you so much. And then you can start with your comments. You have three minutes.
Hello, supervisors. My name is Twyla Laster. I'm the project director of the Soul Project. However, today I am making public comment on my own time. As a resident and constituent of Supervisor Cerna's district, as a resident, I strongly encourage you to restrict the sale of menthol and all flavored smoking products with no exemptions for menthol nor hookah. Hookah is not a safe alternative to smoking. In fact, hookah contains many toxins that can cause the same issues as smoking other products. You've encountered pushback from hookah lobbyists and business establishments with claims that because using hookah is a cultural practice, flavored hookah tobacco should be exempt from other flavored tobacco sales restrictions. Thus, while all tobacco retailers would be restricted from selling flavored products, hookah lounges and retailers would continue to sell. Recent data indicates that hookah use is not unique to any community or culture, and that its use is becoming increasingly common and addicting among youth and young people, mainly from different backgrounds. The 5 hookah lounges in this county with their nightclub atmosphere have nothing to do with Middle Eastern culture and everything to do with increasing profits from disease and potential death of young people. CDC facts were misquoted by the second caller this evening. The CDC website clearly states that hookah use has been on the rise over the past 2 years from use by high school students and college students. Supervisor Natoli asked about flavors. There are apple, cane mint, papaya, queen of sex, mango, peach, on and on. And so in the midst of COVID, there's nothing more important than getting these products out of our community. Smokers are more susceptible for with COVID infections. Therefore, menthol and all flavored products, which specifically includes little cigars, cigarillos, hookah products, cigarettes, vape products, and all electronic smoking devices, must be restricted from sales to protect the health and well-being of all Sacramento County residents. Thank you for your consideration. This concludes my public comment.
Thank you, Ms. Lassiter. Okay, next caller, please.
Next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Hello, members of the board. My name is Amanda Simpson, and I am a policy analyst with the Sierra Club's Environmental Justice in Tobacco Control Project, which focuses on tobacco product waste. Like many of my colleagues have already emphasized, flavored tobacco products are driving a youth vaping epidemic. According to the 2021 National Youth Tobacco Survey, 85% of youth cigarette users use flavored products. Menthol, in particular, is reported as the most popular flavor. I would also like to draw your attention to the fact that tobacco product waste is toxic and dangerous. E-cigarette waste, in particular, contains lead, mercury, heavy metals, plastics, battery acid, flammable lithium batteries, and nicotine, which is listed as an acute hazardous waste by the EPA. In fact, nicotine that the ingestion of as little as 2 cigarette filters is enough to poison a family pet. As you might expect, e-cigarettes cannot simply be thrown in the garbage. You should also know that under federal hazardous waste law, schools, not the tobacco industry, are bearing the financial and administrative burden of properly disposing of these toxic and dangerous products. With that, thank you, members of the board, for prioritizing the health of our youth, pets, and the environment.
Thank you, Amanda.
Can you please send the next caller? Hi, caller, please start with your comments. You have 3 minutes.
Good evening, County Board Supervisors and staff. My name is Paramajit Khera, and I'm a retailer in Carmichael, and also I'm a board member of APCA Association. My another friend just called Dalveer Chahal. I agree with him on everything. And my concern is I am opposing on ban of a flavored tobacco. First of all, ban of a tobacco in Sacramento County will not solve the problem. Basically, like Sacramento City ban it, I think we have not get any survey what they gain out of it. Did everybody stop, smoking flavored tobacco in Sacramento County? Basically, it's going to shift from our county to different city and our neighbor counties. And our all the retailers now is we have a good cash registers, and we are very responsible retailers. And it's not our mission to sell to the minors. We have our own kids. We don't want any kids to be smoking. We just want to be just want to share our things with this. Like Roseville decide to ban on tobacco, and they send the survey out there, send the decoys out there to see how many retailers they get busted. They get 0. So they stop it. They say, well, if we don't have, the retailer is not the problem. So most of the people buy it, the adult passing to them, or they buy online. So, and also I just want to mention is if the bill is passed, then we need more than 30 days. Definitely Sacramento County gave us 6 months. It was good enough. And if we look at 6 months, we are very close to the November 2022, where is that referendum comes. So my request to you guys is please just hold this bill till at least November 2022. And thank you very much.
Thank you, Barbie.
Next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Thank you, Madam Clerk.
Good afternoon, board. My name is Alex Winston. I'm here with Parents Against Vaping E-Cigarettes, also known as PAVE, which is a national grassroots organization founded by parents in response to the youth vaping epidemic. I'd like to take a moment to thank Supervisor Kennedy for sharing the staggering statistics regarding this issue that illustrate my family's story. In 2017, my son started vaping menthol nicotine products at his high school, and he still does 3 years later at age 18. My husband, who was trying to quit, was vaping menthol and died at age 42 of a severe heart arrhythmia with 500 milligram levels of unregulated nicotine in his system, leaving me a single mother of 4 kids. E-cigarettes are not a cessation device. My husband was mixed race, Black and Native American, 2 of the highest risk populations to suffer from tobacco-related health disparities and the predatory marketing of menthol products by the tobacco industry. His life mattered. Please vote in favor of the proposed flavored tobacco product ordinance, including hookah, menthol, and e-cigarettes. No person, business, or government should profit off of people's lives. We were too late for my son, who is already addicted, and for my husband, who is no longer with us. Let us not be too late for the next generation. Thank you for your time.
Thank you, Alex, for sharing. Okay.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Good evening, Chair Natoli and Sacramento Board of Supervisors. My name is Kimberly Bankston Lee, and I'm the Senior Program Director with the Soul Project. I'm sorry for your losses from tobacco-related deaths. I share that too with you in losing my mom to smoking. I'd also like to acknowledge the difficult time that we're all going through as a result of the variant outbreak of COVID-19, and I hope that your families are safe and healthy. Smoking is most likely associated with getting sicker with COVID-19. People who smoke are nearly 2.5 times more likely to get really sick, like admitted to an intensive care unit, needing mechanical ventilation or dying compared to those who do not smoke. In Sacramento County, 20 to 30% of African Americans, as well as people living at or below poverty, smoke, and most started before the age of 18. 8 out of 10 African American smokers smoke menthols. This is true for both adult and youth smokers. Flavored tobacco, including the very first flavor menthol, is appealing to youth because it numbs the throat, which disguises the harmful effects of smoking. And over half of youth smokers use menthol cigarettes. Menthol is also an anesthetic. Comprehensive policies that protect youth, the poor, and African Americans, and really all communities, include prohibiting the sale of all flavored tobacco and vape products, including the flavor menthol, and including flavored shisha tobacco used in hookah pipes. There's community support in Sacramento for this kind of policy. In a public opinion poll conducted by the Soul Project, 67% of African Americans support restricting the sale of flavored tobacco. And comprehensive policies reverse the discrimination inflicted by the tobacco industry, not cause it. The industry lures the Black community by placing cheap flavored products in our neighborhoods and uses the Middle Eastern, Indian, and other communities by suggesting flavored shisha, not regular tobacco, is part of the culture when it is not. It wasn't until the 90s companies started adding fruit flavors. Then it exploded over the world and became very popular. The cultural tradition is pure tobacco, not flavored shisha. The industry is simply using Black and all these other cultures to fill their pockets. Thank you.
Thank you, Kimberly.
Thank you.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, my name is Isam Jwainat, and my wife and I have been smoke shop owners since 2008. I want to thank you, the board, first of all, for your time. I know you guys have been on since about 9:30, so I know it's probably very tiring for you right now, and we're all having a hard time thinking. But I want to ask that you not proceed with this ban. Item number 59, since a statewide flavor ban is already going to be in effect and on the ballot, in 2022. I also want to remind you guys that, we've all been impacted, including yourselves, and we've been slower and struggling financially due to COVID. My wife and my kids and myself currently suffer from anxiety induced by the past couple of years from dealing with COVID. And to put this on us right now, and not just us, and everybody in general is a lot. And for us to having to clear our inventory in such a short amount of time would really just affect us mentally, physically, and emotionally. We need ample time to adhere to these guidelines that you guys are trying to put into effect. And studies have shown. There's a study that's been shown, and numbers have come out from the San Francisco ban that has been in effect for a few years now, that numbers in vaping among youth has actually risen since the vaping ban has been in effect. So how does that make sense? We do our jobs as shop owners, as adults, as humans, and as people that are empathetic and sympathetic to other individuals to make sure that these products do not get in the hands of children. We've been in business, again, like I said, since 2008, and not once have I ever received a letter other than saying that we've done a good job by not selling to a minor, and we've never sold to any minors in our record in our time of doing business. So we're doing our part. The job that comes down to the parents teaching their kids what's right from wrong, what's wrong from right. We're all adults too at the same time, and there's adults that like things. I'm an adult. I like ice cream. I like Skittles. Can I go get that? Yeah, I can go get that. But you guys have to understand that we are all adults and we have a right to choose. We should be able to choose. That's why we live in America. That's why these people that you're hearing from India and Middle Easterners, they come here because there's an opportunity that they didn't have back home. I think there's a bigger problem that's going on, honestly. And if you look at the numbers and if you look at there are more deaths and more illnesses among youth from diabetes, from kids going into any store that they want, pulling anything off the shelf without an adult that says chocolate, Reese's Pieces, sweet and sour, all this stuff that is causing our kids to get sick. And when it comes to COVID, one of the biggest things they say, for example, that affects these kids is obesity, is unhealthiness. Let's focus on that. The ban is going to come, you guys, it's going to be on the ballot for 2022. Let it play out. Let us have ample time to make sure things work out right. Thank you.
Thank you for your call. Okay.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Good evening, supervisors. My name is Marissa Greenband, and I'm the Director of Tobacco Control Projects at Breathe California, Sacramento region. We're a local nonprofit agency. Tobacco use remains the single most preventable cause of disease and death in the U.S., and I want to remind you that this puts this product in a category of its own when it comes to the considerations of policy and public health. While public health advocates have made decades of progress in reducing the burden of tobacco products on our communities, Big Tobacco has fought to continue making a profit by enticing new users with addictive flavored tobacco products. Tobacco products, including vaping and hookah products, are being marketed to our community members under the veil of enticing flavors that mimic fruits and even candy. The tobacco industry and public health advocates alike know that these flavors have been marketed to youth in particular, even mint and menthol flavored products. There is some misconception around menthol not being a youth flavor, but youth are not exempt from the attractive qualities of this flavor and the way it covers the harshness of tobacco. Over half of youth who smoke cigarettes smoke menthols, and mint and menthol flavors are among the most popular in vapes used by youth. Similar to vaping products, the tobacco industry has co-opted the use of hookah too, commercializing hookah use and incorporating flavors to entice youth users to this highly addictive product. In the U.S., nearly 80% of youth hookah users report using hookah because it comes in flavors that they like. I also want to note that hookah is primarily used by young adults aged 18 to 29 years in California, and the Hispanic Latino population makes up the largest proportion of young adult hookah users at 54%. In addition, over 9% of high school students report ever using hookah. Before I conclude my public comment, I want to recognize the youth advocates that work with Breathe, as well as multiple partner agencies who were not able to make the call in time today with school and extracurriculars. But ahead of this meeting, they sent to your offices 278 postcards via mail about their concerns around flavored tobacco in the community. You might have also seen the digital billboard that one of Breathe's groups ran in the month of December on Business 80 near Fulton Avenue, which called attention to the fact that nearly 90% of Sac County youth who use tobacco report using a flavored product. And if you missed it, you can find it on Breathe's Instagram page to check that out. Thank you, supervisors, for hearing our comments this evening.
Thank you for your comments and for referencing some of the work that the young people did to communicate their concerns. Thank you.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Good afternoon, good evening. My name is Chris Hudgens. Appreciate your time today. I know it's been a long day, so I appreciate you hearing all these comments. Excuse me. I'm with the National Hookah Community Association. I want to talk about hookah a little bit further. You've heard a lot of statistics and different points made, but I think the important thing to focus on is hookah is not a issue for youth abuse. The FDA and CDC do an annual survey about youth use of tobacco, and hookah is consistently one of the smallest categories, the lowest categories, coming in around 2%. For comparison's sake, vape is up around 20%. There's many reasons why it's not often used by youth. Part of it is logistical and challenges. A hookah is several feet tall. It's not something that is easily lit or carried around in a backpack. It is the only way to smoke hookah. And additionally, hookah is generally sold in tobacco specialty stops or lounges, places that require of age verification. And in fact, the hookah community completely supports strengthening policies to prevent youth access. We supported that at the state level with SB 793, making it harder for youth to enter places where hookah may be available. And we believe that the county should mirror SB 793 with the same exemption and the same protections to prevent youth access. It's also important to remember that many of the folks and business owners who use and sell hookah are immigrants or minority groups, and that all hookah is flavored. So a ban on hookah in Sacramento County means that the hookah lounges there are going to close, and those lounges verify age before individuals come in and take steps to prevent youth access to the product, and we fully support that. So I think we need to consider all of these, the possible outcomes of this. Fully supportive of preventing youth access to hookah, but you have to balance that with taking responsible steps not to close immigrant and minority-owned businesses, and mirror what the state has done with SB 793. Thank you.
Thank you, Ms. Hutchins. Okay, next caller.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
First, I'd like to thank Chair Natoli and the entire board of supervisors for hearing this very critical ban on the matter on our agenda. My name is Ryan McClinton. I'm a lifetime resident of Sacramento, Sacramento County, a public health advocate, a community organizer. But today I'm here with the Campaign for Tobacco-Free Kids to support this ban. The reason why I'm calling for this particular ban is because it connects to me on a personal level. As a son, I've watched my dad battle the addiction of nicotine, seeing how much he'd rather not be on it. He currently is in his 4th round of being smoke-free for 5 years, and my stepmom as well joined him in that battle. The reality is that so many of the smokers that we're talking about and the folks who would use these flavored tobacco products, and yes, my dad started with menthol and eventually has tried other vaping products once they became available. However, what I found talking to so many smokers is that they would rather not be in that battle, and they definitely don't want to see their kids in that battle. We're having a lot of discussion around what the impact is on our youth and the access to youth. Yes, that needs to be the focal point, but we also need to take account for the people who are currently hurting right now. Our county took an aggressive approach, one that I'm grateful for, to say that racism is a public health crisis. What does that mean in policies? It means that when we have policies that are causing poisonous outcomes to our communities, we're seeing our infant mortality rates being impacted, we're seeing our Black communities being harmed, our Latino communities being harmed by tobacco products in them at affordable rates where we don't have quality food access, where we don't have quality produce. When I'm talking to a lot of these store owners who are calling in, who are saying that this ban would hurt their business and hurt their constituents, why aren't those same store owners providing better health outcomes, better health opportunities for their clients? There was a caller who talked about kids grabbing candy and chocolate and sweets off of the counters, yet you sell those same products in your smoke shops. So I don't understand how we're prioritizing wellness when we're seriously arguing about keeping harmful products in our county. We have an opportunity as a board, as a county, to represent how do we start restoring the health outcomes that have been ravaging our communities for so long? How do we make the smart investments to make sure that we don't have more stories like what Supervisor Kennedy and Supervisor Cerna and Supervisor Desmond have shared about their own personal battles that they've seen and the impacts of nicotine usage and addiction? This is our opportunity to make that right. This is our opportunity to live into the policy that says racism is a public health crisis and change those outcomes going forward. I urge you to strongly consider supporting this ban and making sure that we don't allow this cancer to continue working its way through our communities. Thank you for your time.
Thank you, Ryan. Next caller.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Great. Hi, my name is Dr. Kylie Avison, and I'm a Sacramento area pediatrician. I'm in full support of a comprehensive policy restricting the sale of flavored tobacco products. As has been well demonstrated, flavored tobacco products differentially affect our pediatric population and our communities of color. I recall a specific instance in which I cared for a teenage patient who was hospitalized for something we call E-Valley. E-Valley stands for e-cigarette or vaping associated lung injury. And E-Valley is just that. It's injurious. It's a serious and sometimes fatal lung disease that is directly linked to vaping and e-cigarettes. My patient, like 80% of E-Valley cases, was young. Before coming into the hospital, she was a normal, healthy teenager. But on arrival, she was coughing up blood and could barely breathe. She was hospitalized for over a week and luckily was able to return home. But in over a quarter of cases, our patients end up on ventilators. And 2% of the time, these patients will die. E-Valley is a completely preventable disease, and deaths due to E-Valley are completely preventable deaths. So here we have a product directly linked to the death of young people, and that same product is preferentially marketed to our young populations under the guise of fun flavors. As a pediatrician, the answer is clear. We must ban the sale of flavored tobacco products to keep our children and our community safe. Thank you.
Thank you, Dr. Fay.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. This is Ann Delcourt. I am the founder of the Anti-Vaping Alliance in Sacramento and a member of Parents Against Vaping Electronic Cigarettes. A flavored tobacco ban can prevent thousands of people, especially teens, from initiating tobacco use. My journey in advocacy for stronger tobacco laws began in March of 2019 on the early side of the teen vaping epidemic. As a parent volunteer at Rio Americano High School, I worked closely with the counselors and the administration. That spring, they became overwhelmed by students who were vaping, congregating in the bathrooms, meeting up in cars to share devices and flavored tobacco, even vaping in the classrooms. noting often that the vapor smelled like candy, and teachers had a very difficult time identifying who was vaping. The devices are so discreet. Administrators became overwhelmed with confiscating the flavored tobacco bottles and the devices, often suspending students. 100% of the tobacco confiscated was flavored tobacco. Vaping had become a major distraction to education. So we decided to address the issue head on, and I started the Anti-Vaping Alliance, a group of students, parents, administrators, and health experts. We've worked hard over the years to educate our community about the dangers of flavored tobacco and the effect of nicotine on the adolescent brain. We've spoken at multiple meetings and advocated at the state capitol. It's a quiet, discreet epidemic designed to attract and addict the young. And nicotine is a toxin that actually changes teens' brain cell activity. And these changes can be permanent. Please ban the flavored tobacco and help protect the brains and the health of our teens.
Thank you, Anna.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Okay, thank you. Good evening, supervisors. My name is Tom Nelson. I am a vice president of the 3rd District PTA. The 3rd District PTA represents parents and school communities of Sacramento County and 7 other local counties. We are one of the county's largest child advocacy associations. Our executive board is in strong support of this ordinance. We believe ending the sale of candy-flavored tobacco products in Sacramento County is critical in combating early youth addiction to tobacco products. These candy-flavored products are merchandise damaging the health of our children. Ending the sale of these dangerous, kid-friendly flavors is critical to protecting the health of our children. Please take action to stop tobacco companies from endangering our children. On behalf of the 3rd District PTA Executive Board, we ask that you vote in favor of this ordinance to protect our children. I want to say I appreciate the discussion I heard, and to use a few words from the U.S. Constitution, we appreciate you giving priority of governance to the to promote the general welfare to ourselves and our posterity instead of economic interests. Thank you.
Thank you, Tom. Okay, next caller.
Next caller, please. We have probably around 17 callers, and it's hovering at this number currently. Hi, caller, please start with your comments. You have 3 minutes.
Hi, my name is Dr. Lena Vanderlist, and I'm a community pediatrician here in Sacramento, and I'm representing the American Academy of Pediatrics Northern California chapter. I think that I am in strong support of this ordinance banning flavored tobacco in Sacramento County. We know that flavors hook kids. 4 out of 5 minors, like Spence stated before, say that they started on a flavored product. Just in my office last month, I saw a teenage boy who came in and said he started vaping and didn't even know that there was nicotine in vapes. And he just started using it because there were fun flavors and it was a fun thing to do with his friends. And soon he found himself having to go to the bathroom and use the vape throughout the day. I think this is an excellent example of how flavors are the things that draw kids and teens in, and then they're stuck with a nicotine addiction for the rest of their life. And we know how horrible tobacco addiction is, and cigarette smoke and other tobacco products are for healthcare down the line. And so that's why I strongly support this ordinance in banning flavored tobacco in Sacramento.
Thank you, Doctor.
Thanks.
Okay, next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Good afternoon. I'm Dr. Philip Gardner. I'm one of the co-chairs of the African American Tobacco Control Leadership Council, and I'm recently retired from the University of California Office of the President of Tobacco-Related Disease Research Program. I want to thank you all for having this today and calling on you to pass the strongest ordinance possible. We can't wait on the state. Every day that we wait to implement restrictions on flavors, more kids take it up and more folks of color die from it. It's unfortunate that I've heard, people putting forward that this is a 1,000-year-old tradition in the Middle East. Let's just be honest and frank that it was European colonialism that introduced tobacco to the Middle East only some 300 to 400 years ago. And then, as has also been pointed out by other people, that actually Islam frowns upon this, and then to add insult to injury, the majority of people dying in North Africa and the Middle East, and unfortunately in the United States, in California, and in the county of Sacramento, are folks dying of tobacco-related diseases. It has been mentioned, I want to repeat it, that 793 should be seen as a floor, not a ceiling, and that each county has the ability to take extra steps to protect the health and welfare of their clients, of their citizens. And I want to call on you to do the same thing. A lot of times when we talk about the costs associated with this, what is left out often is the question of healthcare costs that will go down, hospitalizations that will go down, or emergency room visits that will go down. And not to mention that people that use smoking devices during the time of COVID-19 just exacerbates the overall health crisis that we face. Let me give a shout out to Supervisor Kennedy. Supervisor Kennedy, I'm a doctor of public health, and I thought you made the case very well for why we should do this. It isn't a question of saving tobacco industry or hookah industry profits. It's about saving young lives and saving Black lives. With that, I've written you a letter that you've all received. Some of you responded. I hope you do the right thing. Follow the lead of Sacramento. Thank you very much for your time.
Thank you, Dr. Carter.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Good evening, supervisors. My name is Sue Taranishi.
Hi, Sue.
I am calling as a board member of Brief California, Sacramento region. Our mission is clean air and healthy lungs. I'm a resident of District 2. Thank you, Supervisor Kennedy, for your statement and all the data. And I just urge your support of this ordinance. And I think you've heard many, many comments, and I know it's late, but I think a couple of the main things that I just wanted to stress that 80% of the kids who use tobacco started with a flavored product, and 90% of Sacramento County kids who use tobacco report using a flavored product. So as guardians of public health, I would urge your support of this ordinance to hopefully stop many of our youth from starting to use tobacco and just protect our public health. Thank you.
Thank you, Sue.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Good evening, supervisors. I'm Lindsay Freitas, a resident of Sacramento County in Supervisor Desmond's district and advocacy director for the Campaign for Tobacco-Free Kids. I'm also representing the Greater Sacramento Smoke and Tobacco-Free Coalition, comprised of local community groups and community members working to create smoke and tobacco-free communities in Sacramento County. I am here in strong support of a comprehensive policy to end the sale of all flavored tobacco products in the Sacramento County, including e-cigarettes, menthol cigarettes, and flavored shisha tobacco, as the policy is drafted without exemption. Prohibiting the sale of all flavored tobacco products in all tobacco retailers is a critical step that will help protect children living in Sacramento County from the unrelenting efforts of the tobacco industry to hook them to a deadly addiction.
Flavored tobacco products are designed to alter the taste and reduce the harshness of tobacco products so they're more appealing and easy for beginners who are almost always kids. These products are pervasive and are marketed and sold in a variety of kid-friendly flavors. With their colorful packaging and sweet flavors, flavored products are often hard to distinguish from the candy displays near which they're frequently placed in retail outlets. Past economic studies have shown that reducing tobacco sales in a community will actually create new jobs and improve the community's economy. Researchers estimate that since most of the money spent on tobacco products is actually exported outside of our community to manufacturers and farmers out in other states, prohibiting the sale of flavored tobacco products statewide would return money to the state through new economic activity, creating a net increase of 3,322 jobs and $580 million in economic activity. Furthermore, in a survey of hookah lounges in the city of Sacramento before and after the implementation of that policy, we see that these hookah lounges simply did not close. They switched from using flavored tobacco shisha to non-nicotine shisha and continue to operate. In California, 9 out of 10 high school tobacco users report using a flavored product. And I ask for the council to end the sale of all flavored products. Thank you.
Thank you, Lindsay.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, my name is Camille Boudreau, and I'm here on behalf of the Sacramento County Young Democrats. Thank you for this opportunity to speak in support of this comprehensive ordinance. The evidence is clear. Candy-flavored tobacco products are making it easier for kids to become addicted to nicotine early. 90% of kids in our county using tobacco are using flavored products. Big Tobacco directly targets youth and communities of color to get them hooked on tobacco products. They know hiding dangerous and addictive nicotine products behind flavors like sour apple, minty menthol are a sure way to get our communities addicted early and addicted forever. A comprehensive law prohibiting the sale of these kid-friendly products is the best way to put an end to this predatory practices of Big Tobacco here in Sacramento County. This is a public health issue that isn't going away unless we take critical steps to protect our community. I ask that the board please vote in favor of this important ordinance. Thank you.
Thank you for your comments.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Yes, thank you. My name is Miss Wilmore, and I'm speaking on behalf of my family. I'm also a public health retiree, and I'm just so excited that Sacramento County is considering this very important policy. Let's do the right thing. Sacramento County has a golden opportunity today to make public health history. With more than 350,000 youth in your county, it's time to do the right thing and consider a policy that would prohibit flavored tobacco products, including menthol and hookah, to protect our kids. Their lives literally depend on it. I love visiting Sacramento County. It's such a beautiful area, and it's also named after a river, which represents to me the continuous flow of life. Unfortunately, the tobacco industry needs new customers, and we all know how easily flavors entice kids to smoke, like using flavors like unicorn poop. As I reflect on my 32-year public health career, I wonder, what new product is going to be next? This is personal for me, as I lost my dad due to smoking at age 49. He started at age 9. I have a sense of urgency for protecting all of our youth in the state of California. Sacramento County has a great track record for protecting its citizens, and you are no stranger in protecting disenfranchised populations such as foster care youth and African Americans. The county has received some really great notable national awards for your Sacramento County Black Child Health Legacy Campaign, which is aimed at reducing deaths among African American children by 10 to 20%. So what you've already done in your county totally complements what you're doing and considering today. So we need to do the right thing. As we all know, with COVID-19 has had a tremendous life impact on all of us. 4 out of 5 teens, according to tobaccofreecalifornia.com, who vape, 4 out of 5 teens who vape use flavors, and teens who vape are 5 to 7 times more likely to test positive for COVID-19. We have a pandemic with COVID-19, and we have an epidemic regarding flavored tobacco products. Today's action can go a long way in protecting the public's health as well as preventing our youth from having a lifelong addiction to tobacco products. Thank you, and I really appreciate the opportunity to provide public comment.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi there, supervisors. My name is Mark Strow, and I am a retailer in Sacramento. I just want to point out that this ban will not stop youth vaping or smoking. What it will do is reduce staff in our businesses. It will also push sales outside of Sacramento County. So we operate in other counties, and when the city of Sacramento passed their smoking ban, we benefited by having the customers in the area coming to us. This will make it so the youth will be able to get their tobacco from the internet, illegal markets, illegal people on the street, and other places in the other cities and counties in the neighboring areas. Please do not let us lose our staffs because we cannot have the business that we had before. There is the vote coming up in November, as we've been talking about. Please wait on this flavor ban. Please vote no on the flavor ban. Thank you.
Thank you, Mark.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Good evening, Chairman and members of the Board of Supervisors. My name is Jaime Rojas with the National Association of Tobacco Outlets, the trade group representing most of the retailers in Sacramento County. Many of our member retailers in Sacramento County are unable to attend tonight's board meeting. Our retailers have not had the opportunity to speak on the issue to county staff and to many of the supervisors on finding alternative solutions to youth vaping usage. The county did not outreach to our retail stores about this meeting or have scheduled a retailer workshop to discuss alternatives, options, and work with the business community prior to considering any ordinance, like the cities of Sacramento and San Jose did with their retailer community. The county's retailers are exemplary in keeping tobacco products out of the hands of underage persons. According to the FDA in the state of California, county retailers have a near perfect 93% compliance record by refusing to sell to anyone underage. Why would the county want to harm responsible retailers and chase their customers to other jurisdictions or to illicit markets? Our retailers do not sell tamarindo, churro, burro, unicorn poop, or any other absurd flavors because of the limited floor space for tobacco products. These crazy flavors are sold online. It is already illegal to sell to anyone under the age of 21. Let's focus on code enforcement investments since it's already illegal to sell to anyone under the age of 21. The issue is compliance, and the county should consider increasing penalties and even taking away tobacco retail licenses for those not following local, state, and federal rules and regulations. A recent study on the San Francisco flavor ban from Yale University with the funding of the FDA shows that the flavor ban in San Francisco does not work and has caused youth usage to instead use traditional combustible cigarettes instead. Flavor bans do not work. We urge the county to pull the agenda item tonight and schedule it once all stakeholders have been considered prior to impacting businesses on an ordinance that has not worked in other California cities. Let's consider simple options and considerations by the county like stiffer penalties, loss of tobacco license after a second offense that 7-Eleven retailers already use, mandatory electronic age verification systems, cost effective. Focus on the issue of vaping flavors only. Or as Supervisors Desmond and Frost stated, let's wait for the referendum and the voters to pass a statewide flavor ban. We thank you for consideration.
Thank you for your call. For your comments on behalf of the association. Okay, next caller.
Hi, caller. Please start with your comments.
Hello, can you hear me? Yep. Yep.
Yeah, you
Sorry.
have three. Hello. You have 3 minutes to start with your comments. Please start.
Hello, good evening, Council. Thank you for all your patience and listening to everybody's comments that are happening for such a long period of time. My name is George Johnson. I'm a founding member of the National Hookah Community Association. I also manufacture traditional wooden hookah pipes called Regal hookahs. I wanted to make a few comments on masil and shisha tobacco has been preserved in honey and molasses for centuries, thus making hookah masil, or the way it's produced, a flavored product. So, Councilmember Cerna, it is a de facto ban on hookah. Double apple has been around for over 2 centuries. Zaglul and Jurak have been around for over 300 years. If you look up Doka, has been around since the 15th century. So, you know, I go to Egypt and I've enjoyed smoking shisha in like El Fishawi hookah lounge. It's older than the United States as a country. And so to prevent people from existing businesses to continue to do what they're doing, I mean, it's sad. And a caller had mentioned that, you know, Sacramento City hookah lounges haven't closed because they're using alternatives. I want to warn against some of the consequences of the unknown, these unintended consequences like non-synthetic nicotines, non-FDA approved tobaccos. You know, tobacco has to go through PMTAs, pre-market and testing authorization, with the federal government. And so we're in compliance with all these rules that we're providing a safe product. And if we open up Pandora's box to all these alternatives, it's going to be, you know, there's going to be some, you know, unintended consequences here. Also, I'm just wanting to urge everybody to exempt hookah using the language of SB 793 because it prevents it from being sold in gas stations, liquor stores, 7-Elevens. It pertains only to 21 and over establishments, thus taking away this marketing argument that everybody seems to make, that we're marketing to children. We're not. It's been over 50 years since there's been a tobacco advertisement on television. It's been over 20-something years since there's been a print media, you know, with tobacco products. We don't have bright colored images on our packaging for hookah tobacco. So, you know, if children are not allowed in those establishments, they can't see it. So there is no real marketing that way. Also, 30 days is not enough time for these small minority-owned businesses to purge their inventory. I mean, many of these people are personal guarantors on their leases. Should they default on their lease obligations, they get a bankruptcy on their credit filing. You know, they could lose their homes. So I want to thank everybody for all the talk, and I hope that you guys can follow the state's exemptions, mirror the language, 21 and over establishments, save traditional hookah. Thank you for your time.
Thank you, George. Okay.
Next caller, please.
What do we have in the queue still, Madam Clerk?
We have about 12 to 13.
Okay.
Can you guys send the next caller? Did we lose contact? Can you guys hear me? Okay, hi caller, please start with your comments. You have 3 minutes.
Good evening. My name is Neve, and I am asking you to please exempt hookah from this flavor ban. Today, we know what the issue is. Vaping has become a major problem amongst teens. Why do we have to target minority-owned businesses? Why can we not give these businesses a chance to survive and implement the same regulations as marijuana dispensaries? Through my love for hookah, I have met and become friends with people from all different types of backgrounds. I would never think to ask any of my Muslim friends to meet up at a bar for drinks. That is not the type of environment they would like to be in. Hookah lounges are our safe place to meet up and enjoy a night out. We also occasionally meet up at each other's houses and enjoy dinner followed by tea and hookah. If this ban was enacted, I would no longer be able to go to adult-only smoke shops to pick up shisha, and I would not be able to meet up with my friends at an adult-only hookah lounge. Shisha is sold in gas stations or supermarkets like all other tobacco products. This ban would have a devastating effect on lounges and instantly force them to shut down. I would also like to add that there were some false claims made by other commenters tonight. My community doesn't appreciate certain callers telling lies about our own traditions from people that clearly haven't gotten the chance to experience our beautiful culture and haven't done honest research. I hope we can all come together and find a safe and common ground that protects our youth, but doesn't target my people that have been so viciously persecuted in the past. Thank you. Please exempt hookah.
Thank you, caller. Comments?
Next caller, please. Hi caller, please start with your comments, and you have 3 minutes.
Thank you. Good evening, County Board of Supervisors. My name is Nolan Spence. Thank you for the opportunity to speak tonight. Please mirror the rhetoric in California Senate Bill SR 793 and provide a cultural exemption for hookah. Gavin Newsom has stated that hookah is not the problem in our classrooms. Hookah is an important cultural tradition for many minority groups in our community. I am a woodworker that collaborates with an artisan hookah manufacturer. Not only has the hookah community provided me gainful employment, but also it has exposed me to people from different cultures and backgrounds I might never have had the opportunity to meet. In addition, lawfully operating businesses are the best line of defense in eliminating youth access to tobacco. We should consider 21 and up and only establishments for tobacco sales, and perhaps use some of the same precautions that weed dispensaries use, with multiple layers of age verification and security. I'm a fan of better enforcement of already existing laws instead of pushing consumers to online and black market sources. In conclusion, please consider this culture with the respect it deserves and exempt hookah. Thank you so much.
Thank you, Mr. Spence. Next caller.
Next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Hello, my name is Erica Costa. Good evening, supervisors. I'm the advocacy director for the American Lung Association in California, the leading public health organization fighting to reduce and prevent lung disease. I'm here to express our support for the passage of an ordinance in Sacramento County that restricts the sale of all flavored tobacco products. Each year in California, nearly 40,000 adults die from smoking-related causes, and over 12,000 kids become new daily smokers. According to the U.S. Surgeon General, tobacco companies have a long history of using flavored tobacco products to entice new, younger customers. In fact, 8 out of 10 youth smokers report that they initiated tobacco use with a flavored tobacco product, and that the younger a person is, the more likely they will be to use a flavored product. There is no evidence that shows the aerosol emitted by e-cigarettes is safe for non-users to inhale. What we do know is that these products are especially enticing to youth who have begun using at an alarming rate. E-cigarette use among middle and high school students is higher than that of traditional tobacco products by those populations, but effective policies to restrict the sale of these products can curb that trend. In addition to targeting of youth, we also know that the flavor of menthol is commonly used to target communities of color. The American Lung Association urges the board to prohibit the sale of these products and to save the lives of its residents and prevent youth in the county from becoming lifelong tobacco users. Thank you so much for your time.
Thank you, Eric.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. My name is Brian Hecox. I am a small business owner here in Sacramento. I'm a constituent of Supervisor Desmond in Carmichael. I wanted to start by saying that I am not big tobacco. I am a small business owner operating a shoestring budget to keep stock levels for my customers and to pay my employees. There was a call earlier that mentioned EVALI as a scourge of vaping, and that is completely false. The CDC and the FDA both acknowledge that EVALI was the result of illicit THC cartridges being made in people's basements using vitamin E as a substitute to fill cartridges. It had nothing to do with professional e-cigarette use. There are some studies that have shown that in San Francisco, the ban on flavored vaping products is not only not deterring youth smoking rates, but also increasing. The Science Direct Addiction Behavior Reports, published in July 2021, was a peer-reviewed study that showed an increase of 35% among youth 18 to 24 in San Francisco in the year following the ban. Another peer-reviewed study showed that was published in August 2021 in the American Journal of Public Health, showed that policy that had the intention of reducing e-cigarette use unfortunately had the unintended consequence of increasing youth smoking rates. They compared San Francisco with its flavor ban to other jurisdictions in like populaces that did not, and found that youth smoking and youth vaping had actually decreased in those places without flavor bans. This is a disastrous policy that is going to not only serve to not help the public health here in Sacramento, but it's also going to hurt our local economy. There are well over 300 specialty retailers in Sacramento that operate with these flavored tobacco products. Mine among, I don't carry Kratom, I don't carry cigarettes, I don't have tertiary products. I focus exclusively on helping one smoker at a time walk away from tar, from carcinogens, from 25,000 additives, and get them into vaping where they can still obtain their nicotine and do it safely. And specialty retailers here in Sacramento have shown time and time again that they are good actors. The California Department of Public Health's own statistics on youth and straw purchase stings show that among 312 sting operations, only 311 passed with flying colors. Only one wasn't, and it wasn't a specialty retailer. The issue with youth access to vaping products in Sacramento is not happening in vape shops. It's not happening in hookah lounges. It's happening at gas stations where they can walk in without having to be ID'd first, and it's happening online where they can purchase products with someone else's credit card. You are looking at shutting down over 300 businesses with 1,500 employees, and you are looking at disenfranchising tens of thousands of vapors in the local Sacramento market. The MSA, the Master Settlement Agreement, shows that we have a financial benefit in shutting down vaping because it pushes people back to smoking, which yields more money. Sacramento County alone has received $304.7 million to date from the MSA, $15.7 million just last year. That money's not going to enforcement. That money's not going to help these people that are suffering from cigarettes. My own mom died at 35 years old, 3 days after my 14th birthday, from smoking. She didn't have access to flavors. Youth initiation of tobacco products is nothing new. Shutting down flavored vaping will not help the public. It's only going to force them to go to other places to get it. It's only going to force people back to deadly cigarettes. This is a disastrous policy, and I ask you, please reconsider what you guys are doing. Thank you.
Thank you very much for your comments.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Good evening, supervisors. My name is Eliza Tong, and I'm a professor of medicine at UC Davis Health. I'm here tonight as a private citizen in Supervisor Natoli's district, and my views do not represent those of the University of California. As a physician and a native of Sacramento, I am in strong support of a policy for unincorporated Sacramento County to restrict the sale of flavored tobacco products, including menthol cigarettes and without exemptions. Doctors and nurses are working hard to help our community with COVID infections, but people who smoke are among those at greatest risk for getting sicker with COVID. The Surgeon General has concluded that smoking worsens lung health and weakens the immune system. And before the COVID pandemic, we were already dealing with 2 vaping epidemics, with the rise in youth use and also with lung injury, both of which are still ongoing. This policy can help us in this fight to keep our community healthier. A strong policy can also encourage people to quit. When the City of Sacramento policy went into effect in 2020, I had an African American patient in the hospital tell me that her mother and brother told her they all finally needed to try to quit their menthol cigarettes together. We need a policy for the county to help people like my patient and her whole family quit flavors and quit for good. Using flavored tobacco products, whether or not they are vaped or smoked, is not approved by the Food and Drug Administration for smoking cessation. When I grew up in Sacramento, I remember kids bringing candy cigarettes to school, cartoon characters like Joe Cool making smoking fun, and cool menthol cigarettes lying around the house. Fortunately, I also grew up in a time when that social norm changed, when leaders in Sacramento and the rest of California started implementing strong policies to protect me as a child. More than ever, we need your leadership in Sacramento to help us improve our local environment and set standards for a healthier community. I am happy to work more with you to make our Sacramento County the healthiest in the nation. Thank you.
Thank you, Ms. Tong.
Next caller. Hi, caller. Please start with your comments. You have 3 minutes. Can you also mute the meeting in the background while you're talking?
Oh, yes, of course.
Okay, thank you so much. And then you have 3 minutes.
Okay, thank you. I appreciate taking the time. My name is Taylor. Being a smoker of cigarettes for over 22 years, because of vaping, I haven't touched a cigarette in over 3 years. Health benefits, my overall life has just changed for the better dramatically. And, you know, having lost loved ones, family members to lung cancer, I wish they had vaping when they were smokers, because I honestly believe they would still be with me to this day. And I purchase all of my vaping in Sac County and all the smoke shops I go to. You know, I'm 36 years old. I still get carded. So I know there's speculation of underage selling. I have never seen that before. And honestly, every smoke shop owner around is, you know, they're saving lives. They really are. It's a amazing substitute to nicotine, to cigarettes, and you know, it's dramatically changed my life. But listening to everything so far, I understand that it is on the ballot for November, and being a business owner myself, I know how difficult it is inventory-wise, and I would highly recommend everyone to just vote on giving them ample time, you know, to go ahead and maneuver all the material they have, all of their, you know, all their stock, everything like that. But overall, I can just tell you that vaping has saved me, and I owe everything to that. My life right now, it's so much better because of it. So I appreciate the time very, very much, and thank you very much.
Thank you for your comments, Taylor.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Thank you. Hello, my name is Ansh. Thank you for taking my call. I am against this ban. I would like to request to let voters decide during November 22 ballot. If you still decide to go ahead with this ban, please, I request, Give us at least 6 months to clear our inventory. Thank you for your time.
Okay, next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Sure. Hi, my name is Neha. I'm also a smoke shop owner in Sacramento County. I'm calling to vote against this because the reasons this is not just affecting against the ban specifically, because this is going to affect a lot of business owners out here. The reason I understand that young kids are getting access to vape and vape products, just banning it in Sacramento County might not just resolve it. Kids can go different places, and nowadays they normally have access to this products around the area. And so I don't think just banning it in Sacramento County itself will help. So looking at this, I would like to vote against the ban. Thank you.
Thank you for your comments, caller.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Yes, my name is Ashok Desai. I'm calling from the Orangeville Smoke Shop. I am opposing the ban, flavor ban, is item number 59. So if you want, then just wait up to November 22 referendum, and then you can decide it after that what you want to do it. And if you want to do it, then give me at least 9 months to 1 year, then we can rid of our inventory. And Sacramento County, they ban, but what about the nearest cities? We live in Orangeville, our store in Orangeville, and Citrus side is open. So customer get there within 2 and 5 minutes. So what's the meaning? It's a health issue, only they live in a Sacramento County. So what about the citrus sites? So please, I'm opposing the ban, item number 59.
Thank you.
Thank you.
Thank you for your comments.
Okay, next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, my name is Tim Gibbs with the Campaign for Tobacco-Free Kids. I'm also a constituent in District 2. I wanted to highlight who is actually funding the opposition to this ordinance. Flavored tobacco policies have been coming up in California for some time now, and the big tobacco companies like R.J. Reynolds, Philip Morris, and Juul have collectively spent nearly $60 million opposing flavored tobacco policies just in California, and that's only since 2017. That is an obscene amount of money. But make no mistake, this industry is committed and, dare I say, desperate to keep candy, fruit, mint, and menthol-flavored tobacco products on the shelves. They need to replace the tobacco users that die using the products. We've been hearing a lot from the opposition about just waiting until the referendum. That is precisely what the tobacco companies consider a win. Their tactic is delay, delay, delay. Every day we wait to end the sale of flavored tobacco products in Sacramento County is another day the tobacco companies are able to hook more kids in vulnerable communities. As to the referendum that the opponents keep referencing, it only exists because the tobacco companies spent $20 million to qualify it. They were spending upwards of $8 a signature. They're going to spend whatever it takes to try and defeat the referendum to ensure candy-flavored tobacco stays on the shelves. If we want to protect Sacramento youth, we're asking you to pass this policy as is today. One other thing I wanted to address is that this ordinance in no way would ban hookah. It only prohibits the sale of flavored shisha tobacco. There are hookah lounges that still operate in the city of Sacramento. They're continuing to operate despite the Sacramento law that passed in 2019. They just don't have flavored shisha tobacco in their hookah pipes. I also wanted to address the study in San Francisco that the opposition keeps referencing. That study is fatally flawed because the data collection took place before the ordinance even went into effect. It has been thoroughly debunked, but has not stopped Big Tobacco and their allies from referencing it. I urge Sacramento County to side with the trusted organizations who make up our coalition and against the opposition whose reportable funding has been 100% from the big tobacco companies. Thank you.
Okay, next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Hi, my name is Mohammed Askar. I oppose this ban for the flavored tobacco.
Okay. Thank you.
Next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Good evening, Board of Supervisors. My name is Vanessa Lopez. I am a 17-year-old senior in high school and a resident in District 4. I am a representative from my school student government class and heard about this ordinance and felt compelled to call in on behalf of the youth community in Sacramento County. There are 2 main points I would like to address. First being that the arguments from retailers are justified, but not in the aspect that they are not the issue. While it may be true that they are not directly selling to youth, they are the source of it. I can say without a doubt that at least 90% of youth who obtain tobacco products at my school get their supplies from 21+ individuals who willingly and legally are able to purchase these flavored tobacco products, and I doubt it is any different at other schools around our community. Again, I would like to emphasize, while merchants may not be directly selling to youth, they are the source of it. I know this because I am the youth you are allowing to be victimized by these products. Secondly, I am appalled that the argument made by a few supervisors and callers is that the money Sacramento County is going to lose seems to be more important than my health and the health of my generation. I personally have seen peers and friends of mine become victims of these flavored tobacco products, and I can say with a broken heart and tears in my eyes that I fear it may already be too late for them. So I plead to you to approve this ordinance with no exemptions. Thank you.
Thank you, Vanessa.
Okay, next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Hi, yes, my name is Heather Molina, and I was born and raised in Sacramento. I've been an avid cigarette smoker for about over a decade, and I've tried everything to quit. I've tried the Nicorette gum and the patches, everything, and I just want to say the vaping is the only thing that has worked for me. I was able to quit cigarettes. I've been cigarette-free for over a year now, and I just want people like me to be able to express that this stuff has helped us and has, given us something other than cigarettes to get away from that. Because I've had a grandfather that's passed away from cancer, so I know how it is. And I believe it helps a lot if there's choices out there, different things to help quit, because not everything's going to work for every person. Not one thing's going to work for every person. Sometimes we need something different. And I think vaping for the certain people that can't do the gum, can't do the patches, that don't work, has really helped us in that sense. And I just want to thank you for your time, and thank you. I know you guys have been on here for a long time. I appreciate it, and I hope you really hear our voices out there. So thank you so much.
Thank you for calling, Heather. Okay,
Next caller, please.
How are we doing on numbers? What do we have now?
I think we have about a couple more callers to go.
Okay, all right, very good.
Caller, please start with your comments. You have 3 minutes.
Thank you. My name is Ralph Proper, and I'm on the board of Breathe California Sacramento region. I'm a biochemist with a master's in public health. I worked over 30 years at the Air Resources Board as an air pollution research specialist, focusing on cancer-causing chemicals and how to eliminate them from our air. As a result, the research that I authored before I retired a few years ago showed that there were close to 1 million lives saved as a result. However, I want to add that tobacco causes more deaths, not from cancer, but more from cardiovascular disease, heart attacks and so forth, and strokes. This isn't generally known because cardiovascular disease is so much more common than cancer, and whereas maybe a quarter of lung cancer deaths are from smoking, that's not true for heart disease. Why does this matter? Well, one reason it matters is that the death toll from smoking is far higher than thought. I've also heard comments about vaping being better, and it is possibly true that it doesn't have some of the carcinogens in it that cause cancer. However, it still has the nicotine, which is a probable cause of the great increase in cardiovascular deaths from smoking. So that doesn't really help in the long run. So speaking for the Breathe California Sacramento region, I want to add how important this is, that we not get children hooked, and the flavored products is what really does it for them. So for all these reasons, I think it's important for us to pass this ordinance. Thank you very much.
Thank you, Ralph.
And next caller, please. Next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
No problem. My name is Manny. I am a UCD alumni, and I have been in the retail industry for 10 plus years. And I'm not going to touch the issue of violation of personal freedom and too much overlooked by the city on this matter of vaping. But I would request that we are given ample time to consider us ways to liquidate our inventory. And because it's very hard times right now with the COVID shutdowns and everything, we're already in a time of economic hardships. And I would request board members, the city council, if they will go through with this, we will wholeheartedly comply with what the fine people of the city and the board council people want. But I would request that we get at least maybe hopefully a year to liquidate our inventory. And I would like to also add that city does reforms and take measures to actually curb the black market, which this ban will create on the vaping, because people will find ways, especially through online and friend-to-friend sales, out-of-state sales, and that will be all that I would want to add. Let's not ban it, give the people the freedom to choose, but if you guys do decide it, at least give us the time to liquidate our inventory, and please take some reforms and measures to counteract the black market that it will create, because we will lose a lot of tax revenue based on that. Because as a retailer, majority of our sales is going towards vaping. That's what the public wants, and we are paying a lot of sales tax. We're contributing to a lot of sales tax being paid. So give us the chance to liquidate our inventory and take measures to stop the black market after you guys do decide to take it. Thank you very much.
Thank you, Manny, for your comments.
Thank you, sir.
Next caller, please. Hi, caller, please start with your comments. You have 3 minutes.
Although I don't agree with this ban, I'm just asking that you guys give us time, at least till January of next year, to clear out our inventory and allow menthols, as that is a FDA allowed item.
Thank you.
Okay, thank you.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
I'm on there. Hello, everybody on the board. I know you guys are there for so many hours and it must be really tiring. I am a teacher by profession and I've been in a smoke shop business for the last 18 years of my life, unfortunately. When this opportunity came with the e-cigarettes, I was so fascinated that now I had an opportunity to make people quit. And I swear I have made so many people quit, thanks to the Lord. Now, all those people that I have made quit and all those people who are in the process of quitting, what happens with the flavor ban? I know flavor helps them to quit because it is tasty. Who does not like tasty products? So I have helped so many people get on there, and now all this is going to reverse. All my efforts that I have put into this has going to go to waste. As far as you're saying that kids are getting addicted to this, no, we do not sell to kids. We card every damn person who comes to the store. And sometimes I have parents who come and say they are regular cigarette buying ladies, and when they come to buy a flavor or something, I ask them, why are you buying this? I'm buying this for my kid because he would rather go and do meth. I don't want him to do that. So I rather give him this. This is what parents here in America are saying, unfortunately. And we don't sell to such parents. I don't mind losing such customers. But this is something really ridiculous. If we want to do it, let us do it for the whole damn country, the whole state, not just for one county. Because we are going to get deprived of our business. They'll go to other places and buy. They'll go to other cities, Citrus Heights, here, there, they'll buy online. Ban online. Ban the whole country from every flavor that you can, sir. I would be supporting it if you do it without any loopholes. Not where we are creating loopholes. We are creating a black market for the kids to go and buy whatever they want, wherever at double the prices. Don't do that, sir, please. You want to do it? Please do it the right way. Don't keep any loopholes there. Ban it, but ban it all the way through. I really, really urge you to do this. Because otherwise, unfortunately, we are going from the frying pan to the fire. This is not helping us in any way. This is not helping us, sir. This is really not going to help us. I'm sorry I have to say this, but my heart burns to think that this is happening now at such a point in this COVID time where we are dying, we are sinking, and all this is going to happen to us. That too with no time for the inventory to be sold off. All our effort to help people quit is going to go in vain. I have so many customers who have quit, so many. And most of my customers were people who smoked for 40 to 45 years of their life. I have made them quit. I have monitored them. Please help me, sir. Please don't let this ban go like this. Let them vote for it, or you want to do it all the way. Do it all the way. Federally do it. Just stop it. Stop it completely, where they cannot get access to anything anywhere. Please, sir. Thank you. I'm sorry to be so upset.
Okay, no, thank you for your call. Appreciate your comments.
Okay, next caller, please. And also, Chairperson, we have about 5 more or 6 more callers in queue now. Hi, caller. Please start with your comments. You have 3 minutes.
Hi. I just want to say hi to the board and thank you for taking the time to listen to us. My name is Hassan Chaudhry, and I'm a owner of a small business in Sacramento County. And I strongly believe that we store owners are the first in line of defense against selling to minors. And me personally, I can't speak for anybody's store, but in our stores, we have a couple of them in the county of Sacramento. We have never, ever, ever sold to a minor, nor have we ever allowed adults to buy from minors. I have never been cited by the Sacramento County that I've sold to a minor, and I've been in business for over 10 years. And it is very unfair to take that away from us. And I hear all these callers calling, stating that they're professional doctors, or they're this or that. We are hearing students calling in. Like, how can we confirm that any of these callers that are calling are actually professionals and they have done their study? And how do we know all these students are getting extra credit just to call in, just to make up some stuff? You know what I mean? Like, I really hope that all of our voices are heard and our voices matter. And I would like for you guys to push this ban further back, not because so we can make extra profit, just because we're actually struggling just like everybody else to make ends meet. And if we're in with all this inventory, what are we supposed to do with it? We can't sell it to anybody. That's a loss to our pocket, to our families, we're not able to provide food for our families. I know there's a lot of people, or my people, predominantly the Indians or the Punjabis, the Pakistanis, they would love to call in and give their part of the story, but they can't because of the language barrier, and they cannot say all that they want to. And a lot of us were afraid to even publicly speak. So I just would like to say that let the public actually decide what is right for them and what is wrong for them, whether they want to smoke or not. Like, who are we to tell others, hey, you cannot do this, you cannot do that? Let us, the people, like the Constitution says, let the people decide. So I don't think it's fair for us to just put this out there and be like, okay, we're done with flavors, and that's that. That's not fair. So I feel like that the ban is not really going to do anything. People are still going to have access to what they want, whether we like it or not. And I feel like the stores are our first line of defense. So that's all I got to say. I just want to say that I'm opposed to the ban of the flavor and all that. Thank you.
Thank you, Mr. Chaudhary. Appreciate your call. Thank you. Okay.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, my name is Sujeevan Dhaliwal. I am a realtor in the Sacramento County, and I'm requesting that you guys not proceed with this ban. Since statewide flavor ban is already going to be on the 2022 ballot, you should let the voters decide if they want to ban any flavored tobacco or not. I also want to remind you guys that we are in the middle of a pandemic, and retail businesses are really struggling right now financially due to COVID. So in an event that any, banned realtor happens, you should at least give us a year to clear out our inventory. Thank you so much. Please don't proceed with this.
Thank you, Mr.
Okay, next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Sure. Hi, I am Nasser Trazi, the owner of Zahra Hookah, a company that design and manufacture hookah products in California. I have been in the hookah business for almost 10 years. I am also a parent of 3 teenagers who never smoked before or vaped. Why? Because as a parent, it's our responsibility to teach our kids what's good and what's bad for them. What we need is more education about vaping and smoking, better parenting about smoking and vaping. I am here to ask you to mirror SB 793 and exempt hookah. Thank you.
Thank you for your call.
Okay, next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, I am a retailer in Sacramento, California, and I don't want to go through with this ban. I have a lot of products and I wouldn't be able to sell it all within a short period of time. And right now with COVID pandemic, it's very hard for me to with business, and this would just hurt me more. That's all I had to say.
Okay. Thank you for your call.
Okay, and please send the next caller. Hi, caller. Please start with your comments. You have 3 minutes.
My name is Sam Mansour with Sonic Brands and Sonic Smoke Shop. By now, I'm hoping you read my letters and public comments. I know I don't have enough time to touch on everything, but I'd like to tell you that we've done our own investigation, and 90% of shops that did not ID were shops with minor tobacco use permits, not smoke shops, not vape shops. Supervisors, you know over 95% of us are not selling to kids. We're an adult establishment, and I'm not sure why everybody's assuming that we're criminals. I don't disagree kids are vaping, but we're not the problem. Kids are mostly buying the products online and directly through China, specifically dhgate.com, and please do the research on that. To answer a question I heard earlier, flavors are 80% of our sales, and that's how much we're going to lose. Thank you.
Thank you for your call. Appreciate your letter as well. Okay.
And I believe we have the last caller getting transferred into the meeting right now. There could be one person that might have slipped in, but just want to let you know.
Okay. All right. Very good. We're going to take the last couple of callers, and then we'll bring it back to the board for further discussion.
And Chairperson Natoli, when you bring it back to the board, there is a video that needs to be aired, and it is the preference of airing that video before you guys go into discussion.
Okay. And who's the video from?
It's Don. It's from students in District 2. It's only 2 minutes long.
Okay, that's fine. I just, I thought there was a video. That's why I asked earlier about that when we were early part of the hearing, but okay, very good. We'll take the final callers and then we'll bring it back for the video presentation and then back to the board for discussion and deliberation. So, all right, very good.
And Supervisor Natoli, Natoli, I'm sorry to interrupt. Dr. Kassiri is on the phone and she would also like to make a comment at the close of public comment.
Okay, very good. We'll take Dr. Kassiri and appreciate Dr. Braz has been with us the entire time as well. So thank you, Gail. So, or I guess Gail. Okay, very good.
Okay, so did I misunderstand? Could you transfer the last caller, or was that the last caller? I may have misunderstood because we were Skyping. Sorry. Oh, that was the last caller.
Okay, so no other callers in the queue, no one that dropped?
Nope, no one dropped. It's just the delay of what I'm looking at and what they're actually having in their system, so.
Thank you, Flo. And again, when we started into this, we thought about 6:30 or so and came out just about that and a little more. So, okay, well, thank you to all of our callers, all the commentors. And so with that, we'll come back to the board. We'll complete the public hearing at this juncture anyway for today's purposes. And
Dr. Kassiri had a video. I think.
No, I know. I'm getting there. I just wanted we're moving that way. Thanks. We're going to get to Supervisor Kennedy had the video, and then Dr. Kassiri wants to speak. So, is that the order you want to take him in, Mr. Kennedy?
Yes, sir.
Okay. All right. Very good. Okay. So we'll go now to the video presentation, and then come back to Dr. Kassiri and then board members.
Okay, I'll ask Metro to please go ahead and play the video. The volume is really low.
My name is Fresa Naval. I'm a junior here at Valley High and a proud member of the Health Tech Academy. We've been learning about tobacco prevention through the SOAP project. The tobacco industry has been targeting youth like us through bright colors, exotic flavors, and even cartoon characters. We soldiers have been working hard to reduce the number of people impacted by commercial tobacco. Just this year, we pushed to get Heart Health Park smoke-free, but we need your help to take the next step.
Hello, I'm Dahama Qureshi, a junior at Valley High School, and I'm enrolled in Health Tech Academy, where I'm studying to become community health worker. I have seen kids my age, younger and older, using nicotine-weight, e-cigarettes, hookahs, small cigars, and other tobacco products, even at my school. The tobacco industry is targeting young people like me to buy their products because they know we can be addicted at a young age. The industry is making a lot of money by using a slow poison to kill its own community. They invested a lot of money to make tobacco more addictive to the people.
My name is Mustafa. I'm part of Valley High Health Tech Academy. This is an issue I care about because the enormously powerful tobacco industry has lobbied to derail initiatives in progress our state legislature. But where federal and state governance fails, local leadership has succeeded. Thank you.
So please consider stopping the sale and use of tobacco products of any kind. Thank you so much.
I want to see the future people playing together, not alone, vaping or smoking.
Support the flavor ban to protect health and wellness of youth like us.
Vote to restrict the sale of menthol and flavored tobacco products!
Appreciate their comments and the submittal of the video. So Supervisor Kennedy, was there anything else you wanted to add at this point?
No, sir.
Okay. All right, very good. Okay, so now we'll go to Dr. Kasiri, I believe.
Good evening, supervisors. Can you hear me?
Yes.
Yes.
Okay, thank you for giving me the opportunity to talk. I'm not going to say much because Supervisor Kennedy basically covered all of the background on the numbers, but I just wanted to be able to point out two main points. One is that there are 118 jurisdictions in California that have passed these bans. So Sacramento County is not alone on this journey. And a few years ago, we did start reviewing this, but at that time, the decision was made to postpone it because the state was considering it. So I think getting back to that point and then getting to the same point of saying, well, the state is going to consider it, so let's wait. I think we've done that before. And a lot of these children, as you have heard, have waited many years. I've talked to some of them who have said, you know, they see their friends getting addicted and they're very passionate about it and have asked for assistance, for your help in being able to make sure that the availability of these products is reduced in their communities. Lastly, I wanted to talk about the hookah. I know a lot of the speakers did talk about the cultural traditions, and definitely I can understand that as an immigrant myself, the importance of that. But I also want to point out that we also need to look at the health effects. In public health, as we've worked with many immigrant communities, we have identified some things that they look at as cultural traditions, such as certain cosmetics, certain utensils that they use for cooking, that put them at risk of exposure to lead and exposure to mercury. And we address those and look at ways of removing that risk. And that is what we're trying to do here. When you look at hookah, if you look at the American Lung Association, it does website, it does state that hookah smoking is linked to many of the same adverse health effects as cigarette smoking, such as lung, bladder, oral cancers, and heart disease. So I think looking at that, it's not that the target is not the cultural traditions. The target is being able to create a more healthy environment, especially for the children who many times, out of curiosity, try different products and end up getting addicted. So again, I want to thank you for your consideration, and thank you, Supervisor Kennedy, for the work you've put into this and for your introduction of this ordinance.
Thank you, Dr. Kasiri. All right. Is there any further testimony? If not, then I have board members that are hands up. So is there anything else? Not, then I'll come back to board members for comments and questions. And there may be a number of, I see 3 members. So we'll start with Supervisor Serna, then Supervisor Desmond, Supervisor Frost.
Thank you, Mr. Chair, and thank you, Dr. Kasiri, for your words, and certainly thanks to all the dozens of members of the public that waited patiently to address the board on either side of this matter. Even though we're holding this meeting remotely, it's rewarding to see that folks are still willing to take time out of their busy schedules to participate in their county decision making and governance. And certainly, I think all of us can appreciate that. One of the things I didn't mention earlier before we took public comment was, again, sharing my own personal perspective on what's before us, is that, serving as I do also at the state level on the California Air Resources Board, that charge, as well as ours here at the county, is also a public health responsibility. And of course, the California Air Resources Board gets a lot of notoriety these days for what we do when it comes to greenhouse gas reduction and climate change and those types of things. But we are principally a public health agency. And as such, I have a chance to work with my colleagues in that capacity, that many of whom are respiratory doctors and professionals, and certainly have heard from many of the same advocates that we heard from today, representing the Lung Association and others, Cancer Society. And so again, I would just encourage those members of the board who may still be unconvinced or on the fence about the import of what's in front of us relative to the preservation and enhancement of public health, arguably the most important responsibility we have to those that we serve. I think you should let that resonate with you. And again, I say that respectfully, and it's not that I don't believe everyone on this board to a person has a big heart and certainly understands how important public health is. But again, we're being asked to address a balance, as we typically do. One of the things that really hasn't garnered much discussion or comment thus far, either from us or staff or the public, is the fact that doing what we can to prevent more addiction to nicotine, and especially nicotine that is administered via smoking, you get, remember, an additional health benefit in terms of reducing secondhand smoke exposure and the health consequences that come with that. So I think that should be something that we keep at the forefront of our consideration as well, is that assuming that we could find it in our will today to act on this affirmatively, that we'd also be doing, I think, a great service to those folks that don't use tobacco, but who, by way of perhaps being a family member or a coworker or a fellow student, isn't necessarily going to be exposed to that. That is to carcinogenic smoke. So, and then lastly, I was interested in looking at what we actually do as a county and put out there very publicly on our Department of Health Services webpage. We certainly have a fairly robust tobacco education program that is noted there. And on that, the first thing you read on that page is that smoking is the #1 cause of preventable deaths in the United States. Over 480,000 people in the United States die each year from tobacco-related illness. That is more deaths than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. And I can't help but think that if that is our message, that is something that is unequivocally connected to who we are as a government, as a health agency. And if we don't act affirmatively, if we can't find it in our will to act affirmatively tonight on this, I can't help but think that we should be called on the carpet for hollow rhetoric, because identifying that and then the laundry list that follows in terms of all the programs that are dedicated to tobacco cessation and education, and to think that we could have prohibited or intervened to stop the next generation of nicotine addicts or the next generation of cancer victims or emphysema victims. That's more than frustrating. That's really a tragedy, quite frankly. So again, I'm looking at this clearly as a public health opportunity, one that, quite frankly, we should have taken advantage of years ago. I think if there's any room to take what some members of the public commented on today and perhaps slightly shape what's in front of us, would be relative to the idea of standing inventory and how best to be fair about that. But I think other than that, I still, as one member of this board, stand resolute and strong support of the proposed ordinance. Thank you, Mr. Chair.
Thank you, Supervisor Cerna. Okay, Supervisor Desmond.
Thank you, Chair Natoli, and I'm going to echo Supervisor Cerna with his thanks to the callers. It's very emotional, a lot of passion. I'm certainly struck by the science, the adverse health effects by this. Also struck by the personal stories that people shared with us, and the fear of some of the small business owners about the hardships that they face. I mean, I don't think we should disregard that. And Supervisor Cerna, you made a comment about me digging deep. I am digging deep on this, but I assure you, and you know that I struggle with it. You and I we represent different districts, different constituencies, and you're right about the public health benefits of this. It's crucial, and I'm trying to balance it with some individual freedoms here too, and so that's what I struggle with. But listening to Supervisor Kennedy and Dr. K and of course you, Supervisor Cerna, and the other callers, I'm persuaded that we need to act. I'm also persuaded by some of the arguments against exempting hookahs. I think, I'm maybe at some point in the future, but I'm not prepared to go that far at this point. I represent a lot of recent immigrants from Middle Eastern countries, and I've participated in shisha myself in the Middle East when I traveled to the Middle East, and it is such an important cultural activity that I think is would be very difficult for folks coming here trying to assimilate to our country, and so maybe at some point in the future. But what I would ask Supervisor Kennedy is, would you consider an amendment to this that preserved some of the exemptions from SB 793? I mean, particularly when it comes to hookah, I mean, the language is pretty restrictive. So I guess I had a question, what are your thoughts on that?
Yeah, thank you, Supervisor. I did look good and hard at that. And had quite frankly thought about and entertained the idea of putting an exemption in the original ordinance. However, the public health arguments won me over, and as Supervisor Cerna said, we're not looking at a full ban, and as one of the callers accurately said, we're not looking at a full ban here. It's the flavored tobacco. So at this point, I'd rather not. If I was to make a motion, which I'm prepared to do, however, I would extend the time period for it to be starting. I think that is fair, to look to mimic what the city did and give it 6 months. I would be open to entertaining that, however.
Okay, thank you. Well, I appreciate that, Patrick. I mean, even the exemption for hookah. So I mean, when you make a motion, I'll ask to make a substitute motion that would include the exemption for hookah. I guess we see where we go from there.
Okay, Supervisor Desmond, anything further?
No, thank you.
Okay, okay, thank you. Okay, okay. All right, Supervisor Frost.
Thank you, Chair Natoli. I tried to organize my thoughts. I took notes as people were speaking. There was a comment about how there was no outreach to retail, but in Sacramento City, there was outreach. And so I was sensitive to that comment, that, you hate to blindside a large part of the community. I am concerned. I was listening to all of it. I get what, the proponents are saying, that this is not healthy. It may be less damaging than other things and more damaging, and then some things and more damaging for some. But I guess I'm still in that place where if you ban it in the unincorporated Sac County, it doesn't really solve the problem, because they only have to drive 5 minutes to get it somewhere else. And I really believe in equal playing field. I believe in free enterprise, the invisible hand, where I've read the books of Thomas Sowell and other books on economics, where if you pull something out, it impacts something else. There's always those unintended consequences. And I'm sensitive to the comments that people brought about how, adults should be able to choose and make those decisions for themselves. And I also, don't know if it solves a problem if they can just go online and buy it and have it delivered, or just drive over the to the next county or to the next city. They still have access to it. So by banning it in Sac County, we're just punishing the businesses and the people who need it, who could benefit by it. It sounded like there were people that are benefiting by it in the unincorporated Sac County. There was one person who made a comment about, my question as it related to the loss of sales tax. And I just want to point out to that person that the amount of sales tax that we make on any business category is an indication of, how it will impact those businesses in our county. It's, if it's a large loss, then there's a lot of businesses that are really going to lose a lot of sales because of it. So, maybe it's not so much about the revenues as it is, how is it going to impact the local economy? And I think, having, the businesses represent 80 or 90% of, they're the working engine of what makes our, our freedom work. Without independent small businesses, we can't be free. We can't be independent. We'll all be on welfare, and sooner or later we'll run out of someone else's money. I think that was a statement by Margaret Thatcher. So yes, I'm interested in knowing, is there a revenue loss? Because that's an indication of how does that impact our local economy. The solution, I was trying to organize my thoughts so I'd be quick. The state issue, this is apparently coming to the ballot. Originally, when we discussed this a while back, I was of the opinion that this would be, really better managed at the state level, because it would even the playing field for all the businesses, and it wouldn't pick and choose who are the winners and who are the losers. If you live in Sac County unincorporated, you can't offer what you perceive is that service, that free enterprise. And so I don't think it's a bad idea or a bad thought if at the state level, it's managed at that level, then it solves it for everyone and everyone's on an even playing field. I also think that rigorous secret shoppers, someone talked about stings, and I talked about fines and revoking licenses. Even, no matter how hard, one person brought up a good point, no matter how hard we try, we can even ask that person, are they buying it for someone else, or are they buying it for themselves, and why are they buying it? And they, you can't control what other people do. We can't control everything. We just can't. And so in order to do that, we have to think about what kind of administrative resources it would require to enforce whatever policy that we're putting forward. And, good policy, every policy has intended and unintended consequences and cost associated with enforcing it. And so you have to ask yourself, can you enforce it? We already have laws, we're just not enforcing them as well as we could. There were some people that said, why can't we manage it like marijuana dispensaries? I'm not sure how they manage it. I don't know that we have those in Sacramento County. I'm not sure that's valid for us. But there was a thought there that maybe there was a level of enforcement that could help the situation to keep this out of the hands of children. And I also heard comments around education. I heard, education, educating the public, an education campaign that talks about how damaging this can be and how dangerous it is, and so forth. I think, I'm not going to support it because I don't believe in health. I understand the argument about health. I'm not a smoker. I'm also not a perfect person. When I was young, I tried to smoke a cigarette. I've done it and coughed and all that. But again, I am a strong proponent of medical freedom and freedom, independence, free enterprise. That's what America is all about. That's why people want to come to America. And if we start micromanaging everything, people won't be independent anymore. And the other thing I wanted to just touch on briefly was, if you do pass it, there were some very passionate pleas around some longtime traditions, things I'm not sure I'm well educated on, but the FDA approved, use of products in the hookah lounges, and you'll be shutting down businesses. Do you really want to do that in the middle of COVID? Do you want hardship in the middle of COVID when people are going through the hardest time? And also, Sacramento City apparently gave 6 months, but I wonder if it would be possible to just, I don't know. I mean, revisit this after November and see, let this let this happen at the state level so that we can have an equal playing field for our businesses, and so that, we're not singling out the unincorporated county. The unincorporated county is, it's important. They don't have the advantages that some of the cities do. The resources or the support. We don't always have the best roads. It's the unincorporated county that we're trying to help. We should be helping those businesses and helping those people. And, so I wonder if there's a way that we could launch, a rigorous, spend money on an educational campaign and a secret shopper, and, pass something that, if they get caught selling it to kids, their license gets revoked, and they have a large fine, not $250 up to $10,000, but $10,000 or whatever. And I also think it would be good if we could have some more conversation with the retail community who are working with this, and maybe with also, the proponents for, against the flavored vaping, so that they could maybe work together to figure out, how can we tackle this together to solve some of these problems. I bet the retail community would be willing to have that conversation with them. So those are my comments. I don't really want to support passing it tonight, but I want to have a conversation about solutions around this, because I do believe in health and well-being and all that. And so those are my comments.
Thank you, Supervisor Frost. Hey, Supervisor Kennedy.
Thank you, Chair. And I too want to thank all the callers for calling in. That was probably one of the most civil discussions over something that's that is personal and means a lot to people that I've seen in quite some time. So I truly appreciate the tenor of the conversation. I have a question of County Council, if Lisa's there. Or anybody.
I'm here.
Oh, okay. Procedurally, Lisa, I mean, because the action item says to continue, but do we vote on something tonight and then continue it?
I guess it depends on what you're proposing to vote on. I think if you're voting on the ordinance as written, then yes, you can vote on it. If you're voting to have further discussion, then you would just continue it without actually introducing the ordinance. I've also heard the possibility of adding additional time for effectiveness. So I would say that if that was the will of the board, that you would introduce the ordinance with whatever effective date you would like, whether it's 6 months or X amount of days, and then you would vote on that tonight.
Okay, then Mr. Chair, I'd like to make a motion.
I'm sorry, Supervisor Kennedy, this is Diana Reese from County Council, and I represent finance and that drafted the ordinance. And all I wanted to ask is if the board is going to consider delayed implementation to allow businesses to sell off their inventory, if that could also include a prohibition against buying new flavored tobacco inventory during that time.
Yes, that would be certainly the intent.
Thank you.
Supervisor Kennedy.
So with that, I would like to make a motion to approve the ordinance with that change, in that it would take effect 6 months from adoption, and that during that time period, no new products that are covered under the ordinance would be purchased. And that's my motion.
Second it.
We have a motion and a second. And I see a hand. I know Supervisor Desmond indicated he may want to suggest an amendment. I wanted to, before we get to any more procedural pieces, I do want to just speak to the motions on the floor. I was going to speak before, but it's fine. I want to just say that, along with my colleagues, that hearing the testimony, the fact that folks took the time, one, to sort of prepare comments, some who submitted them in advance, others who obviously called in today as word spread that we were considering what's before us here this evening, and obviously is now in the form of a motion. I want to just say too that I don't see what's before us as being a punitive as it relates to retailers. I think that as we have heard from some of those who called in, but also, and again, I know Diana Ruiz in the County Council's office, when we've had violations, have brought this to us in the past. We've had very few violations of the existing tobacco ordinance over the years, and I think it is because, one, we have, an effective ordinance, but also we have, clear commitment by those who are in the retail industry that for the provisions that either provide for the sale of tobacco products to those who are of age, and any restrictions that come under the county ordinance have, at least as best we know, have tailored their business model and have committed themselves to working within the law. But I also want to just say that I think some of the testimony this evening from not only from organizations who have long advocated for stronger policies and certainly healthy approaches to the conduct of our daily activities, but certainly from young people and from others, in fact, those who spoke to the benefits, at least as they saw them of vaping. But this ordinance does revise an ordinance we've had in place. It's been revised a couple of times over the years. And I think the original ordinance goes back to the early 2000s as related to some of the tobacco regulation. And I guess for me, it boils down to do what we can do, recognizing that we can't do it all and that we're not empowered to do that. And that when it comes to other products that are considered for adult use, i.e. alcohol, the state has, basically usurped local authority as relates to some of those regulations. And I know that, stories could be shared and certainly impacts of the forces that are at work with alcohol and alcohol abuse and so forth. But as well as, when it gets in the hands of those who are below age of the sale to them, some very dramatic impacts can happen. But this ordinance basically is, and I think staff characterize it well, is that what it does is it strengthens our current ordinance, recognizing that there's things in play at the state level. And the effort here is to reduce access to the purchase of or use of tobacco, flavored tobacco products, and thereby, I think it's said in the staff report well, that it reduces the potential for young people and youth to begin or continue using tobacco products. And I think, as we all know, addiction to anything is a tremendously devastating and terrible thing, and that again, people make choices in their adult lives to choose to pursue certain use of products and or other activities. But here, when we talk about our young people, and we saw some of them this evening on the video and heard from some of them on the call in, I think that, that thought about experimenting at a young age and then having the avenues by which to do it. And granted, I trust that there are different ways to get these products, but by limiting them to some extent, maybe at least shortcut some of those avenues. And I'm going to bring it back to what I said a moment ago. I think it's do what we can do, certainly with an eye to fairness and trying to balance our decision making, as one of my colleagues said a moment ago, but also recognizing that we have the opportunity to do something. And I guess I would choose to do something rather than to do nothing or to punt on this one to the state. And again, the will of the voters will be heard in November. And again, I have confidence in the will of the voters. And if they choose to do something different, then what we do locally may or may not be impacted by that. But for the time being, I believe we can do something more than we've done in the past and prepared to support with the amendment. I did think that the ability for retailers to be able to reduce their inventory, particularly against small retailers, was an important aspect. And not just because it mirrors the city, but I think it was an important consideration. And so I think that helps ease some of the impact, certainly to the retail community, that will be felt by this ordinance should we adopt it. So, but I'm prepared to support it here this evening and thank all of those who took time throughout the course of a long day for us, but certainly a long day for them as well, to call in, express their concerns, and to express their support and or opposition to what we're considering. So that's all I had to say. Thank you. Now, Supervisor Desmond, I think you had your hand up.
Yes, thank you, Mr. Chair. So I'd like to make a substitute motion, if I might, to adopt the ordinance with the additional language that Supervisor Kennedy mentioned as far as extending or delaying implementation for 6 months, but also adding an exemption for hookah that mirrors the language from SB 793. Not exactly sure where that incorporation would be. It would probably be put in at the end of section 4.07.110.
Okay,
that's my motion.
We have a substitute motion. Is there a second? There are no second to the substitute motion, so unless there is one, then the substitute would die for lack of a second.
Understood.
No, I know, again, I want to be clear, there was somebody considering a second, so. Okay, anything else? Just as anything else you wanted to give a shot at?
No, I just I appreciate the conversation. I'm going to abstain from the vote tonight because I certainly don't want to send a message that I'm against banning flavored tobacco products, but I'm not prepared to go as far as this ordinance goes. I mean, I was hoping for a second because I think it's something we could revisit at some point in the future. But if we proceed with Supervisor Kennedy's, we proceed with that motion, then I will abstain. Thank you.
Thank you, Rich. Okay, any other supervisor want to comment before we, Lisa, did you want to weigh in? I see you.
No, I don't need to weigh in, just the motion.
I'm sorry, I just saw you. Okay, I didn't know.
Sorry.
All right. Okay, Supervisor Cerna, you have your hand up.
I just wanted to briefly respond to Supervisor Desmond and let him know how much what he just said is refreshing and very, very welcome. Here's a situation where we have some respectful disagreement, and the way he's handled or the way he's teed it up tonight, we may not be on the same exact side on this one, but to have it expressed the way he's done just now, as someone that's been on this board for a dozen years, almost extremely respectful of it and welcome it. Thank you.
Thank you, Phil.
Okay. Are there any other board member comments? If not, we do have a main motion on the from the floor, and I will call for the vote here unless there's any further comments by board members. All right. Seeing no hands, then I'll go to the clerk to, and maybe just for the record, so it's clear to those who've been tuning in all afternoon, read the motion that's on the record, if you would, Flo, before we actually call for the vote. So, thank you.
Yeah, so a motion was made by Supervisor Kennedy and seconded by Supervisor Phil Cerna to approve the adoption of the ordinance as it has been submitted, also amending it to include that it would become effective 6 months after the adoption, and also adding on that no new product would be purchased in between this time. I might not have said it exactly the way he said it, but that's my notes, paraphrasing.
Sure, no, that's good. So, and that language will be put in the proper format, then County Council, again, and when this comes back, this will come back to us. This is first reading, so this is introducing the ordinance. So it'll come back to us in 2 weeks. So
On the 25th, we'll have the revised language for your approval.
all right. Okay, thank you. That's the motion then. If nothing further, then Flo, please call the vote.
Supervisors Frost?
No.
Kennedy?
Aye.
Desmond?
Not voting.
I'm sorry, did you say abstain?
Abstain.
Okay. And then Supervisor Cerna?
Aye.
And Supervisor Natoli?
Aye.
And the motion carries. Let the record reflect that Supervisor Frost casted a no vote and Supervisor Desmond abstained from voting on this.
Okay. That's the 3 o'clock item. But with that, thank you all. And again, good deliberation, and thank my colleagues for their patience as we took testimony. Okay, brings us down to not the last item, but the last timed item of the day, and that's our discussion regarding the 3:30 item on the initial recommendations on the American Rescue Plan Act. So, Madam Clerk, call that into the record, please, and we'll get the presentation and then go into discussion on this one.
Yes, sir. So item 60, approve the initial project recommendations for Phase 1 of the American Rescue Plan Act. Approve an appropriations adjustment request in the amount of $10,751,251. Approve a salary resolution amendment adding 1 FTE limited term administrative services officer 2 in the Office of Economic Development. Authorize the allocation of $64,000 for the purchase of 1 vehicle for emergency medical services. approve resolutions authorizing agreements associated with the implementation of American Rescue Plan Act projects.
And I will promise we'll take a break for breakfast between item 60 and 61, okay?
Good evening, Chair Natoli, members of the board. I'm Amanda Thomas, the county's Chief Fiscal Officer, and I will be introducing this item to discuss initial project recommendations for the county's use of funding under the American Rescue Plan state and local fiscal recovery funds. I'll be joined by the directors of each department with a recommended project to provide an overview of each project recommended for funding. They are Siobhan Katari, Director of Health Services, Emily Helkin, Director of Homeless Initiatives, Michelle Callejas, Director of Child, Family, and Adult Services, Sylvester Fidal, Director of Personnel Services, Marie Wooden, Director of Environmental Management, and Troy Gibbons, Director of Economic Development. Hopefully I didn't leave anyone off that list. And I did want to take this opportunity just to thank them and the staff within each of those departments for all of the work that went into getting us to this point. I will also mention that we also have representatives on the line from Deloitte who has been advising the county on ARPA, should there be any questions that are best addressed by them.
Amanda, if I could just 1 second, did we have a changeover in our format, Madam Clerk? Because I only see the presentation, and Amanda, in the past, we were able to see colleagues in the event there was a question going. Is there, we have a cutover to cable or something?
I'm sorry, so are you asking for them to close the present? Okay, there we go.
Well, yeah, no, I just couldn't, before, if a supervisor wanted to talk, I could see their hand come up, and what I was seeing a moment ago was, well, what, just the picture of the,
I think when the presentation is up, it only shows the person who's speaking to the presentation. I'm not sure if there's another format. It's a
different format than what.
No, Supervisor Natoli, this is Supervisor Stern. I think what you're seeing is the broadcast in our actual Zoom. And so that's why you're seeing kind of a stretched out image of whoever's talking.
Yeah, a little different than what we saw after a new law. So.
Yeah.
I am no longer seeing the presentation. Are others?
Metro Cable, would you please bring that? There we go.
Okay.
Thanks. Go ahead, Amanda. Sorry.
Okay. No, thank you. And next slide, please. So just by way of background, and as you know, the board approved ARPA Phase 1 funding allocations for the initial $150 million tranche on November 2nd, 2021. These funding allocations included 3 strategic investments: housing and homelessness, health, and economic response. So each of the projects recommended today falls within one of these strategic investments, and I'll be providing some additional background on each of these strategic investments on the following slides. It's important to note that this initial recommendation is not an exhaustive list of Phase 1 projects, but rather represents the projects that are most fully scoped and ready to begin implementation. And staff continues to develop and scope additional projects within each strategic investment area. Next slide, please. So the next few slides will recap each of the strategic investment areas that were approved in November, with the first being housing and homelessness, including housing and support services for people experiencing homelessness and affordable housing. This strategic investment is targeted toward helping people experiencing homelessness, as well as those who have fallen behind in rent or are in need of affordable housing. And the approved funding allocation is 39% of Phase 1, or $59.5 million. Next slide, please. The second strategic investment is health, including COVID-19 response, public health, mental health, and substance abuse treatment. Projects in this investment area will help people experiencing health impacts from the pandemic, as well as communities with lack of access to healthcare. And the approved funding allocation for health is 13% of Phase 1, or $19.9 million. Next slide, please. The third strategic investment is economic response, including addressing negative economic impacts to residents, communities, and businesses. Economic response investments are targeted to businesses and workers who have been impacted by the pandemic, including those in low-income communities or who serve low-income communities. And the approved funding allocation for this strategic investment is also 13% of phase one, or $19.9 million. Next slide, please. So before I turn it over to the departments to discuss each project, I wanted to provide an overview of this initial recommendation, which includes a total of 23 projects with total ARPA funding of approximately $54.5 million. Of that amount, it's estimated that $11.3 million would be spent during fiscal year 2021-22. And then you can see on the table on this slide how the projects and funding are distributed among the strategic investments. So for housing and homelessness, this initial recommendation includes 6 projects for total ARPA funding of about $17.5 million, leaving a remaining allocation of $42 million. For health, there are 9 projects for total ARPA funding of $17 million. For economic response, 8 projects, total funding of about $19.8 million. For ease of presentation, the remainder of the slides that are going to detail each project are organized by department rather than strategic investment. And with that, I will turn it over to Siobhan Katari to present the projects for the Department of Health Services.
Good evening, board. Next slide, please. So as Amanda said, we have 9 projects that I'm going to present today. I just wanted to highlight, and she mentioned this, but these are projects that we feel were project ready or shovel ready, if you will. There are some other projects that have been proposed that we're looking at digging into more details. And so I just wanted to let folks know that if a project that's been proposed or pitched isn't shown here tonight, it doesn't mean that it's not being considered still. This first project is actually a project that's coming both out of the housing and homelessness tranche as well as the health tranche of 50-50, so $5 million out of each. And it's to build the Sacramento County Social Health Connect. And I've come to the board before to talk about the Social Health Information Exchange, which is a countywide data infrastructure that will link medical, behavioral health, social services, and housing information about the folks that we serve from multiple sources and data systems to really allow us to do more comprehensive care coordination and allow us to get a really good handle on population health for our community. This is a investment that not only will help all of our organizations, healthcare, social services, to do better on behalf of those that we serve, but it will also advance some of the initiatives I've been speaking to you about under CalAIM. The total project cost that we are anticipating is about $30 million for this project. However, what we're asking for today is an initial investment from ARPA funding of $10 million. The balance of that funding, we will be seeking from other sources, including our managed care plan partners, through the CalAIM incentive funding. So we have already been discussing that with them, and they're very willing partners in this. This initial allocation of funding would allow us to hire 3 staff to get this started, 2 within the Department of Technology, DTech, and 1 within the Department of Health Services to launch the project and get it rolling this year. So that is our first project. Next slide, please. This next project is a community nursing or field nursing team of nurses that will go out, public health nurses that will go out to provide outreach, client advocacy, and case management to individuals experiencing homelessness within our encampments. So the board funded the encampment teams, and this community nursing unit would really partner with the encampment teams to go out and provide that healthcare assessments and linkages. And so the total project cost is $700,000. And we anticipate that by the time we get nurses hired, it will be next fiscal year, which is why there's no budget for this fiscal year. We're looking to hire a team of 5 for this. Next slide. This next proposal is similar to the last proposal. It's a field nursing or community nursing unit to serve children and families at risk of homelessness through our Black Child Legacy incubator sites. So we have 7 of those sites. So this would hire a nursing supervisor and 7 nurses to be located in those sites. And this team would provide assessments and interventions, care coordination, linkages to health resources, and health education to pregnant and parenting families who are experiencing or at risk of homelessness. And the total project cost is $1.5 million. Once again, we anticipate launching this in July. Next slide. This next slide represents the investment into the SURE Sobering Center run by WellSpace Health. And this is a center that we have discussed at the board before. We have partnered with the city of Sacramento and would like to continue this partnership to be able to fund the Sobering Center. This would provide short-term recovery, detoxification, and recuperation from the effects of drugs and alcohol, primarily focusing on methamphetamine addiction. One of the primary intents of this is to reduce the impacts on emergency rooms and the county jail. And the total cost of this for 2 years is $2.6 million. Next slide. This next proposal is for our medical services that we provide at Project Roomkey, which are our hotels for homeless individuals who are at risk of contracting COVID-19. This includes us providing health education, care coordination, harm reduction, wellness and supportive care, intakes and assessment, COVID-19 isolation, COVID-19 testing and vaccination to prevent outbreaks. So this would be total project cost of $1.5 million, which we're seeking $1 million through ARPA funding. Next slide, please. This next proposal is emergency medical.
Sorry, Mr. Chair.
Yes.
Mr. Chair, I'm sorry. Back. Sorry, Mr.
Back
Chair.
one slide, please.
Yeah. Would this be applicable to just room key or home key as well?
This is just Project Roomkey.
Okay, thank you.
You're welcome. This next slide is for our EMS, our emergency management services, emergency medical services equipment. Currently, EMS is a primary responder during activations of our emergency operations center. They're also an integral component of the county's PPE and medical supply distribution network. So this funding would provide equipment and supplies to more safely and rapidly deploy the temporary medical mobile facilities that we deploy in events of either COVID-19 resurgence or other EOC activations or emergencies. The supplies we would get would also enhance staff and volunteer safety during an emergency. Total project cost is $107,000. Next slide, please. This next proposal is to get additional primary health clinic staffing through our registry services. So not hiring additional county staff, but being able to bring on additional registry medical staff to provide services to individuals through our primary care clinic, supporting the goal of increasing access to care. There's been an increased demand for these services as a result of the COVID-19 pandemic. Next, and the total cost of this is $2.4 million in ARPA funding. This next proposal is for pandemic technology needs. As a result of the pandemic, we've seen a need for increased IT services and staffing to support and deploy new public health and behavioral health systems and adjustments to our current system so that we can track data and provide care for the community. So this funding would allow DTech to provide these increased services. Total project cost $350,000. Next slide, please. This next proposal is to hire a 0.5 half-time medical registry registered nurse for our youth detention facility who will be dedicated to monitoring, infection control, providing immunizations, and patient and staff education, and assisting the program to keep up with evolving Cal OSHA standards in our youth detention facility. And the total request is $191,000 from ARPA funding. Next slide, please. And I'll turn it over at this point to Emily Halkin, our Director of Homeless Initiatives.
Question before you leave, go, Siobhan. Back to the community nursing children and families unit. Are they going to be stationed out at the family resource centers? I heard you say something about 7 locations, but we have the resource centers. Is that where they're going to be working out of?
We have the resource centers and we have the Black Child Legacy incubator sites. They will be housed at the incubator sites, but work very closely with the resource centers as well. So yes, they will be serving the resource centers and the incubator sites.
And so I wanted to ask on the FRCs, because again, those are in place. We've obviously found funding through realignment or general fund. And I know they ran into, I think, a shortfall here mid or late part of last year. But in addition to the incubator sites, those sites have long been established as, you know, hubs for provision of services for folks that we know are at risk. I'm curious, have we looked in conversation with our partners in the family resource centers about any needs they might have? And again, I know this isn't an all-inclusive list, but as I think about it and heard your presentation, I'm wondering, you know, what are we doing for those that are already our partners? We're helping ourselves as a county internally, but what about the external pieces of this? So.
Yeah, so these are certainly our partners, existing partners that we intend to continue to partner with to amplify this. I don't know that I could answer your questions, and maybe Bruce or Ann, who know more about the family resource centers, can answer that, but I can get more information for you about that by the end of this presentation.
Okay.
Okay, thank you.
Great. Thanks, man. And again, I've just said to my colleagues, I cannot see on the screen right now. I know Flo's working on it. I can't. So if there's any board member wanted to weigh in before we went to Emily's presentation, speak up.
I think Supervisor Desmond was ahead of me.
Oh, thanks.
Okay. Good. Yeah, because I can't see you. Okay, that's fine. I can only see one.
Well, that's why I was teed up earlier. You didn't notice me. I thought.
Yeah, I can't see you.
Excuse me, board members. This is the clerk. I just wanted to let you know that something did happen technically between the video, something about the presentation feed, and we are trying to work that out without disrupting the meeting in the background. So I apologize that the same screen is not available to you, Supervisor Natoli. My apology.
It's okay. I don't want to miss my colleagues. And so, Flo, you can help out. You're very good. If you can see it all, if you see hands while we're still trying to work on that, you know, we've got Supervisor Desmond and then Supervisor Cernan in the queue, but I know Supervisor Kennedy weighed in. So you can help me with that, Flo. You've been helpful all day long. So I'll let you help guide it.
Thank you.
Go ahead. Okay. Go ahead, Rich.
Okay. So, Siobhan, I think on the community nursing, the encampment unit pilot, that was a few slides back, right?
Yes.
So I had a question. I know most of these, they're health related, and so they'll be county-wide. We'll be operating in the unincorporated county and in the cities to provide these kinds of supports. But this one, I'm assuming this one, since it's going to be working with our encampment teams, this will be primarily unincorporated county, these efforts for this item?
That's what we're looking at this point, is them being embedded with our unincorporated, our county encampment teams.
Great. And then the one to support the Shore Center, which I'm a big fan of, and I know Supervisor Cerna is largely responsible for this. And I just hope that we're going to be considering in terms of future funding for ARPA that we consider expanding. This does not include an expansion of it, right? It just makes it what?
Correct. It's
24/7. Okay, yeah.
It's not an expansion. We're paying 50% of the overall cost of it, with the city is paying the other 50%. So this is looking at this current fiscal year we're in, as well as next fiscal year.
I mean, it's such a great model. I would love to see it obviously expanded, replicated in another part of the county too. So, okay, thank you.
Thank you. And I see Supervisor Cerna's hand is up as well.
Yes, thank you, through the chair. So I have a specific question that tees off of what Supervisor Natoli mentioned a few moments ago about FRCs. And I know we're going to get some more specificity from Bruce, I guess, offline about whether or not, I think it was it nursing, family?
The community nursing.
Yeah, the community nursing. So if you can go back to that slide, that would be helpful.
Sure. Yeah, it's about 5 slides back, I believe. It's my second slide, I think it is.
No, I thought, okay, well, whatever slide it was.
Slide 9.
Slide 9, thank you.
So I just wanted to point out that I know we have several FRCs obviously scattered across the county. The one that I've worked, my office has worked very closely with, continues to do so, is the one at the FRCC, the Fruit Ridge Community Collaborative. And as I think most know, the Sierra Health Foundation is in the process of taking over the responsibility there in terms of kind of the property management and overall kind of oversight of activities at the former Fruit Ridge Elementary School. And I'm just wondering, in the course of answering the question for Supervisor Natoli, have we looked at kind of maybe the uniqueness of how this allocation might work at that particular FRC, given that there's a significant amount of BCLC activities that go on there, even pre-COVID, relative to a dozen or so nonprofits that are housed there. So I guess I would just ask that you add that to the question / consideration of specifically providing some resources for this intended purpose at that particular FRC is what I'm saying.
Great, I appreciate that, and I know Michelle Calles is on the call right now, so if she has anything she wants to add, certainly she can. But yeah, we'll take all of this into consideration and definitely choose sites based upon this discussion tonight. So the goal is really to reach out to those communities. How we do that is still flexible.
And then, thank you. And then generally and overall, especially when it comes to homeless and housing services, has our staff in coming up with these preliminary recommendations explored what not just the city of Sacramento, but some of our other cities as well, what they're doing on that particular front with their ARPA allocations? Because as I think was discussed pretty exhaustively at the beginning of the whole ARPA conversation months ago, was let's be smart about how we might look at merging resources from both the unincorporated county and various cities that are also eligible and receiving ARPA funds, so that we can maybe have something greater than just the sum of the parts in terms of the various allocations that are coming from the federal treasury.
Yeah, and I'll have to ask Emily as she speaks to her part to really talk about that. Some of the services that I'm talking about today, public health, behavioral health, those are really things that the county provides. And so I don't know, I can't speak to what the cities are doing in those realms, but from the housing and homelessness, is that what you?
Well, you kind of just nailed it on the head, though, when you say it's something that just the county provides. I think there continues to be a lot of focus and concern that the county has certainly its fair share of homeless challenge in the unincorporated county, but there's certainly a great deal of what goes into effectively addressing homelessness. That yes, the county uniquely provides those services, whether it's public health or AOD or what have you. And I'm just wondering, because of your response to Supervisor Desmond about 10 minutes ago, that I think you said, no, this is just going to be for the unincorporated county. And so that's what kind of piqued my interest was, are we just talking about what is being preliminarily recommended in terms of homeless response just for the for the unincorporated county tonight? Or is some of this both unincorporated and within some of the cities as well?
Yeah, and I would say it's both for some of the proposals. So if for some of the proposals, it may, for instance, the encampment teams are currently, and I'll let Emily speak to this, but currently the encampment teams are serving the unincorporated county because there is a similar mechanism in some of the cities, like the Department of Community Response.
And I get that, and I appreciate you saying that. I think in the future, though, and there may be others on the board as well, I'd like to have a really clear understanding of, what we see as kind of the countywide service delivery intent with these recommendations versus just the unincorporated.
Great, will do. Thanks.
Thank you.
Supervisor Kennedy has his hand up now.
Thanks. I can't see. Thanks, Em.
I think Supervisor Desmond was before me.
Thanks. Thank you, Supervisor Kennedy. I just wanted to echo Supervisor Cerna's sentiment. I agree with that completely. I mean, there are things that we will be providing countywide, and to the extent it's something where it bleeds over, to have that kind of clear understanding of who has what role and responsibility, and where we have those opportunities to team up with the city. So that's why I was asking that question specifically about the encampment team. So yeah, thank you, Supervisor Cerna, for bringing that up.
Yeah, and I was going to actually say the same thing, because we keep saying, to the city that these are the services we provide countywide. So we want to be crystal clear that this isn't just unincorporated for the services that we traditionally provide.
And the Sacramento Bee continues to remind us too.
Yeah.
If I could add,
go ahead, Ann.
I think that much of what Siobhan is talking about are the traditional services that county public health and primary health provide. We do have some distinction on the encampment teams, but as you know, we do go out to encampments that are not in unincorporated county from time to time as well. In fact, very often. But I think these health and public health programs are designed to serve the entire county.
Yeah, I think if I may, Supervisor, I was just going to echo what Ann just said. And I think as Emily goes through these proposals, we can speak to the dialogue we've had with the other jurisdictions. We are in regular contact with them about their plans and ours. So as Emily goes through this, perhaps we can speak to that more specifically.
Okay, so can we, good evening, slide 16, I think is what it is. Okay, good evening, board. I'm Emily Halkin, your Director of Homeless Initiatives. And in addition to some of the collaborative projects that Siobhan already detailed that are partnerships between homelessness and healthcare, I'm going to go through 3 of them, but I wanted to really quickly address Supervisor Cerna's question about some of the other jurisdictions. And certainly the work with the city is ongoing and very detailed. We have had some really preliminary, really good conversations with the city of Elk Grove, who similarly took some of their ARPA allocation and dedicated it to housing and homelessness, kind of in the same vein that you guys did. And we're looking at a potential partnership with them. I haven't heard a similar sort of allocation methodology for some of the other cities, but we certainly can reach out, because I would anticipate some of them would want to prioritize funds into housing and homelessness. And certainly we need to make sure that we're partners with them. So the first project that I wanted to talk about is a recommendation for landlord engagement and rehousing support. The recommendation is for a $10 million allocation. This is really intended to be complementary to a lot of the investments you made through your budget process back in September, where you really focused a lot on outreach, engagement, and sheltering for folks who are experiencing unsheltered homelessness, and really with the intent to make a demonstrable difference in the crisis of unsheltered homelessness. But as you have recognized many times, and we all know, the other side of the coin is to make sure that we have sufficient available, affordable housing opportunities for folks who are exiting homelessness, both directly from the streets and from shelters. So the intent of this program is to increase those housing outcomes, working with existing housing programs to supplement, not supplant, the things they do. We know that in our community, we have a lot of housing programs, but many of them are restricted by funding regulations or targeting certain subpopulations. The goal of this program is really to be agnostic to who the person is, what other funding they might be receiving, and breaking down some of the barriers that are preventing those programs from being as successful as they should be. With approval today, we will enter into a full scoping process with this. This is why you don't see any expenditures this fiscal year. We think we need at least a few months to engage the community, housing providers, the continuum of care, and others to really design what this should look like. But some of the intentions behind this investment, as I said, are to break down barriers within existing programs, to provide those critical rehousing services that some of them can't do or aren't able to do as efficiently. Two examples, and one that you guys just discussed today. Earlier, Siobhan talked about the new allocation through CalAIM that will allow us to access some tenancy supports through managed care, which is a great resource and we want to tap into. But CalAIM can't do the rental payment. So marrying these two programs will help create efficacy through the CalAIM and allow us to leverage those dollars much better. Similarly, we all know that we have a lot of folks experiencing homelessness who are accessing our Housing Choice Voucher program through SHRA. It's a great resource for ongoing, stable, affordable housing, but it can't do all those one-time things like pay a rental application, pay a deposit, and it certainly can't pay the ongoing tenancy supports that help landlords become comfortable and engage with the program. So that's what this program is intended to do, is fill in those gaps in some of our existing programs to make them more effective. Secondly, we think it's really important that this program will do, and there's been conversations at the continuum of care and with other jurisdictions about this, and we think we can bring it to scale, is developing a real dedicated line of work here in our community and funding for ongoing engagement with landlords, apart from case management, apart from all the social services that we do, that really is dedicated to identification of available units, supporting with lease-up efforts, ongoing tenancy supports, and provision of rental assistance, again, with the focus on having landlords be engaged in the programs that we have. And then finally, as I mentioned with the example of CalAIM, is scaling up some rental assistance resources that truly are flexible and can be used with any population, agnostic to who they are, what other programs they're engaging in. And again, this would be countywide. So we would be working with our partners in different shelters throughout the community, different outreach programs, certainly with SHRA and the continuum of care to help use these resources most effectively.
Emily, if I could ask you, again, I can't see if other supervisors have their hands up, but on this one, I mean, we received a tremendous amount of money for rental assistance for both tenants as well as landlords. And if I last recall, we still were undersubscribed for, the many, close to $100 million countywide, if I'm not mistaken, in that last tranche. And I know that Michelle, certainly working with you and others, have been, looking to see to it that rental system was there. This differs. I get the distinctions, but I'm just curious. We're putting another $10 million in for this, and this, I guess, will carry this through the next year. But we still have money. We still have money on the table, if I'm not mistaken, for rental assistance that was provided under ARPA under a different funding silo, right, or stream.
Yeah, I haven't seen, I think you're talking about the ERAP program, which is Emergency Rental Assistance Program. I believe there's still some funding unused. The difference there is that is targeted to folks who are currently housed and at risk of losing housing. This is intended to focus on folks who are currently homeless. And the second thing with the ERAP program is that it's limited to one-time costs. So they can fund, a down payment, but they don't stay on board. They don't case carry. They don't stay supporting the client. The goal here is to have somebody who, if the client doesn't pay rent, you can call, or if there's a loud party or something goes awry and the landlord's nervous. So it is a different intention, a different subpopulation. Certainly we can work, I think working with SHRA is critical and potentially leveraging some of the resources they have, but this is a different focus.
Well, let me ask one piece about this though. If memory serves me correct, going back now 4 years ago, but when we did the county's homeless initiatives, and we talked about vouchers and about guaranteed, basically deposits. It said the event that there was damages and so forth. I thought we had that tailored under what SHRA was already reaching out to landlords with. We obviously had some, upper limits on what we could pay as far as the vouchers and so forth. But I thought we already had that in place, and and maybe this is more of that or different in some ways. But we spent a lot of time talking about how we could assure landlords that if they took on a housing subsidy or a voucher, that they wouldn't be left holding the bag when it came to either deposits or damages and so forth. So maybe you can.
Yeah, and to be fair, and I should have been a little more specific here, is that the amount of the 10 million going towards actually subsidy payments, like a damage fund or a double deposit, is pretty de minimis. What evidence has shown is that many landlords want that assurance that it's there, but they don't often draw from it. The vast majority of this funding is for the staff to provide the 24/7 support to both the clients and to the landlord, and for actual rent subsidies for folks who don't have access to a voucher. So there is a small component of this that is sort of like the one-time assurances or damage funds, but it's definitely not the vast majority here. And I would anticipate that having it there is important for an assurance, but it's not typically drawn upon. And I'm happy to provide a breakdown into what builds up this 10 million, if that's helpful.
Yeah, it might be useful. Again, I know these are summaries, so I appreciate that. Now I can see the full screen. I see Supervisor Desmond, his hand up. So thanks, Emily. Go ahead, Rich.
Thank you, Chair Natoli. Yeah, and thank you, Emily. I mean, this is great. This certainly, to me, strikes me as one of these things where it could be a partnership with the city. I guess my question is, the cities get ARPA allocation to handle this kind of housing assistance as well. Is that correct? Or is this something that's unique to the county?
I'm sorry?
Or is this something that's unique to the county as far as a county service?
No, certainly this is something we're building. It doesn't exist currently. So a city could certainly choose to use some of their ARPA allocation to build a similar program. What might be more appropriate is that if we build the infrastructure, then cities could buy into it if they wanted to dedicate a couple million from their ARPA and expand it. We've talked quite a bit at the continuum of care level of trying to sort of have a sort of central hub so that not everybody is fighting for the same landlords. I do think that it makes sense for the county to be that hub. And I do think reaching out to those cities if they want to participate, I don't think it would preclude us from helping somebody who's homeless, for example, in Rancho Cordova, but it would be something that they could expand with investment.
Okay, great, thank you.
I don't see any other hands, Supervisor Natoli, so.
No, I don't either. Go ahead.
Okay, you can see it now, okay.
Now I can finally see it. That's good, yeah.
Okay. So next slide. Okay, so the second program, while much smaller in scale, is just as critical. And I don't have to tell any of you guys, that the River District community, including a lot of the portions that immediately abut the American River Parkway, is home to a disproportionate number of folks experiencing unsheltered homelessness in our county. And the city and the county certainly provide a lot of resources and outreach in that community. And many of the shelters in that community prioritize folks who are living unsheltered in the River District for services. But there's still a great need. And so this proposal would dedicate 2 full-time contracted outreach navigators through a county contract using a community-based organization to specifically work in the River District, focusing on outreach, engagement, and rehousing strategies. DHA currently holds contracts for navigators that work throughout our county. So this would expand those contracts to add an additional 2 FTEs. This would be in addition to, so this is not taking existing navigators off the streets. And we'd be working with the city, of course, the River District, the providers in the River District to really scope how those FTEs will be deployed to target the greatest need in the River District, and also to ensure that data is collected to demonstrate the efficacy of this very geographic targeted outreach.
Through the chair.
Yes, sure. Go ahead, Phil.
Thank you.
Supervisor Desmond after you. I'm sorry. Go ahead.
Yeah, thank you. Emily, I appreciate you kind of prefacing this with most, if not all of us, knowing kind of the unique trials and tribulations the River District has faced during the pandemic, especially, and also having one of the Project Winky hotels located in the district. Is there anything specific to direct assistance working through the city with the city to help the district economically besides just, and I don't mean to minimize this, it's important that the two navigators, but I could easily see River District leadership saying, what about us? And of course, you know, the knee-jerk response might be, well, you're in the city, let the city worry about it. But that's not the way I can look at it as the county representative representing that part of the city. So are we open to the idea of perhaps assisting through the other pot of funds that we've identified for economic assistance, helping places like the River District, which I would argue all day long has really taken more of a hit or a challenge given the nature of the pandemic and the services required there that are arguably countywide service related. It's something that I think we ought to be thinking about, again, to kind of erase or make fuzzy the line between the city and the county when it comes to these different pots of ARPA funding.
Well, perhaps Troy would want to speak the second part, but what I can add, I believe there have been conversations, and Ann may also want to add about additional supports for the River District related to street management that the city is entertaining. So this is probably going to, I would anticipate, is a component of some larger investments in the River District. I don't know if Ann or Troy want to add anything.
Yeah, I will. Thank you, Emily, and thank you, Supervisor Cerna. This project came from a direct request from the River District, and this portion is half of what the original request was. The city of Sacramento is picking up the other half of the request from the River District to do more garbage management and other things related to supporting that community. So we are working in partnership with the city on this project.
No, that's a really important part of this, at least for me to know, is that this sounds like came at their request, correct?
Yes, and I've spoken with, go ahead.
It came at their request, and Howard and I talked and agreed that we would split the cost of the project. So we're doing this together.
Terrific.
And I've spoken with Jenna Abbott about this, and I certainly want to speak for her, but I believe she's supportive and appreciative and would is looking forward to working with us on scoping how this looks.
Terrific. Thank you.
I think
Supervisor Desmond, Rich.
Thank you. And no, I agree. The River District is unique in terms of the impact that they're facing from homelessness, the amount of homelessness there. So completely support it. Yeah, as I read it, I saw that it was associated with the PBID specifically, and I just had a question. Does this kind of signal that we're going to be having a new approach to how we handle navigator contracts throughout the city? And I'm just asking because I know we have ours in the unincorporated area, and I could certainly anticipate getting calls from other PBIDs, even though they're not in the situation the River District is in. But I already hear complaints about the lack of navigation services available in some of these other commercial corridor areas.
So the request certainly came through the PBID, but the contract and the management and the oversight of the actual navigators will stay at the county. We're going to work with them just like we would with any other community. So for example, when we deploy the Parkway navigators, will work closely with folks who have investment in the Parkway, including our rangers, but others. So the funds are not flowing through the PBID. I know this isn't exactly answering your question. They are a critical partner here, and they certainly will want to provide some input. But this is a contract that will live at the county, be managed similar to our other outreach contracts.
Got it. Okay, thank you, Emily. I just anticipate a lot of kind of me too's. I could see that happening. And then just in terms of the other navigators, are we still set up? We have the Parkway navigator, north of the river navigator, south of the river navigator, all through Sacramento self-help housing. Is that still where we are in the unincorporated areas?
Yeah, currently our contracts for outreach navigation, including the Parkway and some of the ones in the unincorporated areas, are through SAC Self-Help Housing. DHA just completed an RFQ, request for qualifications, and I believe they're bringing the qualified list to you in early February, for which we will draw the expanded navigator resources. The additional 10 navigators will be adding to the Parkway, potentially these and some others. So the expanded contract, depending on the outcome of that RFQ, may continue to be SAC Self-Help. It may be them plus others. It may be somebody else.
Okay, thank you.
Okay, I think next slide. And the final recommendation that I'm going to talk about is a request for an investment to expedite some work that's already underway that DTEC has taken on to develop a database to track and report out on our collective countywide efforts to engage with folks living in encampments, provide services to those encampments. DTEC has created a prototype for this, which will allow us to track the size of the camps, how camps grow and shrink and move, how we as county staff and our contractors engage in those camps, debris removal, all those types of things, as well as movement of people out of encampments into shelters and housing. What this proposal is doing is recommending shifting that work from DTEC to a consultant, simply because of capacity and timing needs. That consultant then would fully build out the prototype. They would work on integrating with existing county database and departments. They would be involved in the testing and training and the development of reporting functions. DTEC would oversee the contract, and my office would provide some input on the content, how it's going to be used, and reporting requirements. And our goal of this, shifting it to a consultant, is really to expedite the availability of this critical resource.
Question, Emily, but I'm still a little vague on what it is if we're going to spend 160,000. So you're going to develop with the contractor to track and manage response to homeless encampments. So what do you mean? You're gonna like GIS so you know where they're going to? Or I mean, I don't. What's this do? I mean, we know you can go out there visibly and see in any moment in time and see what's there. I mean, so what do you mean you're going to track them?
Yeah, so I can tell you my non-techie response to that, and then I think Rami might be on the phone who can provide maybe a little bit more detail. But the prototype, for example, tracks when the county is notified of encampment, whether that be through your offices, through 311, through the public, it details what that camp is. Is it include vehicles? Is it tents? Is it structures? How many people are there? Where is it? Is it in the public right of way? Is it in private land? What kinds of activities have we sent out the DHA social workers? Has DHS gone out to the public health nurses? What offers of services have been made and accepted by clients, and where are clients in the process of moving out of shelters? As you know, we get a lot, and the camps change a lot. So this will help us be more responsive to constituents, to your offices, and to frankly to the people in encampments, so that we can better prioritize the resources we have and get out to the encampments quicker. So it's probably technologically much more complex than I made it sound, but it's a pretty robust tool that will also allow us to pull out regular reports to share with you and the public.
So it's an open page where county departments, our contractors, other partners can go in and input on particular locations. So if it's 10,000 home way, you're going to have data regarding that and all the things you mentioned and maybe others. Is that right?
Yeah, I think that's fair. It's web-based. It would be limited to county staff and county contractors, but we'll be able to extract data and report it out.
Okay.
Supervisor, the only thing I would add to what Emily said is, you know, as we've increased our effort with encampments, we've been recording information about our activities, but it's been very clear as we do more and more of it that we need to have a stronger approach to that, be able to record what we do, who we've contacted. It's really important to document those kinds of efforts. So that's really what this is all about.
Thanks, Bruce. Thanks, Emily. Okay.
And I think that completes my slides, and I was going to pass off to Michelle Cajellas, I believe.
All right. Thanks, Emily. Okay, Michelle, you're up.
Chair Anatoly, can I just say make one?
Sure. Yeah. Super Desmond. I'm sorry. Go ahead.
Yeah, I'm sorry, and I know it's late.
No, go ahead.
So, you know, I'm talking to our county exec and Emily here a little bit. You know, we've had a lot of discussions about, improving our coordinated entry and just coordination in general. And it seems like we're creating a lot more programs, great programs. These are all great things, but I hope we're looking at avoiding more silos and fragmentation, and hopefully everything we're doing, both us and the city of Sacramento, we will see more coordination as a result of this, right? I mean, as we're going through this process. I just want to throw that out there because I know that's a major problem we face. Emily, I know you and I have had many conversations about it after our trip, during and after our trip. So thank you.
Yes.
Well, just one follow on though. So we're going to do this with ARPA money, but maintaining the database beyond the budgetary time frame for ARPA. So, and maybe I heard somebody say it earlier on that we will evaluate because, some of this isn't just one time. It, maybe initial expense is covered here, but these tools will have to be maintained and housed in somebody's department. So I would hope, again, maybe to your point, Supervisor Desmond, that, as we're putting these things in place and certainly seeing their efficacy and their good outcomes, that we don't get caught up in, well, the money went away, so we can't do that anymore. County's been there and had that discussion innumerable times. So I guess maybe I just turn to Ann. Are you looking at that context? Are we going to come through the lens that some of these things we're probably going to if they prove out and do what we want them to do and help us do better, that we're going to, consider them for future funding?
Yes, we will absolutely have to do that. As you can see from the projects before you today, not everything is a one-time fund. Right. Some of these things are ongoing expenditures, and we will definitely have to address that in future budgets post ARPA funding.
Thanks. Okay, any other questions? If not, Michelle, it's 8:10 p.m. You didn't know you were going to come on so early, did you?
Good evening, Chair Natoli, board members. We've got a couple of projects. Could you go to slide 19, please? We've got a couple of projects coming out of Child, Family, and Adult Services. The first being academic supports and school readiness. And this project addresses the negative impact of the pandemic on the academic achievement of foster children. As you all know, foster children have historically been behind their non-foster peers in educational outcomes and are less likely to graduate from high school, which impacts longer-term outcomes. While the pandemic and resulting school closures impacted all children in our community, we believe it further exacerbated the unique challenges that children and youth in foster care face. These kids who've already experienced the trauma of abuse and neglect, experienced increased isolation, uncertainty, and anxiety brought on by the pandemic, as well as disruptions to normal routines, including visitation with family members. While our team did everything possible to support children, youth, and families during this time, we know that there were challenges with technology, as well as helping our kids navigate through the remote learning environment. Of significant importance is the fact that remote learning also did not replace the supportive environment of school campuses, as well as connections with friends, teachers, and other school personnel. So this project will fund services and supports for these kids, including initial academic assessments to determine where they are, tutoring services, academic reassessments, referrals to community supports, and enrichment activities such as after-school programs, homework clubs, school sporting events. This project will also engage and support parents and caretakers. Our hope is that by the end of the project, we will have assessed academic performance of foster children in grades 1 through 8 in five districts that have the highest number of foster children, and provide the services and supports needed to help them perform at or above grade level. The total project cost is $1.2 million. Next slide. Oh, go ahead.
Before you leave, yeah, this is Dawn. So a couple of questions. One is you only look at, we've got nearly full 6 months remaining in this fiscal year, and certainly half of a school year, and you only look at expending $100,000 for the first 6 months. I don't know, when is the other 1.1 million? You gonna spend all in the following year, or is this a 3 or 4 year project? What's the term of this?
It will go as soon as we can get started, because we will have to engage in competitive bid process through the end of ARPA timing, which December of 2025.
So you're looking at this being roughly a 3-year plus timeline. I'm curious, we talk about foster children. What about homeless children that may still be with parents but are not necessarily in the foster program? Is there some consideration, and maybe there is later in what you're presenting, but I think about kids that, for example, the families of St. John's, the families that we've got, I know other small organizations that work with, foster families, foster children, but also those kids that are at risk. You look at, Mustard Seed School and some of the other providers of service. So how does this fit in with that? Because again, the foster is a particular segment, and got, thousands of kids that we touch, but what about homeless?
This one addresses primarily foster children. There are a number of existing efforts to help with educational achievement for kids. So we will certainly reach out and partner with other efforts currently taking place, including those that are already in existence for foster children. But also, we know that many school districts provide services and supports to homeless children and families in their districts.
So they would be eligible for this funding pot or no?
Not for this one. This one's specifically targeting foster children. And we'll assess to see, we've been continuing to reduce the number of children in foster care, which is a good thing. So we can also assess as we move forward, and if there are other opportunities to serve other children, we'd be happy to consider that.
All right, thanks.
Next slide, please. Thank you. So this project would fund community-based family support navigators to connect parents and children to critical services such as home visiting, health, mental health, dental services, transportation, and address basic needs with the goal of supporting and strengthening families in geographic locations hit hardest by COVID-19. Navigators will work with families to complete a family needs assessment and determine the extent to which COVID impacted their health, mental health, housing, financial status, and overall resilience. Navigators will also use a closed loop platform called a closed loop referral platform called United Us, which will allow them to track families and confirm whether or not they actually access and receive the services that we connected them to. They'll use other resources and referral services available in Sacramento County, including 211, sacfamilyhelp.com, Help Me Grow, and the county's multidisciplinary home visiting coordinating collaborative. We want to make sure we're not duplicating services. Child and family serving agencies across our county should see an increase in the number of families reaching out for their services, increased overall participation in everything from home visiting to housing assistance programs, nutritional support, early education programs, and other services. Funding is limited to the 3 years covered by ARPA, after which it's anticipated that agencies will have reached and connected high-risk families to connect them to safety net services, concrete supports, and other areas of need. Total project is just above $3.9 million. And that is the end of my presentation.
Okay, questions for Michelle? See any hands, Michelle? I think you get off easy right now. Stand by.
Okay. Great, happy to provide any additional information. I'm passing this on to Sylvester Fadal, Director of DPS.
Okay, Sylvester, you're up.
Thank you, Michelle. Good evening, Mr. Chair and members of the board. Sylvester Fadal, Director of Personnel Services. My presentation tonight essentially covers the funds to augment human capital support for county COVID-19 vaccination and testing program administration. While the impact of COVID is very well known, the kinetics of the pandemic is candidly unknown in view of the various mutations we've seen over the last few years. Currently, DPS has one staff member who manages the COVID compliance and general administration. This temporary support that will be provided by these funds would help ensure compliance with governmental regulations, increase customer service support to employees, supervisors, managers, and also assist with auditing our records that is required by governmental regulations. We also will be providing support to other department coordinators in the enrollment, disenrollment, and the managing of leaves of absence, reporting, and a variety of other related functions. Over the past few months, we've had an increase in number of requests for support from the departments, and we really haven't been able to meet those demands. So hopefully with the addition of this temporary staff, we should be able to meet those demands and be able to meet the level of compliance required by the government. We have Cal OSHA emergency temporary standard ETLs, we have the CDPH, we have changing governmental regulations that seem to evolve by the day, and there seem to be a variety of areas where compliance is required. So hopefully with this fund, we'll be able to not only meet those compliance requirements, but be able to at least place most of our county employees at ease by increased support in their efforts to help mitigate the spread of COVID. I only have one presentation tonight, and that essentially wraps up my presentation.
Okay, thanks, Sylvester. Any questions of Mr. Fadal? Okay.
Thank you. I believe the next presenter would be Marie Wooden.
Okay, Marie Wooden. Marie, you're up.
Okay. Good evening, Chair Natoli and members of the board. I'm Marie Wooden, Director for the Environmental Management Department. As part of the economic response category, I'll be presenting the retail food permit fee waiver. This project would bring economic aid to the retail food businesses by waiving the annual operating fees from the Environmental Management Department for 1 year. The amount of $6,820,000 would help approximately 7,161 businesses in Sacramento County. Eligible retail food businesses include restaurants, bars, school cafeteria, cottage food operators, caterers, food banks, mobile food trucks, snack bars, and retail markets up to 15,000 square feet. An automatic fee waiver would be applied to each future invoice when the fee becomes due, providing a credit equal to the fee when the program is implemented. This project will focus on assisting the retail food businesses that have been disproportionately impacted economically by the pandemic and ensure that these businesses maintain the necessary environmental health operating permits critical to safeguarding public health and safety. In response to the local and state COVID-19 health orders, these businesses have been directly impacted by restrictions to their operations while trying to adapt to the many layers of change. Since the beginning of the pandemic, we have documented 594 permanently closed retail food facilities. This project would provide much needed economic aid to the owners operating retail food businesses, which are vital to Sacramento County communities and the economy.
Okay, thanks, Marie. We have questions about this from board members. I don't see any hands. Marie, what's the average? Again, maybe that's tough to know because you have different categories, but what would be the average benefit to one of our 7,000 plus permittees?
Well, a restaurant fee typically runs about $1,600 a year. So they would benefit that much regarding a fee waiver.
So just real quickly too, you show the FYI or FY 2021-22 as being 2.1 million, and then overall, I guess the other 4.7 or 4.6 something would be in the following year. So this would go from what, January to this January of 22, all the way through when? Through January 23 or June of 23? When would it?
It would go for, it depends on when the program would be implemented. So for instance, if we received the funds in March of this fiscal year, it would go through March the next fiscal year. So each retail food facility gets one bill, one invoice per year. So we would just cycle through for a year, whenever the program started.
And if you had a business that had a particular hardship, but what, you know, say that they were supposed to pay next month and they were having a hardship, might not be around. I mean, $600 might be a difference between them making another month and getting there till next year or not. So are you going to have some ability to kind of sort that out, or is it just basically whenever you get the money, you'll start from that period going forward?
That's what we plan to do. Whenever we receive the money, that's when they receive their bill. So it's that time period. We have to apply it to the present fee that comes due.
But if the board were to approve this tonight, you're only in the second week of January, so you really haven't got much into the fiscal, even to the calendar year.
Correct.
And the money's already on deposit with the county. So I'm just curious if we could, you know, I think some of these folks are going to need it sooner rather than they are a year from now.
Yeah, it's whenever we can implement the program, whenever they transfer the funds to our department, then we can begin.
So I would just note, this is more for Marie, but maybe for Ann or whoever, but you know, it seems to me if we're looking for immediate impact rather than March, we've got the money on deposit. Obviously, there's some floating revenues within the departmental framework. It would seem to me, you know, if the board were to approve this tonight, that the money is available. So, you know, it's a matter of transferring to the department. You could even go back a week or two. I mean, we're only, you know, January 11th, maybe January 12th, we're done here. But so I guess, Ann, I would just ask, it might make sense rather than have this, you know, it's going to span a year, but let's start it out. We're right at the beginning of this calendar year. Why not make it from January to January versus March to March? I don't know if that's feasible or not, but. I don't know if you're on mute, Ann. I don't know.
I'm sorry, I was on mute.
Yeah.
I said, I don't know if that's feasible or not, but I will commit to you that we will look into that. But we do have to pick a date, but we could look at.
Okay, I just think earlier implementation.
First.
Yeah, and if we have the money and there's
Sure.
enough float within the department for a few weeks or whatever. So, okay, I guess I'd like to take a look at that, but anyway, all right.
And if as I'm thinking through this a little more, if you do approve this today, we would likely, Lisa might want to weigh in, but we would likely need retroactive approval if we were going to go prior to today's date.
Lisa says, I mean, we go back just 10 days, basically, right?
Well, I mean, the board can direct staff that anything paid by X date can either be refunded or credited for the next year, however you want to do it. I don't have an issue. There's nothing legally wrong with the retroactive situation. It just the board has to approve it or direct staff.
Right.
Yep.
I guess my colleagues, any thoughts about that? Again, you know, that was just my thinking, is that we implement this as soon as possible. And if we're going to go forward with it, and that, you know, January of 2022 is a whole lot different than January 2023. So Phil, you got your hand up.
No, I'd be very supportive of that. I think it makes a lot of sense.
Anybody else?
I concur, absolutely.
All right.
I would just ask from an operational perspective or situation, if Marie and your staff can refund people that have already paid. For instance, if we do make it retroactive to January 1st or whatever the board decides, if there's any operational concerns with that.
I'd have to discuss that with my finance manager, but it doesn't seem unfeasible because it's just a short time period.
Right.
Okay. All right. Well, I'll take that as some general direction for at least from consensus amongst the board members have spoken out. So if we can do that, I think, again, the earlier relief, the better, and appreciate the, you know, I know there's probably a little bit of scrambling on the administrative side, but I think it will be greatly appreciated. All righty. Anything else on that one? If not, Marie, did you have any other?
Oh, Sorry. No, I don't have anything else.
Okay. Okay, very good. Thanks, Marie. Who's following you?
That would be me.
That would be you. Troy, you didn't get an introduction, so it's going to be you.
Good evening. It's
Mr. Gibbons.
Troy Gibbons, Director for the Department of Economic Development. Thank you, Marie. Marie introduced the first item of 8 in the economic response component of our funding mechanisms. If we could get the next slide, please. Thank you. So the first component of this next tranche, which is item 2 in ours, we have projects, an amount of $325,000. The project will provide direct grants in the amount of $25,000 each to 13 chambers of commerce for operations dedicated to supporting and advocating for local business recovery and success in the unincorporated area. This is really a hybrid, Supervisor Cerna, to your point. We have several chambers that are countywide that we're supporting with this effort, as well as geographic chambers within the unincorporated area. This is really in recognition of the critical services that chambers provide and can be used for business support, staffing, marketing and outreach for COVID-related needs, supply needs, and other federally qualifying uses.
Troy, question for you.
Yes.
So the 13 chambers, I don't have a list, and so I'm not, but for example, I'll give you 2 examples, maybe 3, but you know, in the city of Ileton, you have Ileton Chamber of Commerce, but it's not just in the city. There are marinas and other businesses that are outside. And in fact, Ileton didn't get any ARPA money, so I wanted to ask about that later this evening. But in the Galt Chamber of Commerce, yes, it has probably the primary membership in the city of Galt, but there are businesses in the Herald and Outline west of Galt that are part of that, small businesses. And even though, I think about Elk Grove, not dissimilar, maybe Rancho Cordova too, where there are businesses that lie in the unincorporated area. So are all those chambers on your list, or are they all excluded?
So as I had mentioned earlier, it was a hybrid. We had the methodology of focusing on the geographic areas that were predominantly served by the unincorporated area. So the geography base were Carmichael Chamber, Fair Oaks Chamber, the Greater Arden Chamber, the North Sacramento Chamber, the Orangevale Chamber, and the Rio Linda Alberta Chamber. It also includes constituent-specific groups as the Greater Sacramento Vietnamese American Chamber, the Sacramento Asian Pacific Chamber, the Sacramento Black Chamber, the Sacramento Hispanic Chamber, the Sacramento Metro Chamber, the Sacramento Rainbow Chamber, and the Slavic American Chamber as well. So that would be 13 out of the total 23 chambers. Supervisor Natoli, the 2 you mentioned were not on that list because of the primary geography that they serve. If you opted to include all 23 based on this amount of funding, it would drop each allocation by about $10,800. So we could fund all 23 at $14,130 a piece based on your, if I understand your potential proposal and what, based on kind of surmising Supervisor Cerna's earlier comments about addressing both city and county related P-bids and chambers, that would be 23 at $14,130 a piece.
Well, and maybe a reverse of that would be that, again, you've got these, you had general allocations for the, for the categories here, and you're working within that. But I guess one of the things I would look at, assuming that, they met the criteria, would be you would provide $25,000 to those chambers as well, because again, or, whether it was Galt or Ileton or Elk Grove or Rancho Cordova, or I guess there's still another 5 or 6 that, someone could rattle off for me as well. That if they're, as long as they meet the criteria, because, they're not exclusively just serving the incorporated areas that they may be, based in. And, I can tell you for a fact, I know the couple that I mentioned have businesses, small businesses that are, in the unincorporated areas. I would, be willing to, bet on that strongly that they do, but have a network, again, assuming they can meet the criteria. So I just raised that because, again, I think this is a good idea. I think it's important. And, this small business supporting programs, but, just to call out the 13 and leave out 10, even with.
Well, and we have, for instance, those located in the city of Sacramento, and we know that the city is going forward with their funding potentially on the 25th. And we expect our partners in the cities to be providing some ARPA options for those entities as well. We want to make sure we're coordinated and perhaps not overlapping, but that may or may not be a policy consideration for your board.
Again, I would be interested in us taking a look at those. Again, I didn't know the list until you just read it, so I probably should have asked in my briefing yesterday, but I think it's worthwhile parsing this a little more. And again, I would certainly argue from the standpoint of Ileton, where they got no ARPA money, so they're not getting any money from the city. And we have businesses that are clearly in the Delta, up and down the Delta, that are part of that chamber. And so I think, looking at the allocation increase to the pot of money here, commensurate with, if we add 6 or 7 more back in, rather than cutting the allocation for those that were already contemplated, just to add this amount. So that would be my thought. Supervisor Desmond, I think, and then Supervisor Cerna looks like have a hand up.
Thank you, Supervisor Natoli, or Chair Natoli. Yeah, no, I think it requires some parsing. I am always really sensitive to if we lowered the allocation to each of the chambers in the unincorporated area, yet we find out the ones that are in incorporated cities got both this allocation and an allocation from their city, right? I mean, they're at a disadvantage already at times being in the unincorporated area. But like with Ileton, you're right, that's a different story because they're not getting an ARPA allocation. They don't have an opportunity. So, I'd be willing to have that discussion as well to maybe up the amount totally and parse it out a little more, like you say.
Thanks, Rich. Anybody else? So Troy, you're going to keep moving through this. Would you be able to then determine that? I guess you could, you're in contact with those chambers to see if they got money from their respective cities, like Elk Grove or Rancho Cordova, Folsom, obviously Citrus Heights, they all have, their own city governments, but I'd be, curious to look at those chambers and see if they're serving, maybe it's an apportioned amount too. Maybe they got some already, but they're still serving, portions of unincorporated area, business communities, whether it be in rural or suburban or outlying areas. Again, without giving you too much work on top of what you're already doing here. And I don't know how $25,000 was arrived at as to be the right number. So, I mean.
It was done in concert with the rest of the allocations that were proposed. Part of the methodology was, again, we have some that are focused on the unincorporated area, and some of these have impacts countywide, like the EMD component of this on the retail food side. Obviously, those restaurants and other food service entities are located within the entirety of the county. So that includes all of our incorporated areas as well. It's a benefit to businesses, those retail food establishments countywide, minus the exceptions that Marie had identified. Some of these that we have, in addition to this, will cover an arts component here in the arts area, which would be countywide as well. And then we have some that are more specific to the county's unincorporated geography as it's proposed now. If I'm understanding your concerns, you have stated that you would like to potentially look at a different methodology that would raise up all of these to an equal amount. It would require some shuffling of some of the potential allocations here tonight.
Well, let me be clear. I wasn't suggesting you cut anybody's allocation.
No, I'm not. I didn't perhaps communicate that correctly. So what it would do is it would require a shuffling of this, or we would have to work with Amanda's office to see if there are additional funds out of the percentages that you had allocated in the previous meetings.
And those percentages, I would assume, are targets. If you added a couple $100,000 to the pot here on the order of magnitude of a total of $150 million, and we do it for economic piece, I mean, they're kind of splitting hairs here a little bit. I mean, it's significant dollars to whoever might be the recipient here. And that, that's just a board decision, obviously. But I mean, if we're so married to those percentages that if we're having this conversation, that looking at a couple $100,000 that would go to another, half a dozen chambers of commerce, if that were justifiable, that seems a little bit.
I'm not suggesting that we don't have the ability to do
No.
that. I think we would just need to understand what your direction is on that.
Okay, so I don't know if again, I don't want to bog down the presentation. I know the hour is late, but if before we conclude tonight, my colleagues, I heard Supervisor Desmond weigh in, if others have any thoughts on this, but so that you could have some direction, Troy, going back on this, through you and the county executive, obviously. But I think I made my point, and I'd like to have us take a closer look at those that weren't included in this funding recommendation. And I'm not looking at cutting anybody's allocation here or taking anybody off of this list. I'm just looking at adding to it potentially. So.
Understood.
Okay, good. Okay.
Supervisor Natoli, could I make a comment?
Sure.
I think what Troy is also getting at is, of the $19.795 million that was allocated to this economic recovery out of this tranche of money, with the programs that Troy is going to be presenting to you today, there's $51,176 remaining out of that allocation. So we can absolutely do what the board wishes, but because we do have these funding allocations that the board approved, we would have to reallocate from one of the other strategic areas to cover this. And we can absolutely do that, but it will be necessary to do that.
Okay, well, and maybe I can make this easy for everybody involved then. If we get down to, and there are chambers that are in large part, serving areas that are in District 5, you can take it out of, after you spend the 51,000, if that goes into the pot here, I will commit to do that, but get it as a part of this so it doesn't get delayed. So I'd be happy to do that. I mean, I'm talking about a very limited number, and I think, again, if we can make the, justifiable determination, then I'm fine with that. That would help, the problem you just cited. I have no problem with that. So, okay.
Understood. Thank you.
Okay, good. Thank you. Okay. All right, Troy, go ahead. You're on mute, Troy.
I apologize. Next slide, please. So this component is projected total project cost of $250,000, all to be proposed from ARPA. This project will provide direct grants in the amount of $50,000 to the 5 PBIDs located in the unincorporated county. It was developed under the same methodology that we had just talked about before. Based on our recent assessments, those county PBIDs support 1,870 businesses and about 803 property owners. This is in recognition of both the change in work and the volume of work related to COVID-19, including property maintenance for businesses that had been closed during portions of time of the pandemic, increased security needs, inability to raise funds, and to assist businesses and property owners with the pandemic as it related to health orders and the changing health orders in the earlier parts of the pandemic process. Businesses can use this for, or PBIDs can use this for business support, for staffing on COVID-related items, marketing and outreach, again, supplies and other federally qualified uses. Now, this particular piece, again, I had mentioned the same methodology. So we had 5 that are located in the unincorporated area. It includes the 80 Watt District, the Antelope Business District, Carmichael Improvement District, Florin Road Partnership, and the Fulton Avenue Association. There are 18 overall PBIDs based on anticipating perhaps some of your questions as it relates to some that are located completely within incorporated cities within the county. But again, our methodology was they would be coordinating with their economic development partners within those cities and looking at the potential of tapping into ARPA funds related to funneling through those cities and their economic development departments. And because our timing is different when they're going to their various jurisdictions and their bodies for approval, we don't have a full slate of who's going to be receiving funds and who's not going to be receiving funds.
Supervisor Kennedy, you have a question?
Thank you, Chair. So this is similar questions as you've been peppered with already.
Yes.
So at least 3 of the PBIDs that are in District 2, for example, are in the city and the county. So how does that work?
That's correct. So the same methodology that I described earlier about the preponderance of the properties and businesses, if they were within the city and it was administered by the city, we didn't include it in this list. If they were administered by the county and the majority of their properties were in the county, then we included it on this list.
What do you mean by administered by the city or by the county?
So if the taxes were collected and administered through the city jurisdiction, then we left it off this list for consideration and would be coordinating with the cities and seeing that they would be moving through the process and allocating potentially ARPA funds through that jurisdiction.
Okay, thank you.
Thanks, Patrick. Any other questions? We're at this point. Okay. All right, Troy, continue.
Thank you. If I could get the next slide, please. So this particular project is a partnership with the City of Sacramento for arts and nonprofit cultural grants. This is a $2.2 million total cost, budgeting about $2.1 million of that in fiscal year 21-22. This is to provide direct grants in the range of $5,000 to $100,000 to up to 300 arts and nonprofit cultural organizations throughout Sacramento County that have been negatively impacted by COVID-19. So this is really a situation recognizing that we've had a number of arts and cultural groups that have been impacted with the inability to provide programming, the inability to open, they had shuttered venues, and that has been a significant impact to this segment of the economy. So in partnership with the city, and the city will be putting in a matching amount of funds, we would be providing these funds through a grant process that would be administered through the city countywide, including all the incorporated cities. Arts groups would be eligible to apply for these funds. And again, we would be partnering with the City of Sacramento on this particular component. I'd be happy to answer questions.
Yes, Supervisor Kennedy and Supervisor Desmond and Supervisor Kennedy. I'm sorry, I got the order ahead.
Is that, oh, okay. Thanks, Troy. No, this is great to support these organizations. In the detail, I saw there that it's going to be a contract with the City of Sacramento's Arts Council, I guess, to administer this.
That's correct.
Is that accurate?
You would be establishing a panel that would have county representation as well to review proposals and again, this would be countywide. So
countywide. So, and the city's putting matching the funds, I think you said. What about the other cities that are going to
We've approached other cities and have not been successful in securing funds up to this point.
So how do we handle something like that? I mean, are the City of Sacramento and the county going to team up to fund arts organizations and other incorporated cities who elected not to contribute towards this effort?
As the proposal stands now, they're not precluded from participating, but as it stands now and as we stand up the program, we would certainly re-engage with them and invite them to participate and would welcome their participation. But as it stands now, it's just the city and the county looking at this countywide effort.
No, I get that, but I'm saying, so if an arts organization in Citrus Heights applies for this, they'd still be eligible for the grant, even though their city elected not to participate.
That's correct, as it's proposed now.
I'm not sure that seems fair. If it's being funded by the city and the county, the City of Sacramento and the county, I don't know what my colleagues think, but because they have the ability to do that with their ARPA allocation if they elect to do it. Is that right?
They would, that's correct.
Okay, we have any other questions, Rich? I think your question you put forward though is, is that fair? I think some of this has historical background with the cultural awards program that used to be the city and county, but anybody was eligible in the county. We kind of got a divorce on the Arts Commission with the city a couple of years ago. We really don't have any parallel organization that rests in economic development. And we've now piggybacked with them to do the cultural grants program, which are eligible organizations throughout the county and city. We put money into that through our TOT. So I don't know if this is.
That's correct.
Yeah, similar. So that may be how we get to this point, but fair question. So, okay, Supervisor Kennedy.
I don't see the city of Citrus Heights being willing to, fund an arts organization in the unincorporated county, that's just how I look at it. I know we have this city county tension all the time, and this certainly it's on stark display in this conversation. All right, thank you, Chair. That's all.
Supervisor Kennedy and Supervisor Frost.
Yeah, for this particular one, and I thank you for doing this. Did you give any consideration to utilizing or going through Friends of the Arts, which is a nonprofit countywide, but already has those relationships?
As far as engagement with the other jurisdictions, or I'm not sure I understand.
Well, I mean, we're kind of letting. I mean, we're having the city's going to manage this for the most part, right?
That's correct. We'll have participation.
I mean, I guess
yes.
Yeah. Well, I guess my thought was that Friends of the Arts would be a countywide. Granted, a lot of their reach is in the city just because the nature of the arts, but instead of going through the city, I was asking, did you give any thought to going through Friends of the Arts?
Now, this was a partnership that we developed in concert with the city, but we can engage and reach out to that group as well.
Okay, I'll give you the contact information.
Thank you.
Thanks, Patrick. Okay, Sue.
So I was just going to say, for many years we had, been working in partnership with the county and the city on the arts, which serviced the entire county. And that was part of the conversation. Like Folsom has the Harris Center, and there's all these wonderful, there's other areas outside Sac City, and I think Sac City knows that. They've met and extended themselves to be a part of, growing the arts in the entire county. But I'm assuming this is going to be based on the quality of the projects and who it serves, something that serves the county as a whole.
Yes, I would describe it that it will be a competitive process, and there will be, we suspect we will be oversubscribed. So we'll be working on an equitable process that would allow us to reach as many of these organizations as possible.
Thank you, Troy.
So is the total pot is 4.4 million?
That's what you said? The city will be matching our contribution, correct?
That's how you get to 300 potential arts and.
That's correct. That's the target. We'll have a better sense of once the actual applications hit the street and so forth. But I'm guessing with the number of organizations that we have, that there's the potential that we will be oversubscribed.
All right, well, some good comments here. Supervisor Kennedy, Supervisor Desmond as well, Supervisor Frost. Okay, let's keep moving then.
Thank you. If we can get the next slide, please. So this particular project is a small business and nonprofit grant. Its total project cost of $7.5 million. This is in order to provide direct grants of $5,000 to 1,500 small businesses and nonprofit organizations in the unincorporated Sacramento County that have been negatively impacted by COVID-19. This would be eligible for supporting payroll costs, cost to retain employees, mortgage, rent, utilities, other operating costs that are consistent with the federal requirements. This is, as we all know, small businesses have experienced some of the most significant challenges due to the pandemic, including periods of shutdown, declines in revenue, increased costs, and workforce challenges. And this is to help bridge that until they're in recovery mode, and hopefully in full recovery mode as we advance through the pandemic and hopefully get out of triage mode and into recovery mode. So I'm happy to answer any questions.
You just received notice from the state with almost $2 million in micro grant monies
That's
how does that, so if somebody got qualified for that money, they couldn't qualify for this?
No, they would not be mutually exclusive.
Would not.
Potentially qualify for this. The micro grant component piece is not part of this program. It is separate state monies. It is five employees or fewer, $50,000 in revenue or less. So it's a very niche component of that, and we'll be providing about 700 of those grants countywide through a process as well that the state will require us to run concurrently to this process because we can't mix and match the monies.
It would seem to me that it would make sense. We talked about helping chambers out, but the chambers are part of that network that, and you've got some, some of the larger chamber efforts on your succeeding pages here. But it seems to make sense that you would take that micro grant and this program and work with those chambers of commerce, not necessarily task them because you're going to give them $25,000 to assist them. But there are natural partners in this. They have contact with those small business people as part of their chamber network. If nothing else, they have probably a better reach than we have.
I would agree with your assessment, and that's exactly what we've done. In this process, the state requirement, to set aside the ARPA for a second, the small business component of that requires us to have 3 partnerships, including we have the Metro Chamber, the SAC IEDC, and one additional partner through the Cal Hispanic Chamber. So we have those requirements as part of that grant program. They have the outreach and competitive piece of that. We also have CalCap included as our 4th partner on the state the micro business component of that. As you'll see in the next couple of slides here, to your point, Supervisor Natoli, the funds that we're recommending to be granted to the Sacramento IEDC and to the Sacramento Metropolitan Chamber will be used as partnership support to go out and do the outreach that you're just describing and make sure that we can utilize those networks and help get a broad reach into this program, in addition to providing technical assistance and other things for some other potential funding sources and other things that we'll be contracting with those partners for to provide that type of additional support as well. So it's not only to feed businesses, particularly in some of our most impacted communities, into this program where we'll be we're proposing to grant $7.5 million out, but it will be identifying other needs that they may have and providing additional assistance as well. So we will be utilizing, that is the intent, is to utilize those networks and those organizations that have specialized in this type of work for quite some time.
Okay, very good. Okay, see no other hands, let's continue.
Thank you. So as I was saying, if we could get the next slide, please. In order for the county to successfully implement these and the proposed grant projects, staff recommends that we partner with these organizations that we're just outlining. So it was a very good, timely transition, Supervisor Natoli. Appreciate that. The first is a component for the Sacramento Metropolitan Chamber of Commerce. As we were mentioning, this will be a $1.3 million contract in total. 660,000 of this is proposed to come from ARPA. The remainder will come from other funding sources. But this is really, as I discussed earlier, small business has experienced some of the most significant challenges. The Sac Metro Chamber and the other partners we're going to talk about here in a minute have extensive experience supporting the county's business community, and an existing team of skilled staff who have been providing technical assistance and training to businesses in need since the beginning of the pandemic. So we want to leverage those resources and that expertise. They also have a broad network of nonprofits and community partners and a wide range of businesses that are members within those organizations. And we view them as an invaluable asset to supporting our community development at this point in time. So areas of focus would be business assistance, one-on-one counseling, county program outreach, as you talked about earlier, marketing and communication support, in-language services, workshops, a variety of different things to help not only triage, but advance to recovery, as I've mentioned. And I'd be happy to answer any questions.
I don't see any questions.
The next is the funding. If I could get the next slide, please. Thank you. This is for the Sacramento Inclusive Economic Development Collaboration. This is a coalition of entities that include a number of different chambers it's 15 community-based organizations with extensive business support and experience that would receive a $1.84 million contract. This is to fund operations dedicated to providing assistance, counseling, again, in-language support services, county programs and outreach for other business services that have all been negatively impacted by COVID. This is within our region. The SAC IEDC has expertise and specializes in reaching some of our hardest hit communities and our underserved communities. We would be leveraging those resources and leveraging those networks to help ensure that we get these businesses into this program and eligible for these potential grant funds, as well as the other services that I had outlined earlier. I'm happy to answer any questions.
Okay, any questions? See any, Troy?
Thank you. If I could get the next slide, please. And then this is the Business Environmental Resource Center, which I believe most of you are familiar with. This target population is to serve small businesses and nonprofits as well. It's a total funding cost of $200,000. This is really funding dedicated services to provide counseling, county program outreach, as we'd mentioned before. And we host a large number, a series of webinars that outreach to a variety of different business sectors within the county, the unincorporated countywide, actually. So the Restaurant Association, other specific business industries, to not only continue to update staff and businesses as to the changing environment as it relates to the public health orders and all, but also changing environments as it relates to the regulations and funding opportunities to help get them in to a ready position to hopefully compete for these funds. And I'm happy to answer any questions as it relates to this as well.
Okay. Questions? None, Troy?
So just one or two closing remarks. This would really provide, before I'll hand it off to Amanda, direct financial relief for over 9,000 small businesses and nonprofit organizations if we're specific to the allocations here. So again, if there are any overall questions, I think we've heard your feedback on the earlier slides. And with that, I'll hand it off to Amanda.
Thanks, Troy. Amanda, back to you.
Thank you. Thanks, Troy. So just in terms of next steps in our ARPA process, we will continue to roll out projects throughout 2022. And based on the timing, these projects may be grouped or may come forward individually. Also, the county's website will continue to provide information on the county's ARPA efforts, including quarterly reports to the U.S. Treasury. So our first of those will be due on January 31st. And in coordination with the quarterly reporting to Treasury, we also intend to provide regular reports to the board for ARPA project status updates. And based on the projects that have been brought forward today, we expect that probably the first meaningful reporting period would be the reporting period ending June 30th this year. And then finally, we will be continuing to plan for and develop recommendations for the second phase of ARPA funding. So that second tranche that we do expect to receive in May of this year of another approximately $150 million. I did want to note here, I think it's important that the U.S. Treasury released the final rule for the use of ARPA state and local fiscal recovery funds just last week. And it will really be important for us to understand some of the new guidance, including additional flexibility that is included in that final rule. Looks like there might be a question before I move on.
Yeah, I'm going to get the board member. Amanda, on that, it would be helpful once you get the, the interpretation, I think, to circulate that to board members, please, as to what that final rule, how you, will apply that. It may be technical in some sense, but I think make it understandable for us so we can explain to folks as to, if there are questions that come up regarding some of the things we've talked about this evening, or, as you bring future projects, it would be useful to know what flexibility, if not, is included in that.
Yes, absolutely. Thank you.
All right, Supervisor Kennedy.
Thank you, Chair. A couple things. One is, this might go back to Troy, but I'm a little concerned. It's germinating in my head about the approach we're taking with the P bids. Just again, because we have 3 P bids that we're discounting in District 2 because they have city and county, and so that's a concern to me. Also, we've received some proposals in the past for surrounding food insecurity. Are we still considering some of those proposals to date?
I was waiting for somebody to
We are
chime
not.
in.
I'll jump in, and Bruce, you can add to it.
Yeah, there you go. Sorry, Ann.
We are not considering food insecurity proposals today. We are in fact considering them, but the ones before you today come from the community survey and really trying to focus on the highest priorities as identified by the community. But we will be considering food insecurity proposals.
Okay, that's what I meant. I didn't mean today. I mean, but it is
okay.
Still in the hopper.
Yeah, Supervisor, we have
Yes.
a couple that have come in.
Okay.
That we're actively looking at for bringing forward in the future.
Okay, thank you.
Patrick, I concur with you. That was one of the questions I had too about food security and just some of the various proposals that are out there. And I would just offer one other suggestion that just regular reports with the 25 million that's been set aside in the first tranche for guided projects in various districts. I think it would be important to have at some juncture a status report on that as we're working through those. So, again, you're gonna be working with individual supervisors, maybe RFP processes and so forth, but I think that's an important component and I wouldn't want to lose track of that. And again, certainly recognizing the work that's going to go into, the various aspects of meeting the criteria that we've outlined, but also seeing how that plays out in other parts of the, in the county itself. So, and I think it would be helpful to, at some juncture, to have, an update on that as well, so people know, in full disclosure, how we're using those dollars. So.
Well, thank you. And we will not only be updating the board, but we do have to bring all projects to the full board for approval. So we'll be doing that as well.
Okay, very good.
Yes.
Go ahead, Amanda.
I was just going to add to that yes, I mean, I think we would anticipate reporting for those projects along with all of the other projects. So we could certainly identify, the allocation category that they're related to, but we would report them just as we would any other.
Okay. And if there are actionable items, again, as I certainly have been working with staff already on some of those that we're looking at in District 5. So I'm glad to see, I'd be glad to see them show up on the agenda so people would know exactly what we're working on. One last thing, what about training for vendors and contractors and so forth? Because again, we've got all of the outline we heard here this evening, and working with county departments, agencies, we'll have partners. Who's going to be providing that technical assistance so that, whether they be other public agencies, nonprofit partners, not-for-profits, who's going to be responsible for making sure that people get a clear understanding besides handing them the rules and say, this is what you have to follow.
So your question relates to training subrecipients and other recipients of funding on the use of the funding?
Yeah.
Yes. So so we did anticipate, having some staff added within the Department of Finance that can assist with developing those sorts of programs. I think that the model that we're sort of rolling out for these projects, there's a department, primary department associated with each project. So I think the departments will have a role, and some already have this role with existing federal funding that they have will have a role in providing that training. But I think overall, from a county perspective, we want to make sure that we're providing those resources for departments that may not have them, and sort of looking at that and starting that process right now. I think we would see that as being, an administrative cost associated with implementing ARPA, and we may have some additional recommendations coming forward with regard to that.
Okay. All right. Very good. Thanks, Amanda. Okay. I trust we have some folks that have called in and waited for hours.
I do have just one last slide.
Okay, go ahead, man.
And then I will conclude my presentation. And so this slide is really just showing the recommended actions associated with this item. I'm not going to read them all out, but there is a correction to the third recommendation that I would like to read. So that should read, approve the attached salary resolution amendment, including an amendment to the Sacramento County Conflict of Interest Code, adding 1 FTE limited term Administrative Services Officer 2 position with disclosure categories A, B, C, D, and E in the Office of Economic Development. And that just relates to the necessary disclosure categories to comply with the Political Reform Act. So I wanted to read that correction. And with that, my presentation is over. I'm happy to take any additional questions.
Any additional questions? So let's, Flo, go to you. And do we have folks in the queue?
We do have a couple of callers, and I will ask Lydia to transfer those calls, please.
Okay.
Hi, caller. Please start with your comments. You have 3 minutes.
Good evening, supervisors. This is Clay Nutting with Family Meal. Happy to see some ARPA funding expenditures. I know there are many worthy projects and urgent needs. I appreciate that programs like ours that address food insecurity may be in consideration for future funding, but I wanted to underline the urgency of our efforts. As you know, the restaurant industry has been one of the hardest hit over the last 2 years, and unfortunately, the hits keep on coming. Family Meal has submitted a proposal to the county that not only helps restaurants save jobs and stay open, but also supports local farmers and purveyors while feeding the most vulnerable people in our community. We're not looking for a handout. This is an investment in small business and addressing food insecurity. It's clear that our initiative is aligned with 2 of the 3 strategic investment categories of Phase 1, health and economic response. Family Meal has 20 plus diverse restaurant partners with businesses in every single supervisor district that are ready to cook for people in need as soon as tomorrow. These restaurants are vetted, experienced in feeding programs. We have transportation, insurance, standard operating procedures. We are ready to go. Our program is scalable. The more resources we can secure, the more people we can feed, and the more businesses we can save. The need is urgent. People are desperately hungry and businesses are suffering. Pushing this out any further would cause great hardship to many in the middle of a pandemic. The surge is wreaking havoc on the restaurant industry, our hospital systems, and affecting our most vulnerable citizens. An investment in Family Meal to feed our community is not only prudent, but imperative. I'm respectfully asking the county to reconsider funding our program in Phase 1.
Thank you, Clay. Appreciate your weighing in this evening. Thank you for your ongoing.
Okay, can you send the next caller, please? Hi, caller. Please start with your comments. You have 3 minutes.
Good evening, Chair Natoli and supervisors. This is Brenda Ruiz from the Sacramento Food Policy Council. I want to ditto comments from Clay. Thank you, Clay, for chiming in the importance of food security. At the end of October, there was a letter by more than 70 organizations and individuals that, really asked for there to be equity across all program areas. Included in that letter of asks was also funding to advance equitable food security to build a sustainable, resilient food system. And a resilient food system would support local farms, BIPOC food businesses, garden nutrition and culinary education for youth and families, community gardens, nutritional support for families and seniors in need, advanced strategies to increase fresh foods availability, such as new farmers markets and increased use of CalFresh, and implementation of county policies EJ 12 through EJ 15 through funded partnerships with BIPOC and BIPOC serving CBOs. We are concerned, dismayed, and disappointed that the food security and components that would support a resilient comeback for those that grow, prepare, and serve food in a sustainable way for future generations is not included in this first round. And I'm encouraged that there's a promise in the future, but it's again a promise, and we'll see what happens. There's also, from some of the comments that I've heard this evening, supervisors have been actively meeting with community members and community members with supervisors. And so, if there is an RFA process, or if there is an RFP process, if there is a pathway by which food security advocates and sustainable farming and resilient regenerative farming, climate smart agriculture and equity in food security organizations and individuals and business should be taking, let us know what that is, because from what I heard today, it's, who the sausage making of what it is to have access to dollars. If supervisors are speaking to projects, then, I'm concerned that on the equity end, those that are not connected in these traditional ways of what it is to play politics and get access to dollars are being left out of the system. And when a grant is announced, then it's, the gladiator death match of everyone trying to, get a couple $1,000s here and there. So it just, I'm encouraged that there will be allocations in the future, but today, the food system is left unfunded. And we hope to activate the food system to be more vocal and more proactive in reaching out to you, and as well as the various offices reaching out to us, so that we can be more transparent about these conversations and access to important dollars that are needed in neighborhoods and for farmers and the organizations that support them, and for not only for food security, but also for regenerative climate. Thank you so much.
Thank you, Brenda, for your comments. The other callers?
Okay, and then do we have one more caller to transfer? Yeah, this is our last caller. Okay. Hi, caller, please start with your comments, and you have 3 minutes.
Good evening. My name is Mike Jaskey, representing Homelessness and Housing Committee within SACT Act. I'm a resident of District 3. Today, I'm only addressing 6 housing and homeless projects proposed by staff on pages 5 and 6 of the board letter. Some general items first. SACT Act is concerned that the projects proposed for funding generally lead to multi-year ongoing expenditures rather than one-time investments that will pay off in the years to come. For those projects with multi-million-dollar funding levels, which are projects 1 and 2, there are only quite terse descriptions which provide much less detail than would commonly be the case for projects coming to the board for approval. It's really unclear what precisely will be done with the funding of the 2 big $10 and $5 million projects. Supervisor Cerna's questions about some of these projects, and then the other supervisors that joined in, show there's a lot of ambiguities about what's really going to happen. As the county, now let me turn to some specific concerns. As the county implements CalAIM and becomes an ECM and community support provider for Medi-Cal insurers, some of the expenditures on landlord engagement and rehousing appear to be precisely what Medi-Cal insurers are supposed to pay for and be reimbursed from the state. The county needs to increase the total revenue flow into the county via state reimbursements of Medi-Cal insurers and not use its own ARPA funds for something the state will pay for. The Sacramento County Social Health Connect seems like a good idea, but the basis for assigning 50% of its costs to the housing and homeless ARPA budget seems dubious. There are plenty of housing projects that need the funding that would be drawn down by subsidizing this health effort using the housing and homeless budget. On a positive note, we're glad to see the foreshadowing of housing and shelter projects that page 6 of the board letter says are coming up in the future. So in summary, SACT proposes that the 2 largest program project proposals under the homeless categories, numbers 1 and 2, be deferred pending further information from county staff that actually explains how these monies are going to be used. The 4 smaller projects could be approved tonight. Thank you for your consideration. Good evening.
Thank you, Mike. Okay, is that any other public comment, Madam Clerk?
We do not have any more public comments.
All right, then we'll close public comment on this and take it back to the board. I see Supervisor Cerna has his hand up.
Thank you, Chair. So, like I think some of the other offices received in recent days and weeks from the likes of Clay and others involved with trying to minimize as best they can the impact of the pandemic relative to food insecurity, which I think we all appreciate greatly and certainly applaud the ingenuity that's been applied to work swiftly to see that one of the most important aspects of a crisis like this is making sure people don't literally starve. When I hear members of the culinary field and restaurant owners say that it's who you know when it comes to something as important as food security, I get very itchy. And it's not, I don't know if it's the lateness of the hour or what, but it's very concerning. It's not, I'm not bringing this up to criticize Brenda. I'm bringing it up because it's a legitimate concern of mine that tells me that there's at least a perception out there that somehow the process is more ad hoc than it should be. And so while I too am encouraged, as others have mentioned, about the future prospect of funding insecurity efforts, granted the amount of work that has gone into this first round of preliminary allocations, and kind of regardless of and I say this respectfully, regardless of what community surveys tell us and everything else, I believe it still is this board's prerogative, if we wanted to on the spot, declare that food insecurity is of the utmost importance and does deserve to be immediately addressed. And if there's a good reason why we think that regardless of who's providing which services or applying which creative approach to it, that it's somehow satisfying to us for the time being that people are getting fed and restaurant workers are being taken care of, then great. But I don't know that I've heard that tonight. And it's not, again, it's not to criticize our own staff, but I want to feel comfortable at the end of this evening knowing that that angle of what has happened with much success, is going to happen quickly. No guarantees, I understand that, but I think what we have in front of us is we have a clear, successful program who has been patient, who has certainly advocated strongly and clearly, respectfully with the members of this board, with staff over several days and weeks and months to continue doing the great work that they've done. And, you know, I, for one, would like to see it continue without a pause, without there being a break. And I don't know if that's even too late at this point, but, you know, having had seen some correspondence in the last week or two that tells me that it was kind of on its last legs unless the county responded. I'd like to know specifically if we're not going to have the will as a board to do it tonight. I just don't want to push it off and say it's going to happen later. I'd like to know when it's going to happen. When is there going to be something that comes before us, regardless of whose program it is, that is addressing specifically food security and specifically addressing the plight of our restaurant workers?
Ann, you want to fill that?
Yes, I was just making sure I was unmuted. Well, we can make a commitment to do that very quickly if that's the will of the board. We can work on an RFP process to address food insecurity, and I would have to check in with staff on how quickly we could get that out. Those things do take some time, but we could certainly do that, tackle it starting tomorrow.
Okay, when is our next board meeting, Flo?
25th.
Our next board,
2 weeks.
yeah, on the 25th.
Okay. Could we have something, I assume then, by the 25th, if not, if we don't act tonight?
When you say have something, what do you mean by that? We would not have an RFP completed in 2 weeks, but
okay.
But we could certainly bring forth a plan on what we're proposing to put in an RFP.
So what is the outside date then of what is the soonest, I guess, Ann, that you think you could go through this RFP process and get something back before the board?
Well, that generally takes 6 weeks.
So yeah, that's kind of the, I mean, it's again, not a reflection on you, not a reflection on your staff. It's kind of the nature of the beast. That's not,
we could go.
Yeah, it's
we
just
could
not.
Go back and look at.
Go ahead.
Go ahead.
Go ahead, Ed.
We could go back and look at all of I believe we have a number of proposals in the queue related to food insecurity, and we could certainly go. I mean, I would have to check in with Amanda's staff and Damon's staff around the appropriateness based on Treasury rules on, you know, just moving forward with a project. But we do have a number of projects related to food insecurity that we could pull back out, look at, and see if there's something we could do very quickly.
Okay, without calling for a vote tonight, because I'm not sure the votes would be there, but maybe they would. But if that's not likely and we can't do it based on Treasury rules because we didn't go through a certain process, understood. But I'd like to see us, even if we need to have a special meeting on this, I think it's that important. I'd like us to see us work at hyper speed in the coming days, and hopefully not weeks, to get something accomplished on the food security front. And I'm not, and I say that without identifying favorites, without identifying friends who are in the restaurant business. I think, Ann, you and your staff are well aware of all the various options out there in terms of food security, but that's kind of been a missing theme to tonight, which I didn't hear a lot about. And it's, again, there's so many different things that we have to be responsive to when it comes to this pandemic. I know we have to kind of bite off small chunks at a time that we can swallow, but no pun intended, but food security is just something that is up there with oxygen and water and shelter. So I don't know how other board members feel, but I'd like us to really step on the gas on this one.
Phil, as Supervisor Frost, I'll certainly agree with you. Sue, go ahead.
I just wanted to say that in regard to the food insecurity, I think it's sensitive because there were a lot of companies involved in the program that we had, and then we had to shrink it down and some got left out. And I think it's really important to try to find, to carefully work through identifying a program that can include as many of the restaurants as possible that want to be part of that program. You know, I think the food insecurity is important and the restaurants are important. So I just think it's important not to rush it to the point where it might not be as good as it could have been. That's all. That's what I wanted to say.
Yeah. I would just, thanks Sue. I would just say, Phil, I think there is urgency to this. Again, you know, how we ultimately decide how we might allocate resources to either support efforts that have already proven their viability and or new efforts. I mean, there's a lot of components beyond just food preparation and delivery. There, you know, I think there's a general awareness we're talking about, and I read the reference in her comments, but we've seen it, you know, local farmers, it's the folks that, you know, the folks that work in the industry, it's the recipients, and whether they be disadvantaged and or seniors, or, you know, there's just a lot of components here. Some are more urgent than others though. And I know that I certainly have had conversation with Ann. I've asked her about where we were and understood what she said early in the evening, that it wasn't a part of this package. But I think to your point, it's certainly, as we're still in the midst of this pandemic, in this fourth surge, and folks are, you know, struggling with, you know, what they're seeing in the marketplace as relates to cost of food. And, you know, we patched a lot of things together. We learned some things. And again, I certainly want to commend our staff. I know that, you know, Bruce and others have been on the front lines of this, but I do think that it warrants our attention and focus. And again, if it means us making some other decisions about the, you know, additional direction regarding dollar allocation and or processes, I would like to see us do it sooner rather than later. And, you know, again, not with any particular favorites in this. There are a lot of providers, and I think Sue makes a good point as well, that they're, you know, this is a big county and there's a lot of need, but, you know, how can we, you know, best address at least some of that need in a way that's fair but also timely. So I would concur with your thoughts about trying to get something before us quickly. So
why don't you let myself and staff work on this and bring something to you at the next meeting on the 25th. We'll look at the proposals we have. We'll look at what we can do as quickly as possible and bring something to you. I don't know, I can't tell you exactly what that will be, but we will put our heads together and work fast and furious to figure something out on how to address the food insecurity.
And to Phil's point, just I say we may need a special meeting, because earlier this afternoon I heard that agenda was worse than the one we had today. So we've already been at this 12 hours. So if we need to have an opportunity to set aside either a Wednesday session or whatever, working with board member schedules, just so you don't get, because again, it might be something that requires a lot of, you know, a lot of input. So anyway, I'm sorry. Go ahead, Phil.
No, you beat me to the punch on stressing the import, and at least it sounds like 40% of the board here that's willing to go for a special meeting. But yeah, I think it's that important, and I won't beat this dead horse any further. But I appreciate the response, Ann.
Okay, Sue.
I just wanted to say thank you to all the staff for the thoughtful proposal that you put forward. I know there was a lot of work that went into it, and I'm excited that we're getting a good start.
Rich, Patrick, anything else you wanted to weigh in on?
Well, I'll just tag on with Supervisor Cerna and you, Chair Natoli. I agree with the food security, insecurity discussion, and also as part of that discussion, scoping what the problem is and how size and scope of the problem and the different approaches. So I absolutely agree, and am absolutely supportive of, if need be, having a separate meeting just for that. So.
And I'm on board with that as well.
All right. So any other thoughts or comments? We have the recommendation before us to act on. I think we got different direction, and thank you, Ann, for being responsive on this. I know it's going to require some additional work in a quick amount of time. But then if there's nothing further, then we have an actionable item here this evening. So do I have a motion on the?
So moved.
Second.
I move and second to approve staff recommendation with further direction to come back on the discussion about food security and related items at the next meeting. And with that, I'm sorry.
I'm
Yeah,
sorry, I need some clarity because we had a lot of discussion about the chambers and the P-bids. And are you making a motion, or is it thought to make a motion to approve as staff recommended, or did you want some modifications on the chambers and the P-bids? I just want to make sure I'm understanding your direction.
Mr. Chair, as the maker of the motion maker, I want to be respectful to the concerns that especially Supervisor Kennedy's expressed regarding the geography of various P-beds that do stretch between unincorporated and incorporated areas. And also, I think to Supervisor Desmond's earliest points about just making sure that, you know, we're being equitable about it. And this is coming from someone that represents a very small portion of the unincorporated area. So, but I think I think that has to be part of the understanding with the motion for our staff that I think we need some clarity on that.
What about the chambers, Phil? Chambers of Commerce.
Yeah, and I think that the same could be said for the chambers in terms of seeing, you know, understanding a little bit clearer, at least from the discussion I heard about what's equitable in terms of where the you know, which size of businesses are being served through which chambers, and based on kind of their service shed, if you will, geographically. I think that needs to be clear. At least that's my judgment from what I heard, not being a huge part of that part of the conversation.
Does that help, Ann? That's make the motion, or you want further direction?
I don't, Troy, is that clear to you? I'm a little unclear, but it might be because it's late and.
No, I think if I understood the original remarks, that my interpretation was that there wasn't interest in peeling back support for any of the P-bids, and there was interest in looking at making it equitable and equal across the board, particularly for those entities. If I understood Supervisor Kennedy's direction or request, was to fund those that were split amongst those between the cities and the counties.
Okay.
So I interpreted that as a request to fully fund those that were split between the cities and the counties. And I am also lacking a little clarity on the others, to your point, Ann.
Okay, I guess
let me just make it. So it's to fully fund all of the chambers, which is not what we propose, but to do that, we would need it would be an additional $250,000. And to fully fund the two P-bids that Supervisor Kennedy was talking about would be an additional $150,000. If you wish to fund all P-bids, it would be an additional $650,000.
And I would offer up one clarification on that. That was all chambers.
Okay.
So we've talked about P-bids and chambers here.
Oh, so all of it together.
So the P-bid component of that, it depends on whether the board would be advocating just those in District 2 that are split between the city and the county, or all P-bids. And then on the chamber component, if we were going to fund the chamber component piece of that to the same amount, city, regardless of jurisdiction, that would be an additional $650,000.
650. You had 13 at 325. You only had
So on the
20.
chambers, Supervisor Natoli, there are 23 chambers.
Right, and you're funding 13 of them at 325. How do you get to 600,000?
To fund all 23, it would be, excuse me, I'm sorry. My math was fuzzy. To fund all 23, it would be 575 at the full mark.
But you were going to parse that. You're going to take a look at that. That was the part of the question. I mean, to take a look at it. So maybe come back on the 25th with that. Then I don't know. A bunch of hands here. Supervisor Desmond, Kennedy, Frost.
Thank you, Mr. Chair. So I just want to go on record to say that I hope that this change doesn't result in the P-bids or chambers that are exclusively located in the unincorporated area from getting a smaller apportionment. And I also, I mean, it just appears to me, just in the interest of equity, I thought the discussion was around when we talked about the parsing. Troy, you would look at, for instance, if there's a P-bid or a chamber in a city, it is part of the city's ARPA plans to also fund those business interests. In which case they wouldn't be relying on us, right? I mean, it was kind of in the context of what's going on in Ileton.
Right.
That's kind of what I was thinking. That it would be part of and same with the P-bids, for instance, if they're formed and administered by the city of Sacramento, and the city's going to be providing support to those P-bids, maybe there's an apportionment or something. I don't know what Supervisor Kennedy's thoughts were, but that's just what I was thinking.
Yeah, the only nuance to that is the unique circumstance of like a river district where you have that project turnkey hotel, and there's an argument can be made and has been made that there have been some unique challenges there that are somewhat county involved.
Right, and that was a specific ask from the city in partnership. Yeah, no, I agree with you.
Okay. Patrick and then Sue.
Yeah, thank you, Chair. I'm going to agree with Supervisor Desmond, and that's, I think I'm going to agree with you. Tell me if I'm wrong. In those P-bids that are, well, the specific ones in District 2 that are city and county, if the city is already contributing some of their funds, we can augment it and don't necessarily have to carry the full fare ourselves. But I do think that they should get, something.
Okay.
I believe I understand the direction. It would require us to wait and coordinate with the city to understand what their funding priorities are, if I'm understanding you correctly.
Yes.
And we have, if that's the motion, we can certainly follow through on that direction. If I'm tracking all of that, the city of Ileton, who does not have an ARPA designated component to this, it sounds like Supervisor Natoli was advocating that they receive a full funding allocation. If I understand that correctly, I just want to make sure I'm understanding.
Yeah, again, but what would they do with the money? It needs to be qualifying too. So
Absolutely.
Maybe,
yeah, there would be a template for qualified expenses and so forth.
Right, and if I could, just real quick, I know Supervisor Frost is up, but I would just say that you could reach out to the City of Galt. Did the City of Galt, the ARPA monies, did they fund their chamber? And if so, did it include businesses that are outside the city limits? I don't know. I mean, they're simple calls. I don't know if they're easy to parse out on paper, but that's what I was suggesting. And I think to what Patrick and Phil and Rich have all said, that, it might require a little bit of finessing. Again, we want to be careful with our dollars, but I think be supportive where we can, where there is that either overlap and or a realistic expectation that they're providing some service either in the unincorporated area or to folks that are doing business, maybe dually, but a part of those chambers and or P-bids. So
I believe I have some clarity on that now, and we will be coordinating. And
I sense a matrix in our future.
Yes.
Been looking at it all day long here.
Yes.
Okay.
So I think I have some clarity on whether we'd be augmenting to get up to a full component, a full funding component if various jurisdictions within the county incorporated cities were participating through their ARPA process. And then we would be augmenting that to get parity across the board. The goal to get parity across the board, if I'm understanding it correctly. So we'll be coordinating and doing that outreach. I think I understand that.
Thanks, Troy. Okay, very good. Sue?
And then we're probably, Amanda, you can correct me if I'm wrong, but we're probably going to have to come back unless you're ready to make a recommendation to us this evening about which bucket of money this comes from. We have fully allocated the economic recovery allocation that you approved some months ago. So we would need some direction from you on where. There's plenty of money. I'm not suggesting there's a problem there, but we would want your direction as to where that would come from.
Yes, Anne, I agree. I think we just for accounting purposes need to know where that's coming from.
Yeah. And we don't have to do that this evening. If you would like, we can come back and make a recommendation to you on where that would come from, and we can do that on the 25th.
Yes.
So that's the motion, is to compartmentalize that portion for the 25th.
Okay. All right, very good. Motion is second, but Supervisor Frost, you still had a.
No, Supervisor Kennedy made the point that I was going to make. So I withdrew my raised hand.
All right. Anything else for the good of the order? Ann, is it
So
clear?
I want to make sure that the clerk understands what the motion is, and I want to make sure that I understand it as well. Because we're going to come back on the 25th, hopefully we'll have time to work with all the cities before then on the chambers and P-beds that weren't included in our initial recommendation. So is it acceptable to have the motion be to approve what we have put before you today, and then we'll come back on the 25th, hopefully, to address the other chambers and P-bids and where that funding will come from, just so that the motion is really clean?
Correct.
Okay. Flo, does that make sense to you? Do you
Yes,
have
it
that?
does. Thank you.
Okay, thank you.
That's the motion in the second, and then we'll also come back on the whole nutrition piece and the whole discussion.
Yeah.
All right. Anything further, Ann? Is that everything's clear on the motion? Okay.
Yes.
All right. Very good. So here we go. All right. If there's nothing further, Flo, you got the motion, and we're going to go ahead and call for the vote.
Okay, it's Supervisors Frost,
Aye.
Kennedy,
Aye.
Desmond,
Aye.
Cerna,
Aye.
Natoli,
Aye.
and that's a unanimous vote. And I just want to double check that that was a motion by by Supervisor Cerna and seconded by Supervisor Frost.
Correct.
Thank you.
Okay. All right. Got through 60 items so far. We still got 61. So very good. Thank you, Amanda. Thanks to all of our staff that stayed with us. Certainly, Ann, thank you. There's a lot of presenters and a lot of work that went into it. Thank you for our callers as well. I know the SAC Act wrote a letter and certainly heard from both Mr. Nutting and Brenda Ruiz and other organizations that weighed in. So, moving forward. All right. That brings us to nominations and both our ranks. We can do that this evening if people still have enough gas in the tank, or we can, I guess, could potentially hold that over, but want to do it? Okay, let's do it, Flo.
Okay, so for item 61, this is your own ranks appointments to boards and commissions. You did receive a memorandum that does outline the action that is required. I'm going to be referring to your spreadsheet and everything that's highlighted in yellow. The first board is the Adult and Aging Commission. This is a chair or chair designee appointment. So previously it was with District 4 and they made an appointment. And so now that it's with your office, Supervisor Natoli, I'll let you.
Can I designate the vice chair to do this? Rich, are you paying attention?
I'm happy to, yes.
No, we can hold it over. I think we've actually had folks in the past. So again, it's again, we don't, because of the lateness of the hour, I don't want to make any jest of this. So if you wanted to look at that, we can bring that one back and let Supervisor Desmond, because it's ex officio, and I know they do meet regularly, but it might be that, there may be a staff person that was, who had been doing it this past year, Flo?
So before it was with District 4, so it was one of District
Oh,
4's. Right,
Vance had
so
been
it needs
appointed.
to either be your district or,
Okay,
because that person will be sitting in there until you guys make the appointment.
all right. Well, Vance is there, and I can talk with Rebecca in my office, in all seriousness, Supervisor Desmond. So if you'd be interested as a member.
I'm interested. No, actually, I'm actually am interested in that.
Okay, all right. So we'll hold that over though to the 25th, Flo, come back and that.
Are we holding all of the appointments
No.
or just adult and aging? Okay.
Bill Nagy, unless Supervisor, he's interested, but let him find out what's involved there if he'd like. And
Understood.
all right, area 4.
So then area for agency on aging for the governing board. These are one-year appointments, so I just need to know from each district. Supervisor Cerna, are you reappointing? Maxine Krugman, my vision is literally departing from me right now.
To my knowledge, I am.
Okay, and then Supervisor Kennedy, Miko Sawamura is in there right now?
Reappoint.
Thank you. And then Supervisor Desmond, you have a Carl Burton sitting in that seat as the alternate.
Reappoint.
Thank you. And Supervisor Frost, you currently have Felicia Bay or B?
Oh, I'm not sure about Felicia Bay, and I do not have notes on this. I'm sorry.
We can hold that over till the 25th, and then you can talk about Steve.
I'm not sure about Felicia.
Point of order through the chair.
Sure, yes.
Correct me if I'm wrong, Flo, but I thought in years past, maybe Don, you know this.
Yeah.
I thought we kind of gravitate towards where we see vacancies on this chart, and so we don't have to go through each.
Right.
No, we
name,
actually
right?
go, if the terms are expired in a year, then we go through them at this time every year. So if it's highlighted in yellow, there is some action that needs to be required, either because the term expired or it just changes because it's designated by the chair or the chair designee.
Is it possible to do this at our next meeting so that we have a little bit more time on this?
Sure. If there'd be board preferences, if there's fine, but I asked earlier. So if you want to hold this till the 25th, we can come back and go through this.
I would like to, but I don't know how everyone else feels.
I know the hour's late.
Fine with me.
Yeah.
Okay, all right. So Flo, we'll stop with that and we'll come back to this on the 25th.
Okay, can I have a motion in a second, please?
I'll move to continue it to the next meeting.
Second.
Seconded. All right, no further comments. Call the roll, please.
Supervisor Frost?
Aye.
Kennedy?
Aye.
Desmond?
Aye.
Cerna?
Aye.
Natoli?
Aye.
And unanimous vote. This is continued to January 25th. And then the next item is item 62, which is your nominations. You're continuing to February 8th, the County Planning Commission, Delta Citizens Municipal Advisory Council, to February 15th, Adult and Aging Commission, Area for Agency on Aging Advisory Council, Civil Service Commission, Cordova Community Planning Advisory Council, Casumnas Area Community Planning Advisory Council, Disability Advisory Commission, Equal Employment Opportunity Advisory Committee, Human Services Coordinating Council, Natomas Community Planning Advisory Council, Sacramento County Employees Retirement Board, Sacramento County Treasury Oversight Committee, and the Veterans Advisory Commission. For your matters today, Arden Arcade Community Planning Advisory Council, Supervisor Desmond.
February 15th, please.
Thank you. California Department of Corrections and Rehabilitation Citizens Advisory Committee.
Chief Staff recommend holding this to January 25th.
Thank you. Carmichael Old Foothill Farms Community Planning Advisory Council, Supervisor Desmond.
Continue to January 25th, please.
And Supervisor Frost.
Sue, did you have any nominations for?
Sorry, I was muted. Continue to February 15, please.
Thank you. Community Review Commission, Supervisor Frost.
Nominate Thomas Scott, please.
Thank you. And you have another seat, so would you like to continue the balance or the remaining?
Yes, I guess so.
Would you like February 8th or February 15th?
15.
Okay, thank you.
Likewise, District 5 would continue February 15th, please.
Thank you. And County Service Area 4B, Slough House, Wilton, Casumnes, Supervisor Frost.
Continue to February 15, please.
Thank you. And Supervisor Natoli.
Yes, I would nominate the incumbent Gary Soto for reappointment and also nominate Patsy Nimitz, Nemetz.
And continue the remainder
Yes,
to what day?
February 15th, please.
Thank you. Developmental Disabilities Planning Advisory Council.
Chief of Staff recommend reappointing Patty Pacheco and then continue remainder to February 15th.
Thank you. Maternal, Child, and Adolescent Health Advisory Board.
Chief of Staff recommend continue this to February the 8th, please.
Thank you. Mission Oaks Recreation and Park District, Supervisor Desmond.
Please continue to January 25th.
Thank you. North Highlands Foothill Farms Community Planning Advisory Council, Supervisor Cerna.
February 15th, please.
Thank you. And Supervisor Desmond.
February 15th, please.
Thank you. Public Health Advisory Board.
Recommendation is to nominate Bakalu Amare and then continue the remainder to February the 15th.
Thank you. Sacramento County Alcohol and Drug Advisory Board.
Okay, recommendations are to nominate Maria Padiga Castro as the public representative and reappoint Paul Tanner as the technical representative, and to also nominate Alexis Sanchez as the technical representative.
Okay, thank you. And Sacramento County Mental Health Board. Supervisor Cerna.
Yeah, I'd like to reappoint Maria Pedillo Castro and thank her for her continued service.
Thank you. Okay, and then the last one is Vineyard Area Community Planning Advisory Council, Supervisor Kennedy.
Please continue to February 15th.
Yes, and Supervisor Chairperson Natoli.
Yeah, I would hold mine to January 25th, please.
January 25th. Okay, got it.
We have two applicants. We just need to complete the interviews, I believe, so.
Yes, thank you. Okay, that concludes your nominations, and your next item is county executive comments.
Okay, Ms. Edwards, you're waiting all day for these. Go ahead, Ann.
It's been a day, and I know it's late, but I just want to take a moment to thank Flo and all the clerk staff and the DTEC staff and the Sacramento Cable staff who made this meeting happen today. It was fairly short notice and they pulled this off well. We didn't have any glitches, which is pretty amazing. So thank you to all of them.
Thank you.
Okay.
And then your next item would be your Board of Supervisors comments, reports, and announcements.
Okay, everybody signed up, ready to go? No, nobody's rushing to the floor.
Let me pull out my 15-page script here.
Okay, all right. Mr. Desmond has a hand up though.
It shouldn't take more than 15 minutes.
Very good, okay.
No, quickly, something I just want to bring, I know it's late and I hate to do this, but I just want to bring it up. Right now, I know we're evaluating a lot of different sites to get more capacity online for shelters and safe camping spaces and other places for immediate help for folks who are unsheltered on our streets and open spaces right now. I know looking at a place in District 2, a couple of places in my district, one on the border between District 3 and 4, and some in the city of Sacramento. It's frustrating to me that some of these things take a long time, and I've expressed this to you multiple times. I think we're certainly losing opportunities to help the homeless, especially the most vulnerable, because of some of these delays. I also understand that just, county bureaucracy sometimes moves very slowly, but I just wanted to bring it up in public session here and express my desire that maybe we look at ways we can be doing this better and doing it quicker, so we can not only take advantage of these opportunities as they come up, sometimes from private property owners, but to help people quicker. We are, as you know, in such a huge acute crisis right now, and I'd certainly welcome any innovative ideas, even engaging more with maybe the private sector to help. So just wanted to throw that out there.
Thank you. And yes, we have talked about that, and Mr. Wagstaff and I have been talking about it, and we are certainly looking at ways to move this along more quickly. It's there are a lot of moving parts to it, but I hear you loud and clear. It is an emergency.
Thank you.
Thanks so much, Desmond. Okay, Phil, 15 minutes.
Yeah, I just wanted to add to that when and if we do hear something back in the not too distant future about how to do it better, as Supervisor Desmond, I think, rightfully points out, I would just respectfully ask Ann and Bruce and everyone else, be super forthright and candid with us about what it is you need. I don't think there's any of us that expect, any aspect of county service delivery in the middle of a pandemic, especially after almost 2 years of it, to go out and pull off miracles without a really honest understanding between the board and executive staff about what resources, whether they be human or budgetary, whatever it is. This is the time to kind of just be very candid with us, and even if it it gets met with some wide eyes on occasion, we can't expect you to be magicians. I think we can only expect you to be the humans that you are, and as dedicated as you are. I know sometimes it gets frustrating that you hear from us as a collective board and individual board members, saying do more, but the old adage of continue to do more with less, I think, has been exhausted. So we just need to know what you need.
Will do. Thank you.
Okay. Any other comments? If not, then I'd bring us to the close of a fairly lengthy day, and I want to thank my colleagues for their patience. You might have voted for a different chair if you'd known what we got into the rest of the day, but at any rate, thank you for bearing with it, and thank you, Ann, and to all our staff. Flo, very much appreciated, and you've kept things going, you and DTEC and Cable 14 and all of your staff. So kudos to all. With that, everyone have a safe drive home, and sleep in for an extra few minutes tomorrow morning. You earned it all. So take care. Thank you. And we'll be back.
Good night, everybody.
Good night, everybody. Thanks.
Good night.
Bye.
We're adjourned.